that did not agree with a mandate of a vaccine that did not effectively stop the spread of an illness, created forged documents in order for others to live a somewhat normal life. These mandates did nothing but create additional criminal classes and should not be allowed to continue, as they do in our hospitals for our staff and employees. As other people come up today, you're going to hear stories of people losing their livelihood over the vaccines. You'll also hear stories of people being harmed by the vaccines. This is, again, many people will take this as a privacy issue, that with regards to vaccination, that they should not have to give up their information, and other people will take a stand on religious freedom, that because of the way that these vaccinations were created, that it is a moral conundrum that we all have to deal with. So with that, I will, if there's any questions, feel free, and otherwise, thank you.
Thanks, Rep. Any questions from committee members? Seeing none, thank you very much. Okay. Next, we have Jean Marie Van Wee. Jean Marie Van Wee, I believe, coming in virtually. All right, we'll try again later. Also virtually, Vanessa Fitzgerald. Vanessa Fitzgerald. All right. Next going, Michelle White, coming in virtually. Michelle White. In person, Julie Boris, Health Rights Mass. Julie Boris, great. Welcome.
Good morning. Thank you to the committee members. My name is Julie Boris. I am one of the co-founders of Health Rights Massachusetts. And while I strongly oppose all of the school-related vaccine bills being heard today, I'm here today to testify in support of H 2431, an act prohibiting the requirement of a COVID-19 vaccine, mRNA vaccine, or gene-altering therapy. This bill is critical to ensure the injustices of the COVID era can never happen again. Despite all of the information now available about the physical, emotional, and financial harms caused by the COVID countermeasures, nothing has changed. No meaningful action has been taken to rein in the sweeping powers granted to the governor and public health agencies by the Massachusetts legislature. This bill would protect Massachusetts residents from being forced to receive a COVID-19 vaccine, mRNA vaccine, or gene-altering procedure as a condition of entry into the Commonwealth, enrollment or attendance in school, entry to public buildings or businesses, access to employment, or entry to public accommodations, even in the event of a declared public health emergency. Over the past 5 years, we've continued to witness the devastation caused by COVID public health countermeasures. Many people lost jobs, careers cut short, retirement and pension accounts vanished, and educational opportunities denied, and so much injury and death from the liability-free COVID-19 injections, which we now know are contaminated with DNA plasmids and SV40 cancer-linked sequences. We have collected 252 stories from Massachusetts residents chronicling their vaccine injuries and job losses due to a government mandate to accept an experimental pharmaceutical product with no liability. Only time will tell, but the data shows these products could integrate with the human genome, and we have no idea of the ramifications this could have on future generations. Yet no one seems to be asking these questions. If we don't act now, this could easily happen again. How many shots are you willing to take? 5, 10, 20, 50, 100? At what point will you say no? And when the law fails to protect you and your family, what will you do then? There are several more mRNA vaccines in the pipeline. Just recently, the FDA approved Moderna's mNEX spike without a single placebo-controlled trial. Or would you rather just trust the Arcus Therapeutics' new self-amplifying mRNA COVID vaccine? Self-amplifying mRNA vaccines, what could possibly go wrong? I urge you to support H2431 to protect the people of Massachusetts from further harm and oppose all school vaccine bills. Thank you very much.
Thank you. Any questions from the committee?
I have one, sir. Thank you, Chair. I was just curious, are there still COVID mandates in place in Massachusetts?
I believe there are some. I know if you want to do clinicals, so if you want to go into nursing or be an EMT or medical school, you can actually do your entire program, but then if you want to do clinicals, you are mandated to get a COVID-19 vaccine in order to do those clinicals. And I believe there's also some private schools that are still mandating. Thank you. Thank you for your time.
Any other questions? Thank you.
Sorry. Thank you.
Next, we have John Bodoin Sr., Bodoin, and then on deck, so to speak, virtually, John Abramson. So if you're out there in the virtual land, you're up next, John Abramson. Before we get started, I just want to make sure, so there'll be no applause or outbursts of any kind, either in the pro or con. We need to get through a lot of people today. So I just ask everyone to be respectful and allow for testimony to continue to go forward. Mr. Bodoin.
Hi, thanks for having me. I live in Medfield. Name is John Bodwin Sr. I have a couple of books here I'm going to submit for the record. Medical examiners in Massachusetts, Janice Gravetti, Robert Welton, Julie Hall, Mindy Hall, Michelle Matthews, committed multiple federal felonies by committing fraud on death records. They said people died from COVID when they really died from blunt force trauma to the head, blunt force trauma to the torso, fentanyl overdose, and COVID vaccine. They certified a 7-year-old girl, Cassidy Baraka, as having died from COVID. 7-year-old girl right at that time died from COVID vaccine reacting in 5 minutes, vomiting for 8 to 10 hours. They gave her a second one a few weeks later. What's your name, Marjorie? What's over there? I'm talking here. You got any interest?
I'm going to ask you to keep your comments going. This is your time, so
yeah,
use it
okay.
wisely.
I'm using my time like I want to. Do you have any idea how many kids died? Thank you. So I don't know if Vargas is here, but let me tell you guys what's going to happen. You know, you're going to have this hearing and go do what you're going to do about vaccines. People are going to testify about all the death. I have the proof. It's in here. You guys are on record. You have a duty to the people, not the stockholders of pharma. And you know what's going to happen to Vargas? He lives in Haverhill. On the corner of Primrose Street, there's Angelo the florist, my godfather. I have 500 relatives in Haverhill. The Sarasolos, Pascucci's, Ferranti's, Pappalardos, Tebow's, Paquettes, Sullivan's, Browns. He's not going to be able to walk down the street without somebody saying, hey, Vargas, did you make the bill that killed the kids? Because the truth is coming out. How much time do I have left now? There's no clock in front of me. Well, I think I sent the message. If anybody wants to talk to me privately, I'm happy to do so. Nobody in the world has more individual private information than I do on COVID death. You got MGB in Massachusetts living off of pharma, killing people around the world. You have no idea. No idea. I have all the records. Go type my name into Rumble. You see 150 podcast videos come up. Millions of people around the world know me. Nobody in Massachusetts knows me. So when you return to your districts, if somebody comes up to you and says, hey, did you support the bill that killed kids? You'll have an answer. Yeah, I did. I did support the bill that kills kids. Hope you enjoyed your drink, Marjorie. Have a good day.
Any questions? Next, we have John Abramson, virtually.
Excuse me, Senator, just to clarify, it's Kyle, correct? Kyle Abrahamson? I don't think there's another, I hope there's not another John Abrahamson.
Sorry, you John Abramson?
My name's Kyle Abrahamson, so I just want to confirm that you weren't confusing me with somebody else.
Sir, why don't you go ahead? I think it's the same name.
Okay, perfect. Okay, appreciate it. Okay, so good day, Joint Committee on Public Health and everybody in the audience. My name is Kyle Abrahamson, Massachusetts parent and taxpayer, and I'm in opposition to bills H2554, S1557, and S1618 for eroding religious exemptions and parental rights. I'm a biomedical engineer by degree and experience, not a lawyer, but I'll do my best to give legal argument first. Legally, I oppose these bills for violating the U.S. Constitution, First Amendment, freedom of expression and religion, 14th Amendment, equal protection rights, and as well as Articles 2 and Part 2, Chapter 5, Section 2, also known as freedom of worship of the Massachusetts Constitution. H2554 and S1557 eliminate religious exemptions infringing on free exercise of religion by forcing me to choose between my faith and my child's education. Legal precedent favors my position, i.e. Fulton v. City of Philadelphia in 2021. S1618 undermines parental rights by allowing minors consent to vaccinations and scrutinizing religious beliefs while favoring medical exemptions. Legal precedent favors my position, i.e. Troxel v. Granville 2000. Now I'll get a little personal. Parents have a sacred bond to their children. Parents persevere through sleepless nights, countless diaper changes, temper tantrums, many, many other things. During these times, a parent's faith and patience are tested. My faith gave me the strength to be a better person and parent. No medical professional, state representative, state senator, or anybody was there for my child during all those times. But I was there with my faith. And of course, my spouse. However, my point is parents, not the state, nor any medical professional or anybody else, but parents are the paramount advocates for their own children. If H2554, S1557, and S1618 move forward, the state is taking away parents' faith and forcing parents to put their faith in them, i.e. the state. These bills are suppression of individual freedoms I described before, translation, tyrannical overreach. Bills H2554, S1557, and S1618 undermine religious freedom and parental authority, hence should be rejected by the committee to prevent tyrannical overreach. And thank you very much for listening to my testimony, and I yield my time. Appreciate it. Thank you.
Thank you. Any questions from the committee? Seeing none.
Thank you.
Rebecca Salamone, virtually. Rebecca Salamone. Robin Markowski, virtually. Robin Markowski. Fern Henley, virtually. Fern Henley. Isabel Howard, virtually. Isabel Howard. Mike Danubio. Mike Danubio, virtually. Shara Daniels, virtually. Shara Daniels. All right. Jennifer Mallert, virtually. Jennifer Mallert. Brianna Fairburn. Oh, sorry, go ahead.
Jennifer Mallert here.
Please go ahead. Thank you.
Good morning. My name is Jennifer Mallard, and I'm a resident of Oxford, Massachusetts. I'm here to oppose Bill S-1618, an act of promoting community immunity, Bill S-1557, an act relative to vaccines and preventing future disease outbreaks, and Bill H-2554, an act relative to routine childhood immunizations. Massachusetts does not have a vaccine problem. It actually leads the nation in vaccination rates. There have been no outbreaks of preventable diseases in school-aged children in over a decade in the state. Allowing minors to consent to preventative medical treatments without parental involvement does not allow any safeguards for the understanding of both benefits and risks of treatments, as their brains are not fully developed. This is a reason that minors cannot drive, vote, enlist in the military, and drink. Their underdeveloped brains do not provide the ability to see the future consequences of any decisions that they make as children. These bills are discriminatory against a small minority of families in the state who have very strong held religious beliefs. As a parent, it is my responsibility to work with my child's physician, not the government, not schools, nobody but myself and my child's physician, to make the best decision based upon their health history. There is also already an exclusionary protocol in Massachusetts for students who have medical and religious exemptions. There is no need to further exclude these children from education due to religious and medical exemptions for vaccines that are not proven to assist or help anything. I am in support of Bill H-2541 and S-347, an act relative to the protection of medical exemptions for immunization for school attendance. Thank you for your time.
Thank you. Again, please, if we could keep the no noises, pro or con, okay, so we can keep things moving. Any questions from the committee? No questions. Thank you, Jennifer. Brianna Fairburn, virtually, Brianna Fairburn. Deborah Bell, virtually, Deborah Bell. Barbara Esposito, virtually. Barbara Esposito. In person, Sharon Santolo. Sharon Santolo. And then in person, Stephen Gamelli, Massachusetts Fraternal Directors, Associate First Vice President. Is Sharon here?
Well, I just don't know if it's a misspelling of, my name is Shannon Snowden, but I don't know if that's something.
No, we'll come back. We'll come back. Stephen Gamelli, Massachusetts Fraternal Directors Association. Thank you.
Chairpersons Decker, Driscoll, and members of the Joint Committee on Public Health, good morning. My name is Stephen Gemelli, and I serve as the first Vice President of the Massachusetts Funeral Directors Association. I'm also a licensed funeral director at Mercadante Funeral Home in Worcester, Massachusetts. I appreciate this opportunity to testify today in support of House Bill number 2463, an act relative to the proper classification of healthcare workers during a public health emergency. This legislation would classify funeral directors as public health workers, enabling them to receive vaccination priority during a public health crisis. While we have already submitted written testimony for your review, I felt it was important to come before you personally to provide further insight into why this bill is crucial for both my professional colleagues and the broader public health system. During a public health crisis, funeral directors serve a critical function. Funeral directors are the first responders and end-of-life healthcare workers 100% of the time when a resident of the Commonwealth dies. Funeral workers qualify for vaccine priority because we are knowingly infection-facing and working in infection-positive environments. We meet the definition used by the Massachusetts Department of Public Health for those who qualify for vaccination in Phase 1 during the COVID-19 pandemic. Quote, persons serving in the healthcare setting who have the potential for direct or indirect exposure to patients or infectious materials, including bodily substances, contaminated medical supplies, devices, equipment, contaminated surfaces, or contaminated air, close quote. Funeral directors enter hospitals and other healthcare facilities across the Commonwealth to transfer deceased patients into the care of the funeral home. Funeral workers respond quickly to nursing homes and long-term care facilities, transferring the deceased residents from restricted areas, designated floors, and multiple bed units. They often enter places where residents are acutely ill and are not wearing face masks. Funeral workers also enter private homes or hospice facilities and spend time there preparing the deceased for transfer into care. Funeral workers meet with grieving family members, many of whom cared for the deceased, as they identify and view their loved one and make the final arrangements. We estimate that around 1,900 individuals are currently classified as funeral workers. They face exposure to infectious remains and waste in their daily duties and public-facing responsibilities. We recognize during public health emergency, government officials face an incredible number of critical decisions. That is why it's crucial to enshrine this protection for our unique workforce in statute before the next crisis. We encourage you to support House Bill number 2463 with an ought-to-pass report. Thank you.
Thank you. Any questions from the committee? Thank you, sir.
Thank you.
Next, in person, Mary Beth Mioto. Welcome.
Thank you. Good morning. My name is Dr. Mary Beth Mioto. I'm a pediatrician at Mattapan Community Health Center. I'm testifying for the Massachusetts chapter of the American Academy of Pediatrics, where I'm immediate past president, as well as the Massachusetts Medical Society, where I co-chair the Committee on Student Health. We urge you to eliminate the non-medical exemption loophole for school vaccinations by passing House 2554 and Senate 1557. 30 years ago, I held the hand of a month-old infant hospitalized with whooping cough. People are surprised that little babies with pertussis don't whoop. They instead stop breathing. This baby was too young to be vaccinated. He needed the children and adults around him to create a cocoon of immunity. I held his hand as he died. Just as I've cared for children who couldn't breathe because of pneumococcal disease or lost their hearing from Hib infection, that is my why. You'll hear that Massachusetts leads the nation in statewide immunization rates. Yes, but local data shows rising exemption rates and dropping vaccine rates. DPH vaccination data shows me that 5 of our 14 counties fell below the 95% immunization threshold needed to prevent measles in Massachusetts. 163 kindergartens across the state didn't meet that threshold. Both this
Want this here to be respectful. If there are outbursts, we're going to ask you to leave.
Thank you. Both the spread of infections and vaccine protection are like real estate. It's all local. High immunization rates in Southborough won't help Northborough families if our school rates are low. In the kindergarten my 28-year-old child had attended, MMR rates dropped from 100% to 88% in the past 3 years. Exemptions jumped to 12%. My youngest son, his prior kindergarten, doesn't report at all. This is our Massachusetts story. Let's address the elephant in the room, measles. In the past 5 months, the U.S. has nearly matched the 12-month measles case count from 2019. Non-medical exemption loopholes around the country allowed preventable diseases to gain a foothold. Our neighboring states of Connecticut, New York, and Maine closed religious exemption loopholes and now have stronger vaccine rates and fewer infectious outbreaks. Those seeking exemptions moved to Massachusetts. I don't want measles in Massachusetts. We know what we must do to protect every community and every child. By eliminating non-medical exemptions and improving reporting, we'll stop a preventable disease in its tracks. No hospitalizations, no missed schools, no needless deaths. We know how to do it because we've done it before. I'll continue to partner with families, the most important people. Some have reservations about vaccines, often based on rampant misinformation of our times. But some parents choose to not discuss their fears when they can more easily choose an exemption. Please take decisive action to eliminate non-medical exemptions. Thank you all.
Thank you. Any questions from the committee? Thank you.
Thank you.
Next, we have Senator Roush. Thank you.
Can you see this?
Welcome.
Good morning, Mr. Chair, Madam Chair, members of the committee. Thank you for taking me out of turn. I'm here to testify in support of my bill, the Community Immunity Act. As you all know, we are more than 5 years past the onset of COVID, and yet we still have not passed into law comprehensive infectious disease prevention legislation. That is a shameful stain on this body. Every year that passes without this public health infrastructure bill becoming law is a gross abdication of our sworn responsibilities to our constituents. And the risks are ever growing with a known anti-vaxxer sitting at the helm of the United States Department of Health and Human Services, and someone who nearly did wreak havoc during the COVID pandemic, sitting again in the Oval Office. Kids in other states are literally dying from measles. We have measles here in Massachusetts, reported confirmed cases in the last couple of years. What exactly are we waiting for? More measles cases in Massachusetts? Our own young constituents to die from vaccine-preventable illnesses? The problems that we have in Massachusetts are crystal clear in the packets in front of you and the posters right here. Due to our Swiss cheese statutory scheme, our statewide data set on vaccination rates in schools and childcares across the country is a measly 69% complete. That's a D letter grade. Does anyone really think that a D is good enough, especially in this moment? Hundreds of school-based communities lack sufficient protection against vaccine-preventable diseases like measles, whooping cough, even polio, as you can see from this chart here. Hundreds more schools are utterly failing to meet even the minimum statutory requirements now, with an abnormally high gap population rate or no student records on vaccinations whatsoever. These are statutory infrastructure problems, and they require a statutory infrastructure solution. That is what the Community Immunity Act does. This bill will support student health through medically accurate information delivery, improve public health by plugging up the gaping holes in our data sets, generate consistency between medical and religious exemption protocols, alleviate additional burdens wrongly placed on the shoulders of our teachers and our child care providers for implementing public health protocols by instead centralizing vaccine exemption management, engaging communities at elevated risks of infection and outbreaks, empowering parents and caregivers to make more informed decisions about where they send their kids, And this bill will remove the utterly ridiculous current reality that a cocktail napkin smeared with peanut butter constituted an acceptable vaccination exemption submission. There is more about the content of your bill in your section-by-section packets, which is again in front of you. Other legislation on today's docket that would strike the religious exemption in its entirety, you have before you, but there is a significant legal question as to whether we could do that within the confines of our state constitution. In fact, the SJC issued a decision alluding to this uncertainty just a few weeks ago. We cannot risk losing every bit of sorely needed infectious disease prevention infrastructure by including a constitutionally questionable provision. Are you willing to risk the health and safety of our Commonwealth's children and immunocompromised residents? What about your own families? Are you willing to take the legal risk and simultaneously continue to put them in harm's way? I'm not. We should pass into law the components we know we need and we know are resoundingly within our power to enact. That is the Community Immunity Act. As many of you already know from your prior service on this committee or from hearing prior instances of this hearing, you are going to hear lies all day long. You will hear lies about science. You will hear lies about fact. You will hear lies about existing law. You will hear lies about the contents of this bill. You will probably even hear lies and slander about me personally. Do not let a small minority, however loud, generate what the United States Supreme Court called a, quote, spectacle of the welfare and safety of the entire population. Do not continue to subordinate the needs and, frankly, the expectations of the many to the misinformed rants of the few. I urge this committee to issue a swift, favorable report on the Community Immunity Act so we can move this bill all the way across the finish line into law this year. Thank you very much for your consideration. I'm happy to take any questions.
Thank you, Senator. Any questions from committee members?
Thank you, Senator Rush. I didn't get your packet, and this is the first time on this committee, so I apologize if I'm not well read, so hopefully you can answer it. I just have two quick questions. Under to allow a minor to consent to preventative care, I guess it's section 6.7. I guess my question is, who pays the insurance or financial cost if there are complications by that minor's decision?
I'm sorry, who pays the cost if there are health complications following a vaccine?
Correct. If no, not a vaccine, if a minor makes one of those decisions. I think it said consent to preventative care, so if a minor in your bill goes without parents' permission, and there's a complication, who pays that financial burden? Is it insurance? Is it people's insurance? Is it the doctor? I just would like to know.
This bill doesn't change anything in the existing frameworks of how healthcare is covered from an insurance perspective.
Okay. So, no, sorry. I was just thinking, like, some people are on insurance plans that you have to pay $4,000 or $5,000 before they start, helping out, and that could be something that's detrimental to some people. Secondly, one last thing, I kind of heard what you said, and I agreed, like centralizing with the DPH and an immunization exemption acknowledgement letter. I understand, I think what we're trying to do is when these immunization acknowledgement letters by DPH is for tracking purposes, but does that kind of add like an extra layer to all this? Like, is that getting in the way? I'm just trying to, like, sometimes I know a lot of people complain about insurance getting in the way of people trying to get care or trying to get something done. So I don't know if that does it, if there's a way to streamline that, make that quicker or easier.
Yeah, I appreciate the question, Representative. It doesn't add an extra burden. What it does is take the response, here, let me back up. This is a map of all the K-12 schools from the 2023-24 school year, right? Every X you see on this map, and these are in your packets, right? And there are color copies, right? So it was easier to see in color. I think, did they have color? They do have color. You do have color copies. Thank you to the business office. Every X that you see on this map is a school or a school, because this is just K-12, that did not report any data at all to the Department of Public Health. Now, a lot of schools might have school nurses. A lot of schools might not have school nurses, right? The problem is that the responsibility, the onus for dealing with the management of vaccination protocols is falling on our already overburdened school teachers, childcare providers, and colleges, most of whom are not public health experts. So it makes much more sense logistically to shift that to the public health folks at the Department of Public Health, right? And get standardization across the Commonwealth. That's the other thing with this, the bigger the circle, by the way, the bigger the dot, the bigger the problem, right? The higher the risk. And you can see on this map where the X's and the big circles overlap, right? That's why maps are so important. Because they allow us to visualize the data, right? So when you have high rates of under or unimmunized children, and you also have a whole bunch of schools about which you have no idea what's going on in there, the risk increases significantly, right? And that is particularly problematic for students who are immunocompromised, for faculty who are immunocompromised, for people in the community who are immunocompromised, right? Measles doesn't know town borders or even county borders or state borders. Measles goes where it goes. So it's about generating consistency in the implementation of the law, right? Because when we leave it to every single school and every single childcare and every single college to implement on their own, we lose that consistency. And if you speak with the folks who are working on the grounds in the schools, they'll tell you the same thing, right? They'll say it's different here and it's different there, and because everyone's got different staffing and different people and different management, they have different approaches. We need it to be consistent, right? Because that's how public health works, because that's how infectious diseases work. So we need it to be consistent, and that's why the bill proffers what it does, a standardized and centralized system for managing both medical and religious exemptions within the public school system. Thank you.
Yes.
So I may have missed this, and I don't know if it's in the packet, but you mentioned, or you made some reference to about a legal question on whether we can strike the religious exemption. Is that information in the packet, or can you
that is probably not in your packet because it's just a very recent SJC decision that just came out a few weeks ago. But I've spent much of the last week reviewing this case law that's come both from the United States Supreme Court and from the SJC here in Massachusetts. And there's a whole string of cases starting pretty much back at the beginning of the 20th century in 1904 with Jacobson versus Massachusetts, and running all the way through just a couple of weeks ago, May 15th, in the case entitled Care and Protection of Eve. And I'm happy to provide a link to that slip opinion to the committee once I get back to my office. But that decision, especially when you take them, well, let me talk about this Care and Protection of Eve, has some very, very sad family circumstances. The child was taken into temporary DCF custody. And the SJC held that DCF cannot vaccinate that child against the parent's religious beliefs. And that is what the SJC just held. And they relied in that holding on our state law in existence now with the religious exemption in place. So particularly when you take a look at Jacobson and Daly versus Board of Education, which is a Massachusetts SJC decision from 1971, and this most recent decision, you take this whole totality of the cases, you have to view them all together, right? And we have before us two competing constitutional rights. In Massachusetts, we have a constitutional right to equal access to public education, as crafted and construed specifically here in Massachusetts, which is unique from other states. And we have another constitutionally protected right, which is the free exercise of religion. And they have to be balanced. And you see in the court decisions that the justices are trying to balance those, right? And when you take the cases all together, it's about as clear as mud as to whether, in the absence of a public health emergency or a pandemic or some other significant risk, it would be constitutional for us to strike the religious exemption in its entirety, particularly after it's been around for 50 years. Now, that doesn't mean that we can't take infrastructural measures to make sure that we have statewide consistency and streamlining and strong infrastructure so that there are no more X's on this map. We can do that. We absolutely can do that, and we should. And that is what the Community Immunity Act does. We can and should make sure that those numbers over there in the polio column go to zero, right? We have 32 early education centers in Massachusetts. The map is from 2023-24. This is the most recently available data from DPH, from the school year that's ending right now, right? 32 early education centers that lack herd immunity against polio, and 9 kindergartens. There are infrastructure steps that we can and should take to ensure that we are doing everything we can possibly do to get those numbers down to zero, right? Nearly half of our colleges lack herd immunity against pertussis. Nearly half. There are infrastructure pieces that we can and should take in order to improve our data, improve our education, improve our outreach, that don't run the risk, the legal risk, that we can do. Yes, sorry, thank you very much for the question.
And I'm just going to remind my colleagues that we always can have the opportunity to speak to the senator. There's a lot of folks here who want to talk today, and we're not going to get to them given they've reorganized how this hearing's happening this year. So quickly, I will just say that I believe the ruling you're talking about actually only refers to children in DCF custody at the moment, is our understanding of that. So I think we should be clear that that's what the ruling says. But I'm happy to have more conversations with you later. I would just like to make sure we can get to the public who have less access to us than we do to each other, so we can keep moving on.
Understood, Madam Chair. I do think the difference is significant, right? That even a child in DCF custody couldn't be vaccinated against the parent's religious beliefs, which is a distinction between, and I think a readily accessible distinction, and I'm happy to have conversations subsequent to today as we consider these bills, as to kids going in and out of public school, right? That's not private school, that's different, but public school, kids come in and out, it's a different situation than a custodial situation.
Any other questions? Thank you, Senator.
Thank you, Mr. Chair, Madam Chair, members of the committee.
Next, Ryan Howarth in person. Ryan Howarth. Cynthia Bajorley, MD. Cynthia, welcome. Thanks.
My name is Cynthia Bierley. I'm a retired primary care doctor from Gloucester. I am also a delegate of the Mass Medical Society. Children are getting massive amounts of routine vaccinations, and the long-term effects are not known. There is reason to believe that harm is being done. You may say that vaccines are good and saving lives, and the experts are not concerned. Who are the experts? Here are some examples. This is from the Cleveland Clinic Journal of Medicine. It's by Dr. Goji, who's from Merck Pharmaceuticals, and he tells us that he and Merck are paving the way for a resilient future anchored in vaccination. The next one is from the New England Journal of Medicine, and this is from Pfizer. And the conclusion is that Pfizer's COVID vaccine is safe and immunogenic. The next one is also from the New England Journal of Medicine, and this is by Moderna. And this concludes that overall, the benefit of Moderna's COVID vaccine, the overall benefit risk profile was favorable in adolescents. Here is a list of vaccines that children are routinely getting. This is the CDC recommendation for all healthy children. There are a total of more than 65 doses from birth to age 18. This list has increased since 1962. Since then, the rates of immune-related diseases have also increased exponentially. This is asthma, doubled. Food allergies, doubled. Eczema increased 2 to 3-fold. In 2013, the National Institute of Medicine independently studied the issue of the safety of the childhood immunization schedule, and here is part of what they concluded. The committee found no significant evidence to imply that the recommended immunization schedule is not safe. Those words have been quoted extensively as assuring the safety of the vaccine schedule, but that is not what they concluded. They concluded, in your packet, that they could not make a firm conclusion. Let us discuss just 2 of the recommended vaccines, influenza and hepatitis B. Hepatitis B is a viral disease that is transmitted via bodily fluids. In a child born to a non-infected mother, the chance of hepatitis B before puberty is ultra rare.
Doctor, if you could just wrap, and then you can also submit additional testimony too.
Right.
Okay?
Excuse me, why are you
Excuse me.
cutting
Someone
short? You're cutting
mute the
short
microphone,
this lady,
please.
but you didn't cut short other folks who went over 3
Mute the
minutes.
microphone, please.
I'd like to say I'm almost finished.
Yeah, if you could just wrap up, and then you can
Okay.
always submit additional testimony.
All
Thank
right.
you.
In a child born to a non-infected mother, the chance of hepatitis B before puberty is ultra rare. Why are we giving hepatitis B vaccines starting at birth? Influenza is a virus that usually causes a self-limited disease. Complications increase with age. 99.9% of children who get the flu recover without incident. We are told that a rationale for the flu vaccine is to protect people at risk from exposure. If little Johnny gets the flu, he might give it to his frail grandmother. Why not just give the flu vaccine to his grandmother? Why are we giving flu vaccines to every healthy child every year for life, starting at age 1? It is my opinion that doctors are beginning to recognize that we are over-vaccinating healthy people to the detriment of their health. I ask that you strongly vote against Bills 1557, 1618, and 2554. State interference and increased regulation will only further confuse and divide. Thank you.
Thank you. Any questions? There we go. Next, we have Angela Beeler in person. Angela Beeler. Brenda Anders Pring, MD. Brenda Anders Pring.
Hi, hello. I'm on.
Welcome.
Remote. Hi,
Yes.
thank you. I'm Brenda Anders Pring, a pediatrician in Boston, president of the Massachusetts chapter of the American Academy of Pediatrics. The Mass chapter represents over 1,600 pediatricians and advocates on behalf of infants, children, adolescents, young adults, and their families. I'm speaking in support of H2554 and S1557, identical bills that would eliminate the non-medical exemptions to immunization for school entry. This is an important issue to me, which is why I'm joining you from where I am working, seeing patients today, and could not be there in person. I want to tell you a story about how this would have a positive impact. This legislation would have a positive impact on a patient of mine. I will call her Sophie. When Sophie was 4 years old, she developed a rare autoimmune disease where her body was attacking her blood vessels, impacting her ability to breathe and walk. While there is no current cure for her disease, she is lucky enough to have an infusion treatment that stops her cells from attacking her blood vessels. But that same treatment also blocks her immune cells from working. For Sophie, her survival depends on infrequent infusions, and even though she has had all of her routine childhood immunizations, including measles, her immune system is not sufficient to protect her. She needs all of those around her to be vaccinated so she can be as healthy as possible. Sophie should be able to attend kindergarten without worrying about contracting measles or any other preventable disease from her classmates. This measles outbreak is happening in Texas and Canada, is the worst in the US in over 20 years, resulting in the death of 3 unvaccinated children. While traditionally we have felt very safe in Massachusetts from measles and other preventable diseases, We are now seeing drops in levels of herd immunity, and an outbreak in the Commonwealth could be only a flight away. In these times, we cannot rely on Washington to contain a deadly virus. Our neighbors in Maine, Connecticut, and New York, which have recently had laws eliminating non-medical exemptions for school entry. We should also eliminate this loophole and ensure we are not a destination for those avoiding the health policies of our neighbors. On behalf of children, my patients, our families, and pediatricians, please act favorably and quickly on H2554 and S1557. We don't want measles in Massachusetts. Thank you.
Thank you. Any questions from the committee? Seeing none, thank you. Gregory Campbell, virtually. Gregory Campbell. Micah Mortali, virtually.
Sorry, I'm here. It just took me a second to sign on.
Go ahead, Mr. Campbell.
Thank you. Good morning. My name is Dr. Gregory Campbell. I'm a board certified in both pediatrics and internal medicine. I'm a primary care physician practicing at a community health center in Springfield, Massachusetts. I'm testifying today in strong support of S1557 and H2554, which remove non-medical exemptions from the vaccine requirements for children entering school in Massachusetts. I practiced in Springfield, which in recent years had the dubious honor of being the asthma capital of the country. The elementary school in the neighborhood I work in, it's actually across the street, backs onto I-91. So it's no wonder that so many children in my practice have asthma. Some of them, their asthma is so severe that they're on medications that suppress their immune system in order to control the inflammation in their lungs. These are life-saving medications, but at the same time put people at increased risk of infections. Despite being up to date on their own immunizations, these children are at increased risk of severe illness should they contract varicella, measles, the flu, COVID. Herd immunity protects the most vulnerable members of a group, because if enough people are immune to a disease, then there are not enough susceptible hosts for that disease to spread. For measles, which has unfortunately been in the news lately, that herd immunity requires at least 95% of the population to be immunized. Schools in Massachusetts vary wildly, with the DPH reporting the current kindergarten class at many schools reaching 100% of incoming students, others under 80%, with many exempt from the reporting requirements entirely. A classroom where less than 80% of children are immunized against these serious illnesses will not protect students like my patients with severe asthma. This is why I'm asking you to support S1557 and H2554, which will ensure that all children who can safely receive the standard schedule of vaccines do so, in order to protect the most vulnerable children and enable them to access public education without fear of devastating infections. Thank you very much.
Thank you, Doctor. Any questions from the committee? Seeing none, thank you. Micah Mortali, virtually. Micah. Danielle Stevens. Danielle Stevens, virtually. Sorry if I pronounce this next name wrong. Hype Vo. H-I-E-P Vo, V-O, virtually. In person, Angela Bueller. Angela Bueller. In person, Cynthia.
Dr. Beeler was there this afternoon, planning on coming, and said she could arrive after 1:30.
We'll circle back. Katie Blair, in person, Massachusetts Families for Vaccines. Katie Blair. Thank you. Welcome.
Thank you. Hello, and thank you to the Joint Committee for holding this hearing. My name is Katie Blair, and I'm the Director of Massachusetts Families for Vaccines. I'm here today to speak in favor of H2554 and S1557, an important set of bills that, if passed, would add Massachusetts to the list of states that have eliminated non-medical school vaccine exemptions. I have supported eliminating the exemption for many years out of concern for the infants, children, and adults in Massachusetts who are medically unable to be vaccinated and thus depend on the herd immunity created by others in their community who vaccinate themselves and their children. This issue became more personal for me than ever this year when I learned that I was pregnant. I'm expecting my first child, a baby girl, in September. Although she will have some benefit from my antibodies for a while, she will be unable to receive most vaccinations herself for several months. My husband and I will protect her from exposure to illness as much as we possibly can, but we will still need to bring her out into the world occasionally, such as for pediatrician visits. When we do so, we will be relying on our neighbors to be responsible and do their part to prevent the spread of contagious diseases and protect people like my daughter. This is an especially anxiety-inducing time to be expecting a new baby, given that there is an active measles outbreak quickly spreading around the country, and a federal administration that has made its skepticism of sound vaccine science clear. Massachusetts has a high immunization rate overall, but there are many pockets of the state where rates are lower, which could lead to an outbreak here. I have spent the last several weeks combing through the most recent kindergarten immunization data and noted that 164 schools report MMR immunization rates lower than the 95% recommended to prevent measles outbreaks. Perhaps even more concerning, 494 schools, over a third of the schools that I looked at, do not report immunization data at all, meaning that we have no idea how well protected their students are from outbreaks. 3 of our Northeast neighbors, Connecticut, Maine, and New York, have eliminated their non-medical vaccine exemptions in recent years. They have seen subsequent improvements in immunization rates, increasing the herd immunity protection that their most medically vulnerable residents depend upon. It's time for Massachusetts to do the same. I also wanted to note that shortly after the New York exemption was eliminated, I read an article that quoted a vaccine-hesitant parent from New York who was considering a move across the border to the Berkshires so that she could continue to exempt her healthy children from vaccine requirements. I am proud of Massachusetts' reputation as a center of academia and healthcare innovation, and I certainly do not want to see it become a haven for vaccine opponents. The Joint Committee has twice advanced the same bill favorably out of committee, and I urge you to do so again, now that the national landscape for public health makes it more important than ever that we enact strong vaccine requirements for our schools. Thank you very much for your work improving public health in Massachusetts and for your attention to this important issue.
Thank you. Any questions from the committee members? Yes.
I'm sorry, I don't know if you're the right person to ask this questions to. I've been hearing a lot about the vaccination rate for Massachusetts. I'm wondering, is that just based on school data?
Yeah, so what I was looking at was the, like DPH puts out a report of like all the kindergarten, it includes the exemption rate and like what they report for MMR immunization. A lot of schools have either like an asterisk or a little like cross symbol if they don't report it.
All right, because one of the concerns I have is I actually have a child of mine that's starting med school, and they had her tested for her titers, and she was vaccinated for varicella and hepatitis B probably 14 or 15 years ago, and to her surprise, she no longer has titers for it, so she has no immunity. So one of the things I'm concerned with here is we might have wide swaths of Massachusetts population that thinks they're vaccinated and they're not. So is that like another issue? Like, how do you contend with that? Like, if we're relying on other people for that, but they might not have the immunity they think of, like, how do we justify that? And again, I appreciate it because as a parent myself, those are things you think about when you're taking your child around and they're young and trying to protect them. But I don't know if we're protected as we think we are, and I don't know if this data that we keep talking about is as good as we think it is. So if you can't speak to that, that's fine. But like I said, I just keep hearing this data, and in my mind, I sit there and I'm like, is it accurate?
Yeah, so I want to say I'm not a doctor or a medical professional, but I do think that's actually a reason why we need to keep our vaccination rates as high as possible by getting rid of things like the religious exemption. Because vaccines are wonderful. They're a public health miracle. They're amazing, but they don't work 100% of the time. So if you get a vaccine and you think you're covered, but maybe it didn't take on you, that's all the more reason why you need to have good herd immunity around you to protect you.
Thank you very much.
Thank you.
Eric Schneider, in person. Eric, welcome.
Dear honorable members of the Joint Committee on Public Health, my name is Eric Schneider. I'm a parent of 3 fully vaccinated children in the Swampscott Public Schools. I am here today to express my support for S1557 and H2554. These bills are not just important for public health reasons, but they are also a step to bring us back to the basics of what it means to be part of a civil society. America is the land of the free, but freedom is neither free nor is it unlimited. The fundamental compromise of any civil society is an agreement that each of us gives up certain rights and freedoms to live in a just, peaceful, and healthy society. Our individual freedoms end when they encroach on the life, liberty, and happiness of other people, whether they are friends, neighbors, or strangers. Unlimited personal liberty to do what you want, when you want, regardless of who or what it might affect, leads to the opposite of civil society. It will result in anarchy. That fundamental compromise is under threat. In recent years, some people have demanded exemptions from society's rules to do as they please under a claim of religious freedom and individual liberty. But they neglect to account for or consider how their demands for individual freedom infringe on everyone else's freedom and imposes burdens on our communities and our Commonwealth. In other words, they are privatizing the benefits but socializing the cost of individual liberty. You might wonder, how is this applicable to the non-medical vaccine exemptions? A deliberate choice to not vaccinate a child under a claim of individual liberty or religious freedom imposes health risks and health costs on the rest of us, and as a result infringes on the life, liberty, and happiness of all of us. Our vaccines are safe and effective. Life expectancy has nearly doubled since the American Revolution, in large part because child mortality has plummeted. This is due to medical advancement, but also vaccine requirements and many other public health laws and regulations. Vaccinated children are less likely to become sick and miss school. Even if they become infected, their symptoms are less severe and require less medical interventions. Unvaccinated children are not protected from those viruses, are at a higher risk to contract these diseases with more severe symptoms. They are more likely to require specialized medical resources and expensive medical treatments. Unvaccinated children are also more likely to spread diseases to immunocompromised children and seniors. The higher costs unvaccinated children generate are borne by all of us. These costs are imposed on our community in the form of higher insurance premiums, longer wait times at medical offices and hospitals, and strained medical resources. The unfortunate part is all those additional costs are easily preventable if only all children were fully vaccinated. For that reason, I support the passage of S1557 and H2554. Thank you for your time.
Thank you. Any questions from the committee? Thank you. Next, we have Matt Mata in person. Matt Mata, welcome.
So, members of the Massachusetts Joint Committee on Public Health, thanks so much for inviting me to speak today in support of S1557 and H2554. I'm Dr. Matt Mata. I'm an assistant professor in the Department of Health Law, Policy, and Management at the Boston University School of Public Health. And as an expert in the study of vaccine hesitancy and its public health consequences, I believe that passing this legislation into law will have an important impact on public health in the Bay State. And here's why. This legislation eliminates parents' abilities to request religious exemptions for vaccination for their children. If enacted, this legislation would promote public health by encouraging vaccine uptake against vaccine-preventable diseases. Our research shows that many Americans hold at least some level of skepticism about the safety and efficacy of vaccinating their children prior to entering public schools. And those who do are more likely to forego or delay vaccinating by seeking non-medical exemptions, such as the religious exemptions that we're talking about today. Public health researchers have found that the prevalence of non-medical exemptions in schools is linked to lower vaccination rates and, in turn, the increased incidence of vaccine-preventable diseases. And that's not just a problem in Texas, where an unvaccinated child recently died of a measles infection. That's something we need to worry about right here in Massachusetts. In a peer-reviewed paper that my colleagues and I recently published, we found that school districts in states that allow for non-medical exemptions have tended to experience lower levels of vaccine uptake since the onset of the COVID-19 pandemic. And that's true right here in Massachusetts, where 85% of kindergartens had an MMR vaccine uptake rate in excess of 95% prior to the start of COVID-19, compared to 82% following. That may seem like a small change, but 95% of people living in a particular area need to be immunized against measles in order to prevent its transmission. Luckily, more than 98% of Massachusetts children have received the MMR vaccine, roughly, but that's a statewide estimate. That's not necessarily the case everywhere. Some school districts report far lower levels. Ending religious vaccine exemptions protects all of us here in the Bay State by promoting childhood vaccine uptake. Now, let me be clear. Every serious public health expert believes that there are some people who should not have to vaccinate. Children at risk of serious vaccine-related complications due to underlying medical conditions ought to be able to receive exemptions. But what this legislation does is especially important for those people who cannot, for medical reasons, be immunized. These Bay Staters depend on all of us who are able to vaccinate to do so in order to keep them safe from infectious disease. That's what this legislation will allow us to do by ending religious vaccine exemptions, and I'm here to strongly support both pieces of legislation. Thank you.
Thank you. Any questions from the committee? Thank you very much. Next, virtually, Paul Grenier. Paul Grenier. Virtually, Jeannie Monahan, or Jean Monahan. Jeannie Monahan. Virtually, Ricard Moriarty.
In person.
Oh, welcome.
Thank you. My name is Dr. Richard Moriarty, retired pediatric infectious disease specialist. I'm here to urge you to support S1557 and S2554 on behalf of the Mass chapter of the American Academy of Pediatrics and Mass Families for Vaccines. We haven't had to fear outbreaks of polio and measles because of vaccines. We've had good immunization coverage in Massachusetts thanks to our requirements for school, and our state legislature has supported those. But things have changed with anti-vaccine misinformation flooding social media. School immunization rates are down across the country. Bills in state legislatures are aiming to weaken or end school requirements for vaccines. We now see what happens when school immunization rates drop. 2,000 people sickened so far across the country from measles. 3 kids have died from measles. Nearly 9,000 people have been sickened by whooping cough this year, and 3 youngsters have died. We must maintain and improve our level of immunization to protect against these diseases. Immunizing children keeps them healthy and in school where they belong. Measles is an awful disease with dangerous complications and side effects. With cuts in healthcare funding, how are we going to pay if there are outbreaks? Outbreaks are very expensive. Measles is so infectious, we need 95% of a population immunized to prevent an outbreak. We thought our schools were good in Massachusetts, but if you take a deep dive into them, 119 kindergartens have MMR rates less than 90%. 31 schools are below 80% in Massachusetts. 19% of our schools didn't even bother to report their immunization rates this year, and 24% report their rates only on rolling 3-year averages. These bills would make schools require schools to report their immunization rates every year. These bills would also eliminate non-medical exemption. No major religion preaches against vaccines. Most religions endorse vaccines as life-saving. 90% of our kindergarten exemptions are religious, and the number of religious exemptions are 7.5 times higher than they were 40 years ago, even as church attendance has fallen across the country. A religious exemption is a placeholder or a loophole for medical or personal belief exemptions. There are 3 Supreme Court decisions that you might take a look at, and if I can read one of them, and I'll quote this directly from a Supreme Court decision in 1944, the right to practice religion freely does not include the liberty to expose community or child to communicable diseases or the latter to ill health or death.
Thank you, Doctor.
Thank you very much.
Thank you. Any questions? Yes. Senator Dooner?
Thank you, Mr. Chair. The statistic of church attendance has fallen. Could you just tell me where you got that from?
I'm sorry.
The statistic of church attendance has fallen. Could you just tell me where you got that from?
Several sources online that showed how.
Do you know the sources? Just I wanted to
not
check.
off the top of my head, I don't, but I can get those for you.
Thank you.
Thank you. Any other questions from the committee? Thank you, Doctor.
Thank you.
Next, we have Ashley Wyshak, virtually. Ashley Wyshak. Hital Marble, virtually. In person, Keith Erickson. Keith, welcome.
Members of the committee, thank you for having me. My name is Keith Marzulli Erickson. I am a health economist, a professor at Boston University, co-editor of the Journal of Public Economics, former co-editor of the American Journal of Health Economics, and I am testifying in my personal capacity today, and my views do not reflect the official policy or position of any of these organizations. I speak in support of Bill H-2554 and S-1567, bills that would eliminate the non-medical exemption. Childhood vaccine requirements exist in part because vaccines have what economists call externalities. Those who get a vaccine have to incur some costs, such as time or money associated with doctors' visits. Others benefit from the reduced risk of getting disease spread to them. When people simply make their own choices, not accounting for the impact those choices have on others' health, there is too little vaccination and too much disease spread. This reduced risk of spread is important because vaccines, while valuable, are not 100% effective, and some people medically cannot be vaccinated. Thus, it matters whether other people in our community are vaccinated. Public policy has an important role to play in preventing disease spread, just as it does in preventing other harmful externalities like pollution. To speak of freedom, vaccine policy affects whether our children have the freedom to safely attend schools where they won't be exposed to measles, for instance. Current barriers for non-medical exemption are very low. It is more difficult to provide documentation of vaccination than it is to simply make the claim that vaccination conflicts with a belief. Evidence shows that adding even small amounts of paperwork for non-medical exemptions can increase vaccination rates. This suggests that at least some people in the current system use non-medical exemptions as a shortcut rather than going through the hassle of complying with vaccination requirements. We can learn from the experience of other states. Some states, such as California and Maine, have removed non-medical exemptions. Empirical evidence then shows that removing these non-medical exemptions increases vaccination rates, thereby protecting other children. Another thing we can learn from these states is that some people may substitute a non-medical exemption with a potentially fraudulent medical exemption. So it will be important to have clear criteria for medical exemptions. It will also be important to publicly report data on vaccination rates. Other states, such as Texas and Arkansas, have gone in the other direction and started allowing personal belief exemptions. There, we see a decline in vaccination rates, particularly among low-income individuals. Moreover, that evidence shows that vaccination doesn't just have health effects on people in their communities, but also ongoing effects on academic achievement. When it comes to communicable diseases, an individual's choice is not made in isolation, but affects the whole community, and I hope that public policy accounts for the impact that unvaccinated children have on the health of their classmates when deciding whether to allow non-medical exemptions. Thank you.
Thank you. Any questions from the committee? Thank you very much. Christina Hermos, UMass Memorial. Christina Hermos.
Hi. Hi, I'm joining from
from home today. I'm the Division Chief of Infectious Disease. Can you hear me?
Yes, go ahead. Thank you.
Hi, thank you for having me. I'm the Division Chief of Infectious Disease at UMass Memorial Children's Medical Center, and I'm testifying in support of the bills, the Community Immunity Act. I didn't write anything, but I was listening to the testimony and deciding how I wanted to use the time, and just wholeheartedly agree with the testimony of Dr. Moriarty and Mary Beth Mioto. I have patients who've suffered from vaccine-preventable diseases. They're unimmunized patients. But more importantly, hundreds of patients who are immunocompromised, who rely on the vaccination status of their their peers and their classmates. But I also just wanted to speak as a parent. I have 3 kids, and I listened to the testimony of the people against this, sort of talking about that sacred bond that they have with their kids. And I just believe in that. I agree with it. That's what we share. And what I think is lacking is this understanding of how these vaccines protect our kids. They are extremely safe. They have saved so many hundreds of thousands of lives over the past decades. And people who know how safe and effective they are want these vaccines for their kids. So what's tragic is that the lies are spreading faster than the truth. And we're up against this enormous just wave of misinformation and lies that's really targeting parents who care about their kids and instilling fear in them that is just so unnecessary. So what I want to talk for is advocate for my colleagues on the front lines who are educating these parents every day, who care about their kids and want them to be safe and healthy. And my colleagues are spending so much time just re-educating parents who have trusted the medical system for years and now have been instilled with this fear, which is completely based on this misinformation. And the frontline pediatricians are burning out having these conversations. We're already having a crisis of people going into primary care across this nation. We're seeing the number of medical students who are choosing pediatrics going down due to reimbursement and really burnout. And now they're spending time educating patients or reassuring patients about the safety of vaccines that could be spent talking about nutrition, that could be spent talking about, academics, about seatbelt safety, about other really important issues facing our kids. And they are, distracted by these other conversations. And it's hurting our profession. It's really, it's hurtful when, people in power are spreading messages that undermine what we do in our lives, what we've chosen to do. We chose to go into a low-paying field to support the public health and to keep kids alive and healthy. So please vote in favor of these bills before you. Thank you.
Thank you. Any questions from the committee? Seeing none. In person, Mike Pantos. Mike Pantos, welcome.
Good day, ladies and gentlemen. My name is Mike Pantos. I traveled here today to testify in opposition of Bills H.2554 and S.1557. These bills are a further infringement on the religious freedom and religious liberty of Massachusetts residents. If passed, these bills would remove religious exemptions from vaccination for students at K-12 schools across the Commonwealth. Having been a lifelong resident of beautiful Massachusetts, I plan to start a family here. As a devout Christian, my children will need religious exemptions from vaccinations in order to attend school. Under no circumstances will my sincerely held religious beliefs ever cave. I answer to God and not to any government or politician. Removal of religious exemptions will lead many families to resort to homeschooling as a better option. Those who cannot afford to homeschool will be forced to move out of state. This will further exacerbate the problems we have seen in central Massachusetts with loss of funding for schools due to significant decreases in enrollment. This impacts all taxpayers in our communities across the board. In closing, I respectfully request that you reject these bills. Please stop infringing on the religious liberty of your constituents, your voters, and all those who call the Bay State home. Our society was founded to defend religious liberty, and we must keep it that way. God bless America. Jesus Christ is Lord.
Thank you. Any questions? No questions. Thank you. Thank you. Next, Julia Regan, in person. Julia, welcome. And while Julia comes up, I just want to say thank you all for being here today. This is what democracy is all about. I appreciate the enthusiasm on both sides. Just ask that we keep pro-con, no outbursts. We have a lot of people to get through, and there's a lot of views in the room, and I just want to be as respectful as possible as we hear those differing views, even if they're different from ours, okay? So I really appreciate, and again, seriously, thank you for showing up. This is what we depend upon as legislators in terms of being able to have our conversations, listening to this testimony today. So with that, welcome.
Thank you, and thank you to the whole Joint Committee for being here today and holding this hearing. I very much appreciate it. My name is Julia Reagan, and I'm a soon-to-be first-time mom from Quincy. I'm here today in support of S1157, my apologies, 1557 and H2554, which would eliminate the religious exemption loophole and prevent dangerous disease outbreaks in our schools and our communities. A former coworker told me that once I become pregnant, I'll never stop worrying. And unfortunately, I found that to be true. Each week of pregnancy brings new worries. Next week, will her nuchal translucency scan show a healthy baby? When I have my glucose test to check for gestational diabetes, will I pass? In 6 short months, how will the birth of my daughter go? Will eating too many chicken nuggets cause nutrient deficiencies in utero? I still don't know the answer to that last question, but I will be checking with my doctor when I see him next. And most importantly, after birth, will she be able to receive a regular vaccine schedule? Well, my husband and I plan to vaccinate on a regular schedule as discussed with our pediatrician. What if our little one can't be vaccinated? How will she stay safe? This is one of my biggest worries, especially as a measles outbreak is happening across the country as we sit here at this hearing. Per the CDC's website, as of May 29th, 2025, a total of 1,088 confirmed measles cases were reported by 33 jurisdictions, with 30% of those infections confirmed in under 5 years and younger, and an additional 37% of those infected under 19 years old. How will any exemptions outside of medical ones positively impact vaccination rates when we know herd immunity is critical to protecting our most vulnerable community members? How can I protect my daughter if people in our community are choosing to not protect themselves against preventable diseases? I ask the committee to support both S1557 and H2554 and help keep not only the children of Massachusetts safe, but all of Massachusetts safe from preventable diseases. Thank you all so much.
Thank you. Any questions? Thank you.
Thank you.
Next, Katrina Capobianco. Katrina? Welcome.
Hi, thank you. I'm here to support Bill H2431. Firstly, when I was pregnant with my oldest son in 2021, I lost my job because I chose not to receive the COVID-19 vaccine. There is nothing more powerful than a mother's intuition, and that instinct to fiercely protect my children started well before they were here earthside. I believe that everyone, not only pregnant women, should have the right to choose what's best for their bodies and not have the fear of losing a job be a factor in that decision. Ironically, that vaccine is no longer recommended for pregnant women or children. So it looks like my intuition was right. Again, I support Bill H2431. I also strongly oppose Bills S1557, H2554, and S1618. I've only been a mother for 3 years, but like I said, mothers have an innate power to always act in the best interest of their children. No one will ever care more about my kids than my husband and I. No one in a position of power will ever truly have their best interests at heart. These bills are not about protecting children. They are about money and power. Leaving families with no options besides a medical exemption is unethical, since the only doctors who are brave enough to grant them are receiving backlash for their support of parental choice. Again, as parents, it is our job to decide what's right for our children. Let us do our job. I'm also here on behalf of my friend who was unable to come today. Her life and her family's life were changed when her son had a vaccine injury. Her son Brady, who I love dearly, lost all his words. Her quote is, the sparkle in his eyes, his appetite, he cried constantly, started headbanging, as well as suffering from a seizure. He has been diagnosed with autism. This was after one round of childhood vaccines. My friend has done everything in her power to fight for her son, but there are no doctors who can prove that it was a vaccine injury. But how are you to tell a mother she is wrong after seeing a clear difference in her child? I fully trust my friend and want her to have the ability to make all future decisions for the well-being of Brady. It is her job to protect him, since the medical professionals failed to do so. Let her and all of us have the choice to keep our kids safe. That's not your job, it's ours.
Thank you. Virtually, we have David Kilkenny. David Kilkenny.
Yep, trying to fix my camera here.
Welcome.
Thank you for letting me speak. One person today said that no major religion is against vaccines, and I'd like to educate him for a second. Christianity is about a personal relationship with our Lord and Savior, Jesus Christ. And no man-made institution, meaning the Catholic Church, the Presbyterian Church, govern that. The relationship with our Creator is personal, and it's up for us to interpret God's living word, which is found in the Bible. So quit telling us what religion, which is not faith, different thing. We don't care what the Catholic Church says about vaccines. Jesus said about his Father, thy will be done on earth, not my will, not your will. So allow us to continue to live God's will according to our interpretation of the Bible. One could argue simply that these bills endanger us all because the long-term result of grieving our Creator is far worse than anything that can happen to us here on earth. The Civil Rights Act says you cannot consider race, gender, sexuality, religion when hiring people, when determining who has access to services. This bill of discrimination, which is what it is, prohibits people with certain religious beliefs from going to school. If I don't think like you, I'm not welcome. I don't belong. I'm not included. I don't participate in equity. I lose my rights. But what I'd most importantly like to say, and what affects you, our elected officials, the most, what happens to middle school and high school kids if this bill of discrimination passes? Do they have to catch up with the 48 vaccines all at once? Over a week, a month, a year? Has any study been done to show what happens when you get 48 vaccines in a short period? I encourage you to research a little boy named Isaac Iben from Jamestown, Tennessee. He got 18 vaccines in one day to catch up with the school schedule and developed immediate, not the next day, not that night, not an hour later, immediate regressive autism. He can no longer communicate, he wears a diaper, and he needs 24/7 care the rest of his life. He went from playing Little League to that. Obviously, you know we can't sue vaccine makers if their products cause harm to our kids. But let me ask this. If your bill of discrimination forces middle school and high school kids to catch up to the schedule and they're harmed in the process, and many will be, can we sue our elected officials? Do you have immunity from this harm? It's gross negligence, which, by the way, removes any corporate veil from your personal assets. If this bill of discrimination goes through, please provide a grandfather clause to kids who already have existing religious exemptions. As much as I detest these bills, as much as I get angry about people who discriminate, I'll pray for all of you tonight, that God fills you with wisdom and reveals to you the best choice in this matter. Thank you.
Thank you. Any questions? Any questions in the committee? Thank you. Seeing none. Leslie Doyle, virtually. Leslie Doyle.
Can you hear me?
Yes, go ahead.
Thank you. Thank you, members of the committee. My name is Leslie Doyle, and I live in Sherborne, Massachusetts. I'm here to speak in favor of House Bill 2554 and Senate Bill 1557, and in opposition to House Bill 2376 and House Bill 2431. In 2015, after recovering from a stem cell transplant, I received a distressing message from my employer. The company discovered that several individuals unknowingly came to the office with measles on a day that I was there. This was particularly scary for me because my stem cell transplant wiped out my immune protections from vaccines. There's a long period of time after the transplant before you can medically get revaccinated, and it happened to be during that period of time when I was potentially exposed. Fortunately, I did not contract measles, but it made me all the more aware of how essential vaccines are to protecting us all from infectious diseases. I continue to receive treatment for multiple myeloma. I also received the full course of COVID vaccines. However, unfortunately, research shows that many patients with blood cancers like myself can't fully mount an immunity to COVID despite receiving vaccines. The more that people refuse to be vaccinated, the greater the risk to people like me. According to the National Institutes of Health, roughly 3% of the U.S. population is immune compromised and face similar issues. This situation is exacerbated by people refusing to vaccinate themselves or their children. Because of this, I continue to avoid going to public places indoors aside from Dana-Farber for my treatments. When I go to receive care, I mask, and as I sit in the crowded waiting room, I worry about whether people around me are vaccinated. If I contract COVID, it will require me to pause my medical treatment. This is the first treatment I've had in 9 years that does not come with painful side effects, so I'm doing everything possible to avoid contracting COVID. I miss weddings and special occasions. I've avoided flying, missed time with my grandchildren for fear of contracting infectious diseases from someone on the plane. This simply points out that the more that people refuse to vaccinate, the more pressure it puts on people like me. The rampant disinformation about vaccines and the hostile perception of vaccines that result are increasing the chances of contracting dangerous diseases. I do not believe there should be religious exemptions to forego vaccines. To my knowledge, there is no religion that dictates that followers should refuse to be vaccinated. Having an exemption gives people an automatic out from vaccinating that's not based on science or supporting evidence. This situation makes life more isolating for people like me and so many others. I'm asking today to please support House Bill 2554 and Senate Bill 1557 and oppose House Bills 2376 and 2431. And I thank you for your time.
Thank you. Any questions from the committee? Seeing none. Virtually, Maureen Treadle. Maureen Treadle. In person, Lorraine Rudd. Welcome.
Hello, I'm here. See me?
Sorry, is that Maureen Treadle?
Yeah, hi, sorry, I couldn't get my
We'll
audio
come right back to you after this next testimony, so be on deck.
Okay.
Thank you.
Who's up? Lorraine? Hi, my name's Lorraine Rudd. I'm a lifelong Massachusetts resident. I currently live in Lunenburg. I support Representative Gasky's Bill 2539 or S539 and H2431 prohibits the requirement of a COVID-19 or mRNA gene-altering procedure. Really scary. I oppose Senator Kennedy's Bill S1557 because it removes religious exemption. Religious, not non-medical. I oppose Representative Vargas' Bill H2554 because it also removes that exemption or that right and can bar children from attending public and private K through 12 schools. I oppose Senator Roush's bill vehemently, S1618 on community immunity, because it's false. You don't get healthier from an injection. I've been a certified holistic nutritionist for over a decade, retired now, but I'm a lifelong learner. I love nature and I'm drawn to alternative medicine. It works. It works. My position on these 4 bills is from a parental common sense standpoint. Parents know the harm from the shots aren't reversible by the provider. You can sometimes not even get the provider to admit, oh, your child has been harmed, let's fix it. We don't get that. It goes back to someone who talked about that as an insurance problem. When COVID-19 lockdowns and mandates were forced upon us, parents had to become more self-reliant and discerning as to what they were really facing, physically and politically. This had a profound effect on me, and I'm sure others, when the fear and threats, the gaslighting, the censorship, and the uninformative news that weren't helpful It was during that doubtful time that I sincerely appealed to God for help and guidance. I had never done that before. Raised Catholic, never thought to reach to God. Went to church, didn't help. I needed a one-on-one relationship with our Lord and Christ Jesus. I doubt it was unique. I think we all were facing some pretty scary decisions. I now have a newborn faith that is unshakable, and for that I'm eternally grateful, because prayer does work. Take your fear and give it to God. These callers and the testimony, I'm afraid. We were not put here to be fearful. We're here to help each other and to give our fear to God. We're not learning that in our religious education. We don't learn it in school. We walk around scared with masks in fear. The one-size-fits-all CDC vaccine schedule is flawed. Health Human Services is delivering updates so fast it's hard to keep up. I try. It's interesting. We need to focus on the very concerning data emerging that the mRNA-based injections greatly damage natural immune systems. We were all told the same thing, but some were harmed more than others because they did the right thing. They were scared. I was scared, but I took a bit of caution. And I'm asking you to please just let people decide for themselves. Thank you.
Thank you. Any questions? All right, Maureen Treadle, thank you for your patience. You're up on virtual, Maureen.
Thank you, legislators. Thank you for hearing me. My name is Maureen Treadle. I live in Milford, Massachusetts. And I'm here to voice my belief against S1618, S1557, and H2554, and I do support H2431. I am the mother of 7 now adult children and 6 grandchildren. In 1991, when I became a mother for the first time, I had no reason to be concerned about vaccines. I trusted my pediatricians and didn't question anything and went through it. And fortunately, none of my children had adverse reactions. I did think it was unnecessary for newborns to receive any injections, and I did have a pediatrician that respected my timing. I didn't think it was healthy for any child to be injected with who knows what all at once. But as time went on and things started happening with some of my other children, I started stopping and pausing and to learn more, and was really shocked to find out that I asked my doctor what was in the vaccines. She said, she didn't really have an answer for me. And I started learning that doctors aren't informed, I guess, of what's actually in them, but they are very much taught to learn the schedule of when they get them. And then I started, the more I learned, the more I realized I am the parent. Why am I the one that's being told what to put in my child? But I did have a daughter who received a cancerous sarcoma that nobody can tell me why it happened. Thank God it wasn't malignant. And I do have a grandson after the rotavirus vaccine had inconsolable crying for 24 hours. Thanks be to God, he's doesn't seem to have any impairments at this time, that he's 4 years old. But I don't understand the mentality of forcing children to go, forcing parents and some of these prior people who have spoken about, the grandfather clause, and I didn't even consider that either. There's just so many reasons for us to really put a pause on what we're doing here and why. I have respect for the people who are for this and their reasons. I'm not their enemies. I do have a very different opinion from them, and I do appreciate when we can have an opportunity like this to share what we are concerned about. And I would ask that all of these things be seriously considered. The people like me who are asking you to be very cautious about what sort of act might happen if you pass these bills. Thank you.
Thank you. Any questions of the committee? Seeing none. In person, Joanna Sacco? Joanna? No. Shannon Snowden? Welcome.
Good afternoon, senators and representatives. My name is Shannon. I'm here to respectfully express my strong opposition to S1557 and H2554. As a resident of Massachusetts and someone who has had sincerely held religious beliefs since long prior to my children, who are currently 20 and 16, attending school, I'm deeply concerned about the proposed legislation to remove the religious exemption. Taking away religious freedoms is not only a slippery slope, but it is also not following the values that our Commonwealth was built upon. The right to worship in a, quote, manner consistent with the dictates of one's own conscience without restraint of personal liberty is explicit in Article 2 of the Constitution of the Commonwealth of Massachusetts. Furthermore, the right to a public education is enshrined in the Massachusetts Constitution and is an essential aspect of a free, fair, and democratic society. Stripping children of the right to an education because of their religious beliefs would force some people into an impossible choice between religious freedom and a right to education. Like so many other families in the Commonwealth during COVID, my family saw firsthand the extraordinary challenges presented by the loss of access to school-based education. School-based learning provides not only the obvious educational benefits, but also opportunities for children to form social ties, experience community, and learn empathy. It also combats a range of social ills, including socioeconomic inequality, gender inequality, and racism. For so many families, loss of school-based learning also did so much harm in terms of increasing the already skyrocketing mental health crisis. Think of the trauma imposed on these children by kicking them out of schools that they have been in for all of their educational lives. Furthermore, data shows that Massachusetts does not have any kind of vaccination problem. Massachusetts has the highest rates of vaccination and the lowest rate of vaccine hesitancy in the country. According to the Massachusetts Department of Public Health, only 1% of students entering kindergarten have a religious exemption, and the vast majority only have an exemption to one or a couple vaccines and are otherwise immunized. Religious exemption rates have had no impact on overall vaccination rates, which remain historically high without coercive measures. There are some communities with non-optimal rates of vaccination, but these lower rates have almost zero correlation with the use of the religious exemption. Low rates are more often due to students that the DPH calls the gap population, students who do not have adequate records and do not have an exemption. Instead of discrimination based on religious beliefs, these communities need support and outreach, including full-time nurses to follow up and support families. The idea of kicking a child out of school because of sincerely held religious belief that he, she, they have is cruel and unusual punishment. Children have suffered more than enough throughout recent years. Why add to that burden? Instead of punitive coercive measures, we need support, empathy, and education to promote healthy communities. Please oppose these bills and focus on more urgent health problems facing the Commonwealth, such as the mental health epidemic among children, teens, and adults. Thank you for your time.
Thank you. Any questions from the committee? Thank you. John Marchese, in person. John Marchese. Jason Gardino. Jason Gardino. Virtually Esther Hawkins. Esther Hawkins. All right. Virtually Chloe Schwartz. March of Dimes. Chloe Schwartz.
Can you hear me?
Yes, go ahead.
Okay, great. Thank you so much. My name is Chloe Schwartz. I am the Director of Maternal and Infant Health for March of Dimes' Boston Market, and I am also a lifelong Massachusetts resident. I'm pleased to represent March of Dimes in support of House Bill 2554 and Senate Bill 1557. March of Dimes, formerly known as the National Foundation for Infantile Paralysis, was founded by President Franklin Delano Roosevelt in 1938 to fund the research that later led to the development and dissemination of the polio vaccine. Polio, known back then as infantile paralysis, used to strike thousands of children in the U.S. every year. Polio was eradicated in the U.S. by 1979 because of the landmark National Salk and Sabin vaccination programs, the funding of which was the very first mission of March of Dimes. March of Dimes remains committed to promoting vaccinations nationally and locally. We are a co-founder and current member of the Massachusetts Families for Vaccines Coalition. Exemptions to vaccines put communities at risk from preventable diseases. When families refuse or delay vaccines for their children without a medical basis, they endanger the lives of those in their community, especially those who cannot be vaccinated. Newborns, individuals with autoimmune conditions, those going through chemotherapy, or those having had an organ transplant, just to name a few, will always be more susceptible to severe infectious disease. High vaccination rates protect those who cannot medically be vaccinated and stop outbreaks from becoming epidemic. Before vaccines, thousands of children died from these diseases. In 1900, nearly 20% of children died before their 5th birthday, the leading cause being infectious disease. Those same germs still exist today, but because children are protected by vaccines, we've rarely seen these diseases until now. The utilization of non-medical exemptions has been steadily increasing as both religious affiliation and service attendance has declined, according to Gallup in 2024. And we are now in the middle of a measles epidemic across the U.S. with more than 1,000 cases, 133 hospitalizations, and 3 deaths already confirmed this year as of last week. The CDC even issued new guidance for international travelers, regardless of destination, to be fully up to date on measles vaccinations. We also saw the greatest number of pertussis cases, also known as whooping cough, in the U.S. last year in over a decade, and we are currently on course to see the highest case count of whooping cough this year since 1948. Our vaccination rates in Massachusetts may look good on the surface, but there are schools across the Commonwealth, from Great Barrington, Walpole, New Bedford, East Boston, that have nearly half or more than half of their students missing critical vaccinations. Outbreaks in these communities and more are a matter of if, not of if, but when. House Bill 2554 and Senate Bill 1557 maintain the legislative language that passed favorably out of this joint committee during the 2022 and 20 session. So myself and March of Dimes support these bills and urge legislators of the Public Health Committee to vote in favor of it. Thank you very much.
Thank you. Any questions from the committee? Seeing none. Gary Ajamian. Gary Ajamian. Nicole Cohen. Nicole Cohen. Randy Hale. Virtually, Randy Hale. Matt Campbell. Matt Campbell. Kenny Anderson. Kenny Anderson. Camden Dupre. Camden Dupre. Mary Al-Amseti. Mary Amseti. Alyssa Gonzalez, in person. Alyssa, welcome. What's the name?
Thank you, chairs and members of the committee. My name is Alyssa Gonzalez, and I oppose the community immunity bill and the removal of the religious exemption. I do support the medical exemption bill. I'm a Mass resident living in Gardner. We are a homeschool family. I've homeschooled my family since COVID. Homeschooling is not easy, and it should never be treated as a default or backup option forced onto families by misguided policy decisions. It punishes children from faith-based, working class, and special needs families who don't fit a narrowly state-approved mold. You're not building bridges, you're burning them behind children like mine. I testify today as a mother of a 14-year-old boy who wants to be an electrician, he wants to be a welder or a plumber. I can't give that to him. I need to send him to a tech school. He is kind, he is responsible, and he is the kind of kid that you'd want your own kids to be friends with. He worked so hard to get into a vocational technical school. He aged out of his YMCA sports because he turned 14. He missed an entire season of soccer because of his age, and he's a homeschooler. He studied for hours for his placement exam. He went through the application process, and our family celebrated his acceptance. And he allowed himself to dream, especially to play high school basketball. He loves basketball. You're going to rip that away from a 14-year-old innocent boy. That's the real impact. It's not theoretical, it's not abstract, it is personal. And now you're telling me that his hard work, his place, his dream, might be taken away by legislators who don't even know his name. For what? For political posturing, an attempt to assert your moral dominance over my religious liberty. I've heard the way some legislators speak about our religious beliefs, our choices, and worst of all, our children. The disrespect for our families is absolutely glaring. There isn't a soul on earth who can judge my depth, my struggle, or my beautiful relationship with my Lord and Savior, because that is between him and I alone. I don't want to leave Massachusetts. This is my home. My family has lived on the same generational land for 10 generations. No place could be home. Massachusetts is home. If this state turns its back on children like mine, pulls the trigger on their futures, don't act surprised when the fallout hits hard. That's not inclusion. That's not equity. That's abandonment, plain and simple. You're not closing doors. You're lighting a match and walking away. And I'm not asking you to fight for my son. I'm asking you not to fight against him. Don't pass these bills.
We're doing so well for a while. I just want to say that when we do the applause, it's going to take time away over time, cumulatively, from people that are here to testify. So please keep it down. Next, virtually, I have Northeast Saunders. Or in person? There we go. Thank you. Welcome.
Good morning.
Morning.
Senator Driscoll, Representative Decker, in absentia, members of the committee. My name is North Saunders. I'm here today with my 5-year-old daughter who will be starting kindergarten this fall. I'm also the executive director of Safe Communities Coalition, a national nonprofit organization dedicated to protecting public health by strengthening immunization policies. We work with Families for Vaccines chapters throughout the country, including Massachusetts Families for Vaccines, because every child deserves to be protected from preventable disease, no matter where they live or where they go to school. I had the honor of helping lead Maine's successful effort to remove non-medical vaccine exemptions. It wasn't easy. We faced well-organized opposition and a statewide referendum. But when it came time to vote, nearly 73% of Maine voters stood with science and removed the exemption. And it worked. Since then, Maine's kindergarten MMR vaccination rate has climbed from under 94% to nearly 98%. That's not just the statistics. That's thousands of more kids protected from dangerous diseases like measles in much safer schools across the state. Meanwhile, here in Massachusetts, MMR rates are now lower than Maine, New York, and Connecticut, all states that have already taken action. This isn't because Massachusetts parents don't believe in vaccines. It's because your laws haven't caught up. That's why I strongly urge you to pass H2554 and S1557 to eliminate the religious exemption and close this dangerous loophole. This is personal for me. I have 3 young children, including the one here with me today. My wife is a pediatrician. We've built our lives around protecting children, our own and others. We believe deeply in science, in community responsibility, and in laws that reflect both. No parent should have to worry that their child's school might become the center of an outbreak of a disease that we have the power to prevent for decades. Massachusetts has a chance to lead. Please pass these bills and give every family the confidence that school is a safe place to learn, grow, and thrive. Additionally, we support H2384 and S1514, your bill, Senator, to protect provider choice when it comes to immunizations. I'd like to respond to Senator Dooner's question about declining church attendance, if I may.
You have 2 seconds. Oh, so if you want to send us an email afterwards,
so
that'd be
you
terrific.
asked for a citation of declining church attendance, and so the Gallup poll on March 24th of 2024 noted that 3 in 10 Americans attend church. And that's down 42% in 2 decades from 2004.
All right. Thank you. Thank you for your testimony. Any questions?
Thank you. And do you know if that takes into account those who watch virtually? I know ever since COVID, some people do watch virtually on Sundays, and that is their church. Did that poll take that into account? Do you know?
I don't.
Okay.
I can send you the link, though.
That'd be great. Thank you.
You're welcome.
Any other questions? Thank you. Next, Candace Edwards.
Thank you very much for your attention today, committee members. My name is Candace Edwards, and I'm a mother, a Christian, and a fierce advocate for my son, a beautiful 10-year-old boy with a generalized intellectual disability, ADHD, autism, has seizures, and an auditory processing disorder. He is finally in an incredible Chapter 766 program that provides the intensive support he needs, supports our local public school system simply could not provide. I am here today to voice my strong opposition to the Community Immunity Act and the religious exemption bills. This is the 4th time that I have testified on this legislation. My son was just 3 years old when this all began. That marks nearly 7 years of anxiety, exhaustion, wondering every year if the world that my child knows would be ripped away. And in fact, I'm sure the stress gave me breast cancer. Let me be clear. My son's life was permanently altered after a routine vaccination. He developed serious, lifelong medical complications, and I've spent many times sat beside his hospital bed begging to God to spare him. Doctors told us that he should not receive further vaccinations to protect his life, but none will sign the medical exemption he needs. And now this bill tells me I must risk his life or surrender his education. That is a cruel and impossible choice. During the pandemic, I tried homeschooling and it nearly broke me. My son's needs and therapies, the learning style and strategies are far beyond my ability. And if this bill passes, I'll be forced to leave my job and apply for any and all assistance, such as food stamps, cash assistance, mass health, just to survive and provide. Massachusetts says that it is a sanctuary for the vulnerable, for diversity, equity, and inclusion. But where is that protection for families like mine? We pay our taxes, we follow the law, we file exemptions as is required, and in return, we are mocked, vilified, and targeted, called abusers of the law and anti-vaxxers just because we want our children in school. This bill targets families like mine under the guise of public health, but the data is clear. The largest gap in immunization comes from non-compliant students, not religious families. That group is up to 11 times larger. So if this is about public health, why are we the ones being targeted? The Community Immunity Act terrifies me, especially the minor consent provision. There are no age minimums, no mental capacity safeguards. This will allow my son with significant cognitive and communication challenges to consent to medical procedures without my knowledge or input. He does not understand his medical history or the risks involved. Granting him legal authority to make those decisions would put him in grave danger.
Thank you. If you could wrap up, thank you.
Can I just say one more sentence at the end?
Please wrap up.
And let me say this plainly. This bill assumes that removing the religious exemption will increase vaccination rates, but I will not gamble with my child's life or betray our faith to buy his place in the public education system. Thank you.
Next, we have Courtney Neal. Courtney, welcome.
Good afternoon, distinguished members of the Joint Committee on Public Health. My name is Dr. Courtney Neal from Hamilton, Massachusetts, and I'm here today to respectfully oppose Bills H.254, S.1557, and S.1618, and to express my sincerely held religious beliefs regarding vaccination, shaped by both personal and clinical experience. After receiving an MMR booster in 1992, I began experiencing frequent seizures and was ultimately diagnosed with epilepsy, which deeply affected my life. Seizures are listed as a known adverse reaction on both the MMR and DTaP vaccine inserts. Additionally, peer-reviewed research has shown that certain vaccines can and do trigger seizures and epilepsy in individuals with predispositions. If that risk exists, then we should be mandating proper genetic screenings and family medical history assessments, not enforcing a one-size-fits-all vaccine schedule. It is unethical to coerce and mandate products with known risks without accounting for individual vulnerabilities. It is well established that children inherit their mitochondria from their mothers, organelles essential for cellular energy production and immune system regulation. Given my own medical history, it is entirely reasonable to believe that my children may share a similar vulnerability to neurological and autoimmune complications. With this in mind, and as a mother entrusted by God to safeguard their health, I must make the medical decisions I believe are in their best interest and will protect them from potential harm. One of my children has an IEP, and removing the religious exemptions would deny him access to the specialized education he needs. We learned during the COVID-19 period how devastating it is, emotionally and developmentally, for children to be kept out of school. I'm grateful that Massachusetts currently respects religious exemptions so family like mine can uphold both our faith and access education. We do not need to be worried about an unvaccinated child contracting and spreading diseases in school. Massachusetts already has laws in place to temporarily exclude unvaccinated children in the event of an outbreak in school. Therefore, these policies protect public health while respecting individual rights. Bills H.254 and S.157 would force parents like me to choose between our religious beliefs and our children's education. Bill S.1618 would give the Department of Public Health the power to define what counts as religious belief, which contradicts Article 2 of Massachusetts Constitution. According to mass.gov, only 1% of Massachusetts students currently use a religious exemption, while 10% have not reported their vaccine status. Eliminating this exemption will do virtually nothing to raise vaccination rates, but will harm vulnerable children, increase mental health challenges, and put strains on family. If the state is seeking higher compliance, I urge the committee to focus on improved reporting and access to vaccines rather than removing the rights of responsible, well-educated, and hardworking tax-paying families. Thank you for your time.
Thank you. Vanessa Pompey Britt. Vanessa, welcome.
Thank you, chairs and members of the committee. My name is Vanessa Pompey Britt, and I'm an attorney. The fear of measles and other illnesses is understandable, but the COVID and HIV epidemics should have taught us that public health and education policy should never be motivated by fear or politics. Eliminating the religious exemption in the Community Immunity Act are fear-based measures that will do more harm than good and will result in costly taxpayer-funded litigation. The Community Immunity Act purports to maintain religious exemptions, but it actually allows the DPH commissioner to exclude from school children with exemptions even when there's no outbreak or emergency, effectively eliminating religious exemptions at certain schools. This clearly conflicts with the standard recently articulated by our Supreme Judicial Court in Care and Protection of Eve, and not allowing medical exemptions runs afoul of the century-old Supreme Court precedent Jacobson versus Massachusetts. Parents suing the state for loss of the religious exemption will be supported by a federal court precedent that ordered Mississippi to allow religious exemptions after years of allowing only medical exemptions. And the Supreme Judicial Court recently ruled that the state's interest in vaccinating a child temporarily in the custody was outweighed by the parents' religious objections, emphasizing the extent to which the Massachusetts Constitution protects the free exercise of religion. As for the claims that religious exemptions are a loophole and that there are no legitimate religious objections to vaccinations, circuit courts all over the country and the Massachusetts Supreme Judicial Court disagree. To be sure, our society has become more secular, making religious believers an anomaly, especially in this state. But the Supreme Court warned that the state and courts are not free to reject religious beliefs because they consider them incomprehensible. But it's not just the cost of litigation, it's the cost to children and families when a school closure is imposed on them, a sin that occurred during COVID and should never be repeated. And to what benefit? An illusory marginal increase of vaccination rates, not because parents abandon their faith and vaccinate their children, but because these children won't be included in the reported numbers once they are kicked out of school. Note that these children won't disappear. They will continue to go to all the places children should go, except school. To increase vaccine uptake, public health officials should focus on the 4% of non-compliant kindergartners who attend school without an exemption. Targeting the 1% with religious exemptions suggests institutional hostility towards religious identity. Define principles of diversity, equity, and inclusion. Massachusetts has achieved the right balance between public health goals and free exercise by allowing religious exemptions for decades and still ranking first in the nation for school vaccination rates. We can prevent and control infection with current law, which allows for the suspension of religious exemptions in the event of an outbreak or emergency and includes extensive isolation and quarantine protocols. And this is not a misunderstanding of the law. The site is 105 CMR 300. I urge you to carefully consider the costs of these measures, which outweigh the benefits, and resist the inclination to enact fear-based discriminatory measures that harm children in the name of public health.
Thank you. Thank you for your testimony. Sergeant Goodchild. Sergeant, welcome.
Thank you very much, committee members, for this opportunity to address you. My name is Sergeant Goodchild, and I oppose S1557 and H2554. As a member of the community who has spent decades advocating for informed medical and religious freedoms, I feel compelled to voice my concerns about these bills and their implications for public health and individual freedoms. The proposed legislation appears to undermine nuanced case-by-case assessments that are necessary for safeguarding the rights of vulnerable groups. Massachusetts leads in immunization rates. Religious exemptions are less than 1% for high school seniors and about 1% for kindergartners, while 4.1% of the unvaccinated are considered non-compliant because they lack exemptions and vaccinations. At 10 schools with the highest amount of unvaccinated children, 7 children had religious or medical exemptions, and 181 were non-compliant. In kindergartens across the state, there are 853 children with a religious exemption, and 2,689 who are non-compliant. Statewide, there are 2,203 children with religious exemptions, but there are 16,067 who are non-compliant. These bills discriminate against and marginalize a small group of children while ignoring the more significant contributing factor to low immunization rates. The disproportionate focus on religious exemptions creates a narrative that unfairly targets families who make informed choices about their children's health while disregarding the larger systemic issues. For instance, the significant number of non-compliant children points to gaps in accessibility, education, and outreach efforts that may hinder families from completing vaccine schedules. Instead of enacting punitive measures, a more constructive approach would involve addressing the root causes through community engagement, improved healthcare access, and comprehensive public health campaigns aimed at increasing compliance through support rather than coercion. As a child, I was vaccine injured. My experiences between the ages of 5 and 13 years old were remarkably challenging. Having been diagnosed with severe epilepsy, mental retardation, and autism following my measles vaccination in the 70s. I fully recovered and have worked with children with neurodevelopmental disorders for 30 years. Because of all of my experience, I have deeply held religious beliefs on this matter. My family is worthy of your consideration. We are all worthy. Thank you for your time.
Thank you. Any questions from the committee? Seeing none. Dr. Silvana Casale. Welcome.
Hola, buenos días y gracias por esta oportunidad. My name is Dr. Silvana Casale. I'm a pediatric psychologist. I have 4 graduate degrees. I specialize in the diagnosis and treatment of brain and learning disorders. I am here in favor of giving parents a medical choice. I support religious freedom. Where there is any risk, there must always be a choice. Please do not make the same mistakes others have. I lived in California when the government removed the religious exemptions. The very neediest of children were kicked out of school. These children lost all access to all services, including occupational therapy, physical therapy, counseling therapy, autism therapy, integration of all pediatric interventions were gone. Talk about costly, members of society. Regression of education, severe. Mental, physical decline for an already marginalized and underrepresented community. While inclusion must be the goal, the ultimate mission for all children with special needs, removing medical choice will not be inclusive. It will be isolation and inequality for our brown, Latinos, Hispanic familias, mi gente, please. Gracias por escuchar. Thank you.
Thank you. Okay. Sylvia Fogel, MD.
Hello, my name is Dr. Sylvia Fogel. I'm speaking today in my personal capacity. I am a psychiatrist with over 20 years of clinical experience. Over the past decade, my primary clinical work has been with individuals with autism, including their families, and those with neuroimmune disorders. Public health policy should support and empower, not harm or humiliate. Public health should provide education, not take it away. Unfortunately, bills S1557, H2554, and S1618 are the antithesis of just, equitable, and ethical public health policy. By removing or limiting access to education, these bills will do more harm than good. Advocates for these bills purport they will make us safer, yet children with religious exemptions who are kicked out of school will still be at our grocery stores, movie theaters, faith centers, and waiting rooms, just not in school. Advocates for these bills assume they will coerce compliance and raise vaccination rates. Yet data from other states clearly suggests that when forced to choose between their religious convictions or coercive mandates, many will not comply. After California removed non-medical exemptions in 2016, homeschooling increased by 78% and public school enrollment decreased by 6%, almost 400,000 students. In Maine, public school enrollment decreased by 5%. In New York, homeschooling increased by 100%. Education is a fundamental social determinant of health. It is crucial to bolstering equity for the marginalized and those with special needs. Educational achievement lowers mortality and improves health outcomes, including mental health. During COVID, when families managing autism and other special needs lost access to special education services, I witnessed incredible harms that are unimaginable to most. I worked with families whose special needs children put their heads through walls, literally. Some broke windows and TVs and threatened themselves or others with violence. In most cases, a major contributor was the loss of access to education, services, and support. Massachusetts already has high vaccination rates and a low religious exemption rate. If these bills are enacted, we could expect at best that vaccination rates would increase by a few tenths of a percent. If even a handful of special needs or marginalized children lose access to education, the total harms will unequivocally outweigh the speculative benefit of marginally higher vaccination rates. History tells us that struggling teens, as happened during the COVID epidemic, may be tipped towards suicidality in the context of losing access to education, sports, mentors, and peers. In February of this year, Governor Healy explicitly addressed gaps in education access in marginalized populations and affirmed a commitment to equal access to education in Massachusetts. These bills directly and obviously undermine those sentiments and will cause lifelong harm to children and their families. Thank you.
Thank you for your testimony. Evan Hines, Evan C. Hines. And then panel, Bridget Kearns and Emerson Kearns. Welcome.
Good morning, and thank you for the opportunity to speak today. My name is Bridget Kearns. I am the mother of 2 teenagers who attend public school and a private college in Massachusetts with a religious exemption. This is my daughter, Emerson Kearns. I'm strongly opposed to Bills S-1557, H-2554, an act relative to routine childhood immunizations, and Bill S-1618, an act promoting community immunity. Children with religious exemptions do not pose an inherent risk of harm to anybody in the community. They are not perpetually sick. Vaccination is not the only way to prevent infection, support an immune system, or reduce the risk of spread in a community. While my reason to vaccinate is rooted in my religious beliefs, do not assume that I lack the capacity to understand science, nutrition, healing, and the basic principles of healthy lifestyle. The practices we maintain not only support our own health, but contribute to that of the broader community, including the smaller minority of children who have a medical exemption. As for the immunocompromised, they are not simply at risk for diseases on the childhood schedule, but all illnesses. These vulnerable children must take precautions beyond the expectation that the entire community is up to date with the current vaccine schedule. The false narrative that these children will be safe as long as school children are vaccinated is simply an illusion and does not eliminate the need to take other measures. My heart goes out to those families that face challenges with their child's health. However, I believe my children are equally as precious. And mandating vaccinations against our religious beliefs to make them a human shield or a sacrificial lamb is not equitable. My children's souls and health are not a bargaining chip, and removing their constitutional right to an education does not align with the diversity, equity, and inclusion initiatives that Massachusetts prides itself on. In fact, solely relying on the data of school vaccination rates does not give an accurate picture of rates within the community. School children don't live in a vacuum, and infectious disease does not simply circulate amongst them. Even within a school, we have a population of adults not held to the same standard as children and are not calculated in the data. If we were to accurately measure community immunity, we would need to accurately account for everyone in the state. Removing the religious exemption in other states has not been an effective strategy to increase vaccination, but rather to skew data to appear that vaccination rates have improved. Children do not get up to date, but most move or homeschool. Many remain in the community as they normally would in movie theaters, dance class, on athletic teams. Depriving 1% of the religious minority access to education not only lacks diversity, equity, and inclusion for protected class, it does nothing noteworthy to improve the community-wide rates, nor does it address the gap population that are non-compliant with any regulations.
The McKinney-Vento Act, which affords homeless students access to education without adhering to the same regulations required for other students, is critical for vulnerable children. In addition to our own homeless population, Massachusetts has been a beacon for migrants looking for better life. As this population increases, so do the rates of children in school without documentation of vaccination. It would be unethical and unsafe to indiscriminately vaccinate these children, and even if we could, we simply don't wait until they are fully up to date to enter school. Given the number of variables at hand, it is unjust to continuously attack the religious exemption and place full responsibility of vaccination rates on our backs when there are clearly larger populations contributing to it. It is discrimination to deprive tax-paying citizens of the Commonwealth access to education while allowing other unvaccinated groups that privilege. It is an illusion that passing this legislation will move the needle at all in vaccination rates or reduce disease outbreaks in Massachusetts. There is no historical evidence that a disease outbreak in Massachusetts is caused by a child with a religious exemption. Religious objection to vaccination is not a driver of the rise in vaccination hesitancy. For that, you will have to reflect on the actions of our government to coerce, manipulate, mandate, penalize, exclude, and fire citizens for an experimental shot that did not live up to its hype. I just completed my freshman year of college. However, participation in the Massachusetts dual enrollment program and AP courses, I am technically a junior. That's kind of frightening. I am on track to complete a bachelor's degree in only 2.5 years and have been accepted to the graduate program. At 19, this is my third time testifying to preserve my right to the education opportunities available in this state. And unfortunately, I have had to continually advocate for myself and other children since I was just 13 years old. I pray that I am able to complete my degrees at the college where I am thriving and never sit before this legislation pleading for you to see I am worthy of an education. Massachusetts does not need to be a follower of states who have discriminated against families and deprived children of an education, but rather it should be a leader in demonstrating how we have and continue to balance both honoring religious freedoms and preventing disease outbreaks through a variety of public health initiatives, including the exclusionary criteria that already exists. Finally, we support H2541, S347, an act relative to the protection of medical exemptions, and H2431, an act prohibiting the requirement of a COVID-19 vaccine, which could have protected people like my mother, who lost her career in healthcare when her long-standing religious exemption of more than 16 years was denied for just the COVID shot. Thank you.
Thank you. Again, please, rather pro or con, we need to keep the no applause. We need to keep moving. We have a lot of people to get through today. Next up, we have Catherine Vandy Collegy. Sorry if I got that name wrong. Okay.
Thank you for the opportunity to speak. My name is Catherine Vandy Collegy, and I oppose bills H2554, S1557, S1618, support bill H2541. I have been a registered nurse for almost 20 years. I've worked in oncology, pediatrics, and school nursing. As nurses, we take an oath to treat everyone respectfully and as individuals, each with an equal right to health care regardless of our personal views about their choices. I would imagine, as public servants, you'd feel the same about the people you represent, as you have also pledged an oath which states that you will faithfully and impartially discharge and perform all the duties incumbent on you and bear true faith and allegiance to the Commonwealth, in other words, your constituents. So I'm confused as to why these bills, which would deny a specific population from education, has resurfaced yet again, as they are far from impartial. The intent of these bills appears to be protecting people from communicable diseases. But this raises the question, why do we not exclude children with AIDS or hepatitis C? Why are children with these confirmed communicable diseases allowed in school, but healthy, unvaccinated children who may or may not pose a future risk are not? Massachusetts already has an exclusion protocol in place. Schools are to notify unvaccinated families during outbreaks and temporarily restrict physical attendance if needed. Why impose permanent exclusion from education when a reasonable measure already exists? Furthermore, the current statistic for children in Massachusetts with vaccine exemptions is just 1%. This figure includes fully and partially unvaccinated children and the GAP population. Only 6% of that statistic is fully unvaccinated. If you want to address vaccination rates, take it from a former school nurse. The GAP population needs to be addressed first, as those stats are far higher than those seeking exemptions on religious grounds. In my county, where I live, there are 972 children in the GAP. So tell me again why eliminating the religious exemption is going to help that statistic increase. As for Senator Roush's bill, I need a full hour to go over how dangerous it is from a medical standpoint. This bill erodes trust in the medical profession and puts children at tremendous risk. Minors cannot consent to medical procedures, period. They need consent from a parent to get their ears pierced. What this bill proposes is reckless at best and evil at worst. I will continue to uphold the rights of every patient I serve. And I'm going to do that for as long as I have my license. And I wish all of you would as well, for as long as you continue to serve the public. If I denied someone access to care on religious grounds, I'd be fired, or I'd lose my license. I urge you to remember the oath you took as a public servant. Denying access to education through legislation is not in the spirit of that oath and borders on authoritarianism. Thank you very much for your time.
Thank you. Renee Vanderzicht, virtually. Oh, here in person. Welcome.
I'm here with my daughter, Charlotte Vanderzeit, and my other daughter, Sydney, and my mother. Thank you for taking the time to hear all of us. My name is Renee Vanderzeit. I'm from Uxbridge, Massachusetts, and I'm here today to voice my opposition to Bills S1557, H2554, and S1618. We are in support of Bill H2541 and My Beautiful Family. Bill S1557 and H2554 in particular would be utterly destructive and disruptive to thousands of families across the state, including mine. We have been a part of the public school system since 2009, as well as a homeschool family for 4 years coming out of the pandemic. And let me tell you, while it was a positive experience, it was hard. My kids are thriving right now. I'd love for them to stay there. They're now thriving as students and athletes in our public school system. My daughter, Georgia, has persevered and overcome every obstacle while bringing kindness to those around her to successfully complete her first year back to public school as a 5th grader. My daughter, Charlotte, sitting right here next to me, has achieved high honors each term for her first year back to school as a 6th grader. She already has dreams and aspirations of attending college. My daughter, Sydney, sitting right over there, has been an honor roll student each year and is going to be a senior this fall, with hopes of attending college to play field hockey. I also speak on behalf of my 4 nephews and 1 niece whose families would be negatively affected by the removal of the religious exemption. Max, grade 5, Phoebe, grade 6, Leo, grade 1, Jameson, grade 1, and Caleb attending preschool. They are all smart, talented kids who love school. My children are able to attend school with a religious exemption, as well as a signed affidavit with the Uxbridge Public School System stating that my children would be excluded from public school during an outbreak of a vaccine-preventable disease. This is a reasonable safeguard that is already in place that makes removing the religious exemption unnecessary, unsafe, and unfair. Denying access to education based on religious beliefs is a violation of our constitutional rights. And although it would impact a very small minority group, it diverts attention from a broader yet more urgent issue. There's a gap population with those who are likely missing records and potentially vaccinated. Last, I'll leave you with this. From 1 Corinthians 6, 19 through 20. Do you not know that your bodies are temples of the Holy Spirit who is in you, whom you have received from God? You are not your own. You were bought at a price. Therefore, honor God with your bodies. And also, those who would give up essential liberty to purchase a little temporary safety deserve neither liberty nor safety.
Thank you. Heather Linehan. Heather Linehan virtually. Amy McPherson.
Yes.
Oh, Heather, go ahead.
Oh, I'm sorry. I'm Jean Monahan. Did you say Monahan?
No, Heather Linehan. We will circle
Sorry.
back. No
Similar.
problem.
Thank you.
Amy McPherson,
Yep, I'm here. Can you hear me?
please go ahead.
Hi, thank you. I am here today speaking to oppose H2554, S1557, and S1618, and also in support of H2541. With the introductions of these bills in 2025, Massachusetts is going in the complete opposite direction of the rest of the country. These bills I show opposition to directly affect my family, and it will force my 2 children to be homeschooled or potentially relocate out of Mass. My 2 boys are thriving and love social interaction. These have so many friends, and these bills threaten their normal life. I'm a tax-paying homeowner born and raised in the Commonwealth, and my religious values will not waver if these pass. It will just force our lives to be different. And it will cause an enormous stress on our home and be forever life-changing. We are constantly told day after day to love people, respect all people's views, my body, my choice, but these bills are the exact opposite of that. They are completely saying different messages. Our legislators who wrote these bills love only certain people, respect only certain people's views, and my body, my choice is only related to certain situations. These bills are completely out of touch of the public's views. This is the 4th time I have had to fight these bills, and the public has already spoken, and shame on the legislators for continuing to bring these bills back, protecting their own personal interests, continuing to introduce these bills, forcing us to show up every couple years to speak against these bills, causing an immense stress on the families that it's impacting. Our legislators scream loud and clear to follow the experts and use the aggressive terms anti-vaxxers, but they have no idea the hundreds and thousands of studies that each of us have gone through, reading through every ingredient of every vaccine, and we definitely don't take this lightly. They have not done that. Even the medical professionals invited have minimal knowledge on the vaccine ingredients, adverse events, but reap the yearly bonuses from the pharmaceutical companies provided for fully vaccinated children. I am a mother whose whole world is my 2 strong, healthy boys. I am not what the legislators say or far right label as an anti-vaxxer. On the contrary, I have done my research and fight tirelessly to make sure that I'm always doing what's best for them so that they're living happy, healthy lives. They are always first in my mind. The countless days and nights I've researched every vaccine, every ingredient, and I'm strong in my beliefs, and I know I'm doing what's best for them. The bill changing parental consent is so alarming, I would need days to literally fight it. I am their mother and I protect them from harm. The government taking it into their own hands to hide the medical information from parents that can directly harm them should not even be considered. Mass does not have a vaccination issue, and we in fact have the highest vaccination rate in the country. To top that,
Thank
our
you.
religious exemption. Thank you. Please vote no for those bills.
Thank you for your testimony. Any questions from the committee? Mary Miller? Mary Miller? Caroline Williams? Caroline Williams? Elizabeth Held? Elizabeth Held?
I'm here.
Please go ahead.
I'm here. Okay, thank you so much. Good afternoon, and thank you so much for the opportunity to oppose bills S1618, S1557, and H2554, and support bill H2541. I'm a mother of 4, and I've lived in Massachusetts for 20 years. I have a master's in nutritional biochemistry, and I am very intentional and thoughtful about everything we put in our bodies. For what feels like my lifetime, all I've ever heard about vaccines is that they are safe and effective. Safe and effective. This morning I heard extremely safe and effective over and over and over again. Do you ever stop and think, what does safe actually mean? And what does effective actually mean? And how is it possible that one product is safe and effective for everyone? Vaccines, just like many other pharmaceutical products, are not one size fits all. But because of the massive amounts of financial influence from big pharma filtered through doctors, the media, and politicians, citizens who have questions or concerns about the safe and effective label can't even really ask them. Those that seek to have a conversation about their child and a particular vaccine can be kicked out of pediatrician offices, gaslit, and here we are with these bills. The threat to take away such an absolute, fundamental, and constitutional right to an education. What these bills are actually doing is grasping at straws to try to control vaccine uptake in Massachusetts. But in reality, it's not possible. Kicking kids out of school who use an exemption accomplishes nothing other than making families feel punished. These unvaccinated or partially vaccinated kids are still interacting in community centers, libraries, birthday parties, and sports arenas. There is really no way to control their vaccination status in the way in which these bills seek to. Only about 1% of kindergartners used a religious exemption in 23-24, which was less than 10 years prior. Why is such a small number of families being targeted? In closing, I deeply care about the health of not only my kids, but also all the kids in Massachusetts. That said, I know I only have control over my children, and I in no way ever look to seek control over how other parents take care of their children. It's not my place. I firmly believe in my body and my choice when it comes to all medical decisions. I can sense that those supporting these bills, albeit through a different lens, are also not trying to inflict harm on kids in the state. But we are two very opposed sides. How can we find a compromise? The good news is that it already exists. Exclusion protocols already exist for students with exemptions during outbreaks to prevent further spread of illness. The problem is solved and these bills are unnecessary. Thank you so much for your time.
Thank you for your testimony. Any questions? Kelly Travis? Kelly Travis? Jamie DeCesar? I might be getting that wrong. Dicesare? Jamie? Kim Richards. Welcome.
Kelly Travis is here.
Thanks, Kelly. We will circle back.
Thank you.
Thank you to the committee chairs and all members for this opportunity to speak today. I'm here to speak against Bills H2554, S1557, and S1618, and in support of H2541. My name is Kim Richards. I'm a resident of Newbury, and I'm here today as a concerned parent. At the age of 5, my son had a reaction to the DTaP vaccine. He began ticking. He squinted his eyes, which must have been a million times a day. Simultaneously, he thrusted his tongue over his teeth. As many times as he squinted his eyes, his tongue bled for days. Blood would come out from his mouth, and my little kindergartner would wipe it on his sleeve. We took him to our pediatrician, who could not help us. We visited several Boston hospitals and left each time without answers. During this difficult time, I turned to my religion and prayed for our son's health to return. He was a vibrant little guy. He was full of spunk and enjoyed the arts, Dr. Seuss, and all things Jim Henson. It was devastating. We prayed each day in the hope he would fully recover. My religion dictates that we protect our children. This has been ingrained in me by my mother, who is a religious educator and author. This is a sincere religious belief. This sentiment is to my core, to watch over him, to guide him, and to make the best decisions for him medically. After the reaction he had, we cannot take the risk of it happening again. Religious beliefs are not limited to official doctrines of organized religions. Governments are not free to reject religious beliefs. We would not comply with a vaccine mandate. We would have to leave the state. It would create several hardships for our family. My son is now a happy high schooler. He's on an IEP, and he's thriving where he is. It would be beyond disruptive for him. You would strip him of his right to an education. We all know the numerous negative effects children suffer during COVID from a lack of education and socialization. It would profoundly stunt his growth. My mom lives with us. She is elderly and barely mobile. We have set up a handicapped accessible space in our home for her. If we had to duplicate this elsewhere, it would be financially impossible for us. She cannot walk and rarely leaves the house, so moving her out of state is overwhelming at best. I'm an employer. My partner and I own an engineering firm. We have contributed to the state for decades. We are proud of the contributions our firm has made here in the Commonwealth. However, should this pass, we would relocate the business and move our employees out of state. Unfortunately, the issues of vaccine has become political. As a lifelong Democrat, I don't understand why politics is playing a part in the health of our children. Is it the plan not only to ban children from schools, but also restaurants, activities, movie theaters, etc., where their right to an education be taken away along with their right to roller skate, rock climb, and take an art class? Is this what we want to put upon our children and families here? Thank you very much for the opportunity.
Thank you. Kelly Travis.
Hi. Good morning, chairpersons and members. Hi there. Thank you for letting me talk. Good morning, chairpersons and members of the committee. My name is Kelly Travis, and I'm a lifelong Massachusetts resident, a healthcare worker, and most importantly, a mother of 2 beautiful children, still in elementary school. I'm here today not as a politician or lobbyist, but as an educated healthcare worker with a master's in health science and a spiritual mother who is heartbroken and angry at our legislation for another year. I want to begin by stating my support for House Bills H2541, 2376, and 2384, as these bills build upon personal protections and freedoms for citizens of Massachusetts. I am opposing Senate Bills S1557 and 1618 and their associated House bills. Both of these bills undermine parental rights, families' sincere beliefs, and are using access to education as a weapon to force medical compliance. But these few families that follow their beliefs and respect the current law are not going to waver in their actions. The proposed changes in law won't change the health status of this small 1% of children. It only stigmatizes a few. It isolates children from their peers and denies them federal services. It teaches a small group of children that they are different and they don't belong, and they don't deserve equity and equality. If passed, these bills show our citizens that there are a few who could cherry pick who we get to protect for equity and equality. These same citizens get on their loudspeakers to protect other groups of Massachusetts citizens. Why? Why are protections for some populations more important to you than others? This is not how a just society treats its children. Massachusetts was founded from the desire for religious freedom. Education should not be used as a weapon to target a small religious group. Removing 1% of children, about 2,000 children, from the data for the 24-25 school year doesn't solve the real problem, which is the non-compliant GAP population, which was recorded to be 16,000 children this school year. If either of these bills pass, my children, who are happy, healthy, and thriving, will be banned from attending school or other child-focused activities. But they aren't sick, they are not a threat to others, and we have current exclusionary policies in place to protect unvaccinated and vaccinated children if there is a potential outbreak. This is the path of least restrictive actions that our government has committed to follow. And these bills don't remove these kids from society. They will be everywhere still. Sporting events, airports, theaters. These few children will still be in our society, but barred from an educational system that is their constitutional right. I urge you to vote no. Protect public health, yes, but do this by increasing healthcare outreach to the GAP population. Continue to protect all children in schools by following our current exclusion protocols, and follow the least restrictive path by leaving access to education to 1% of children. Thank you.
Thank you. Brianne Walsh. Brianne Walsh.
Thank you, members of the Public Health Committee. My name is Brianne Walsh, mother of 2 young, healthy boys. I am testifying today in opposition of H2554 and S1618. This is my 4th time testifying against these bills that have been met with enormous opposition year after year, and yet we are still left here to fight. I want to begin by reminding you again that under the 1986 Vaccine Act, vaccine manufacturers are granted full immunity from liability. If they are so safe and effective, why are they protected from liability? Despite repeated testimony, this critical fact seems to be ignored. If a child is injured or dies from a vaccine, families are left with no recourse, only grief, medical bills, and a lifetime of consequences. Now our children's education is being threatened if we do not make that choice. This bill is essentially saying a child's right to an education is conditional. It's not a right, but a privilege. For years, we've shared facts, studies, heartbreaking personal stories. Children have lost their ability to speak, walk, and die just a few hours after a shot. Yet year after year, these bills return. We are not asking for you to agree with us, but we are asking for your respect. These exemptions have existed for decades with proper exclusion protocols without an issue. This bill is looking to solve a problem that we do not have. 1% of Massachusetts students utilize the religious exemption, and we remain the highest vaccinated state in the nation. So what is this bill really intending to do? Still, we are forced to sit here and justify our beliefs. We are told we aren't valid, that we should follow certain religious leaders over our own convictions. Massachusetts prides itself on inclusion and respecting diversity, but this bill undermines that ideal. Would you ask someone to sit here and justify their gender, sexual orientation, or culture the way you're asking us to defend our faith? The authors of this say this is about safety, but what does this really do besides discriminate a small group of family based on beliefs that you may not share? These children are still part of the community at the parks, sports teams, and birthday parties. They will be forced to homeschool or move out of state. This bill doesn't remove them from society. It just tells them they are not worthy of an education in this state. Please oppose these bills.
Thank you. Allison Fitzgerald. Allison Fitzgerald.
Hello, my name is Allison Fitzgerald, and I oppose bills H2554,
S1557, and S1618. As a sixth-generation business owner here in Massachusetts, a mother of two, a woman of faith, and a member of the LGBT community, I am deeply concerned about these proposed bills that would directly harm my family and children. These laws force me to consider either homeschooling my children or leaving the state entirely. Both options would devastate my employees and disrupt our 80-acre farm here in Massachusetts, a legacy dating back to the 1800s. Our farm provides fresh year-round produce to the local community and employs over 40 people. In 2023, I returned to the Catholic Church, where my wife, children, and I were warmly embraced, defying my lifelong fear of rejection due to my identity. Yet now, it is my own state, once a pioneer in progressive values, the first to legalize same-sex marriage, that makes me feel unwelcome because of my faith and relationship with Jesus. Why should my family, my business, and my community suffer? These bills would harm my children most of all by denying them the education they rightfully deserve. Further, these laws contradict the inclusive joint guidance from our governor, lieutenant governor, attorney general, and the Executive Office of Education, which they recently stated in a press release dated 2/26/25. We believe that bringing people of different backgrounds and perspectives to the table, including women, people of color, and the LGBTQ+ community, is a strength, especially in education. Do religious students not deserve the same inclusion? I believe they do. Thank you.
Thank you. Jesse Flynn. Jesse Flynn. Jennifer Entwistle. Oh, she's here. Okay. Oh, sorry. That's fine.
My name's Grace. I'm 9 years old. I don't go to school like most kids. I'm homeschooled. But I'm not hidden away. I'm very active in my community. I go to Greek school, perform in ballets and musicals, and go to concerts, attend many community events. I have a lot of friends just like me. And some of them do go to school. I'm healthy. I mean, really healthy. I almost never get sick. My mom's friends always joke and call me the bionic kid. We eat healthy foods and exercise. I've learned that real health doesn't come from shots and medicines. Real health comes from the choices you make every day. My family has been fighting for 7 years to keep our right to choose. Not just for me, but for every family who believes with faith and freedom matter. My mom was hurt by a drug that was supposed to help her. It changed her entire life. I watched her struggle every day. If I'm allergic to an ingredient in the shots, do you even care? This is why we're careful about everything we put into and on our bodies. That's why we say no to a lot of things. Most people don't even question. Our choices has been to homeschool, but it shouldn't be something forcing on us people want to take away our religious exemptions and say that kids like me don't belong in school. They say we can't go to school unless we ignore our faith and follow rules we don't agree with. That hurts because I do belong, just like any other kid. Isn't that what schools keep trying to teach us? That we can't discriminate everyone for their personal beliefs? I'm not here today. I'm here today because I'm scared. Not of getting sick, but of losing something really important. Don't shut the door on kids like me. I don't take away our choices. I'm not dangerous. I'm not a threat.
Can I go?
Yeah, 2 minutes.
2 minutes.
Yeah.
I just want to simply say that this is my 4th time here. I've been fighting this since my daughter was 2 years old, and now she's old enough to speak up for herself. All I want to do is read to you some of the laws of Massachusetts. In Part 1, Title 12, Chapter 76, Section 5, every person shall have a right to attend the public school of the town where he actually resides, subject to the following section. No person shall be excluded from or discriminated against in admission to a public school of any town or in obtaining the advantages, privileges, courses of study, or such public school on account of race, color, sex, gender identity, religion, national origin, or sexual orientation. Senator Rush was right. It's literally in the Massachusetts Constitution and the general laws. The Articles of Amendment, Article 46, Section 1. No law shall be passed prohibiting the free exercise of religion. And in Article 2, and no subject shall be hurt, molested, or restrained in his person, liberty, or estate for worshiping God in the manner and season most agreeable to those doctrines of his own conscience or for his religious profession or sentiments, provided he does not disturb the public peace or obstruct others in the religious worship. Senator Rush is right. All the laws in Massachusetts are protecting our exercise of religion, and it specifically says our own conscience and our own faith to do what's best for our children. This should not be taken away. She sat there and said that you guys were going to listen to us all testify lies, but these parents are sitting there telling you how these children have been hurt and killed, and she looks at us and calls us liars. I just find that reprehensible, and she doesn't even sit in this meeting anymore and listen to what we have to say because she does not care. I'm happy to see a full panel today of people who are here to actually listen to us.
Thank you. Rokia Panone. Rokia Panone. Payon. Sorry if I got that wrong.
My name is Rokia Paoni. I'm here on behalf of my husband, Mark, and my 2 children, Max and Maddie. I'm here in opposition of 1557, 2554, 1618, which would remove the religious exemption currently allowed in our state. These bills would directly impact our family's ability to practice our Catholic faith while remaining active and engaged members of our local school and community. As a Catholic, I take my beliefs seriously. Just recently, I had attended a Mass where the sermon was based on John 21:119. The Gospel tells the story of how disciples, after casting their nets and catching nothing, followed Jesus' guidance and drew in 153 fish. The priest emphasized how that number, 153, represents all of humanity, reflecting unity, inclusion, and the idea that no one is left out. This message deeply resonated with me, especially as I reflect on the implications of these proposed bills. Eliminating the religious exemption would, in effect, do the opposite of what that gospel message teaches. It would divide rather than unite. It would separate children and families like mine based on sincerely held religious beliefs. It would teach our children that segregation and exclusion are acceptable when someone thinks or believes differently. If passed, these laws would deny my children access to a well-rounded education, not just in academics, but also in social development, extracurricular activities, and cherished life experiences like prom, school plays, and team sports. In essence, we would be punished for our faith. I believe this is not only morally wrong, but also constitutionally questionable. My children are thriving in school. My son Max loves math and is highly competitive. His favorite program is ST Math, which encourages progressive, challenging puzzles. He's proud to be leading his class toward the year-end goal of reaching 100%. My daughter Maddie is a first grader. She struggled with reading this year, and her teacher has recognized this, stayed after school weekly to help her, and I'm proud to say that she has reached the benchmark just last week. These are the kinds of moments that can't be recreated in a homeschool setting. These are opportunities that my children will lose if forced to withdraw from school and do the elimination due to the removal of the religious exemption. Because let me be clear, we will not comply and vaccinate just due to this bill. So it will force us to remove the children from our school. Thank you for your time.
Thank you. Rep. Vargas. Welcome.
Thank you, Chair Driscoll and Chair Decker, and members of the committee for sitting through this hearing today, and in particular to the members that are staying throughout this entire hearing, and the chairs, of course. Thank you. I remember being a member of this committee and how long this hearing can be, and to listen to the testimony. I know a lot of folks, as the previous panels articulated, appreciate it, and so just appreciate your presence as public servants. I'm going to be brief today because you're going to hear from, as you have already, from experts and testimony from residents and individuals. But I will just share a couple of things that I hope are relevant for the record and help this committee with its work. I'll open up with a quote, actually. Quote, "The most effective way to prevent the spread of measles is the MMR vaccine," end quote. RFK Jr. Another quote, "I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those vaccines." RFK Jr. This is an issue that unfortunately has been polarized beyond belief and has reached a point that lives are at risk. And this committee has shown great leadership over multiple sessions in reporting the religious exemption bill out of committee favorably, H2554, an act relative to routine childhood immunizations. Last year in 2024, there were 285 cases nationwide on measles. This year in 2025, as you know, we're just about halfway through the year, there are 1,080 cases. 1,080, and we're halfway through the year. This was a disease that was once considered eradicated and is now returning, and it's clear that the decrease in childhood vaccinations plays a role. The majority of the cases seen this year have happened to unimmunized people, and this alarming trend underscores the urgent need for Massachusetts to reinforce and strengthen its immunization policies. And as misinformation about vaccines becomes more prevalent at the national level, it is critical that state leaders take decisive action to protect public health and prevent the resurgence of preventable diseases. This bill would remove the non-medical exemptions that currently exist for childhood immunization requirements in public schools, meaning if a parent wants to send their kid to a public school in Massachusetts, their child must receive all required vaccinations unless they have a medical exemption. And to be clear, this bill would not require the COVID vaccine, as it is not on the list of required vaccinations for schools. The bill would also improve immunization data collected by DPH. And as I said, you're going to hear, and you have heard from many experts today, but I will share that I have sat with parents who have used the religious exemption and can say that the majority are good-hearted people who just want what's best for their kids. They have sincere fears, and their experiences are often dismissed, and I can be guilty of that myself. And unfortunately, figuring out what's best for your kids is an increasingly difficult thing in the era of pseudoscience, digital misinformation campaigns, and people who profit from an anti-vax movement. I sympathize with the fears that these parents have, many of which have been aggravated and taken advantage of by online movements. And it is our duty as legislators, however, to make decisions that reflect the expertise, data, and scientific consensus. And the science is clear that vaccinations save lives, that herd immunity is essential to the control of disease, and that individuals who cannot be vaccinated for medical reasons are left vulnerable when herd immunity is not reached. The efficacy and safety of these vaccines on the schedule is settled. Evidence from other states also shows us that removing the religious exemption increases vaccination rates without impacting school attendance. You'll see that across multiple states. Despite religious exemptions being so high, no major religion in the world objects to the use of vaccinations, as vaccinations were created long after the establishment of all major religions. As a Catholic myself, even the Vatican and the National Catholic Bioethics Center says that Catholics are, quote, morally free to use the vaccine despite its historical association with abortion, end quote, and that Catholics have a moral obligation to protect the life and health of their children and those around them. If a person's actions put others in harm's way, our laws do not allow the citing of religion to abdicate that person of responsibility. But our religious exemption law, as it stands now, allows exactly this. We know that vaccinations are needed not only to protect oneself, but to protect those around us from the spread of deadly disease. You've also heard about constitutionality in those claims. There are several cases that I'll include in my testimony, from Jacobson versus Massachusetts, Prince versus Massachusetts, Phillips versus City of New York, Brown versus Smith. This has been settled in the courts as well around the constitutionality. The state of Maine removed the religious exemption. The state of New York removed the religious exemption. The state of Connecticut removed the religious exemption. California, West Virginia removed religious exemptions. And West Virginia recently survived an attempt to roll that back. This legislation was filed in 2019 after multiple constituents reached out to my office during the resurgence of measles. Back then, I didn't have kids yet. Today, I have a 3-year-old and a 1-year-old. And so I empathize even more with the parents that are here in this room. And my son has received the vaccine and, yes, had a fever when he got home. It can be scary. It can. But we as legislators have to make decisions that are in the public interest and not wait until an outbreak occurs for us to act. And it is my hope that we can be proactive and not wait until preventable disease and outbreak occurs in this state. Every child deserves to be safe at school. The science is settled, the courts have ruled in favor, and it is rare for scientists, doctors, clergy, and the courts, a majority, to all stand together on an issue, but this issue they have. And it's time for us to stand with courage for the health and safety of our kids in the Commonwealth. And I want to thank this committee for your diligence.
Thank you. Any questions?
Thank you so much, Rep. Vargas. I'm just curious, if this bill were to pass, would DPH be allowed to add more to this schedule, or would what's currently on the schedule be codified and we couldn't go any further from that?
The legislation doesn't touch the schedule at all. It just doesn't touch that issue. It just says this is what the schedule is and these are the requirements.
Does DPH set that, though?
Yes.
So that's my question. If we sit here and say there's no longer a religious exemption or any type of exemption, if DPH just says, hey, listen, we want to start adding all these other ones, because in the limited research I was able to do, we went from 8 to 20 shots. And I kind of struggle to feel like how some of those vaccinations been added, if there's actually like a real reason why some of these vaccinations have been added to the schedule. So I guess one of my concerns is, if we pass this, does that give them free rein basically to add things without people being able to have a voice?
Well, DPH is able to add to the schedule as they'd like right now. All of those decisions, I'm not DPH, so I don't want to speak on their behalf, are always rooted in science and in collecting the best input from folks.
Thank you, Rep.
Thank you.
Kara Sotiropoulos. Sorry if I've got that wrong. Kara Sotiropoulos.
Thank you, chairs and members of the committee. I am the mother of 2 boys, and like any parent, I want to make informed decisions. That's why I think it's so important to look at the actual data from mass.gov, not just the headlines or talking points, but what the numbers really show. I oppose the Community Immunity Act and oppose removing the religious exemption. Disease prevention is a laudable public health goal. Removing the religious exemption, however, won't actually increase our nation-leading school vaccination rates by any material amount, but it will increase distrust in public health institutions and public resentment. This is because religious exemption rates are already so low, around 1%, that removing the religious exemption would only marginally, at best, increase vaccination rates. Moreover, there is a much, much larger group of under-vaccinated children in the state that would be unaffected by these proposed measures. DPH refers to them as the non-compliant children. Non-compliant children are those who do not have all the required immunizations and no religious or medical exemption. This chart presents publicly available data taken from the DPH website and shows that the non-compliant population is 7 times greater than the number of students with religious exemptions. The chart here shows the public kindergartens with the highest rates of non-compliance. The most disadvantaged children in our communities could be excluded from school under the Act. According to DPH data, the schools with the lowest immunization rates can attribute these low rates to almost entirely non-compliant students, not students with religious exemptions. This table shows schools with the lowest vaccination rates in the state. The number of students with exemptions, religious or medical, at these schools is 7. The number of non-compliant students is 300. Targeting families with religious objections to vaccination while ignoring the much larger non-compliant population suggests institutional hostility toward religious families. I feel that hostility, members. Unnecessary, coercive, and discriminatory measures will only increase generalized distrust in public health institutions, risking backlash in the form of increased vaccine hesitancy with the population at large. So I have to ask, why are you targeting us? Why are you targeting us? I've been fighting this for 7 years. This is my son. This is Ethan. He's 10 years old. I've been fighting this since he was 3. His brother Ryan is 7. He doesn't know me, not in this fight. Why are you doing this to us? We're not the problem.
Thank you. Alex Flett. Alex Flett.
Thank you, legislators, for hearing our testimonies today. In honor of Pride Month, I'd like to express how proud I am of everyone who showed up in any capacity, to be seen, to be heard, and to be loved for who they are. God is love, and today I pray you see the faces of your community, feel the anger and hurt of families fighting for their rights, and that you show love for the children these proposed bills would impact. I urge legislators to validate and respect the private, medical, and religious rights of your citizens. Step away from bills promoting exclusion and bullying, and instead create a movement of acceptance. Uphold equal educational opportunity and support the protection of our rights before more legal action is required. I formally document my opposition to bills H2554, S1557, and S1618. I support and ask for co-sponsorship of proposals from Soter H2541 and Boldiga H2376. I respectfully ask that Roush, Vargas, and Kennedy move on to other pertinent issues in our state. My name is Alex Flett. I am a registered nurse and DESE certified school nurse going into my 7th year of school nursing in the Commonwealth. I have worked in public and private schools, managed religious and medical exemptions, completed annual immunization reporting to MIIS, led homeschool cooperatives, cared for children with chickenpox, and testified now 4 times on what seems to be the same bills continuously proposed. From my personal experience, the systems we have in Massachusetts regarding exemptions to vaccines are working to great effect. As a school nurse, I renew any exemptions annually. I identify the children who need notice of communicable disease. I have the public health contacts and exclusion protocols as needed, and I review the posted immunization rates of each school in the state. I do not support removing our students with exemptions from the school setting. I do not support harassment and coercion of my patients, nor do I support disclosure of private medical information to the state. June 2012, DESE, Mass General Law, Chapter 76, 603 CMR 26, Access to Equal Educational Opportunity is promulgated to ensure that the public schools of the Commonwealth do not discriminate against students on the basis of race, color, sex, gender identity, religion, national origin, or sexual orientation, and that all students have equal rights of access and equal enjoyment of the opportunities. 603 CMR 26 shall be liberally construed for these purposes. March 2017, the Lowell School Committee is committed to upholding the U.S. Department of Justice and U.S. Department of Education's basic tenet of Plyler versus Doe, that all children in the United States are entitled to equal access to a basic public elementary and secondary education. And the Lowell School Committee further affirms that it must comply with FERPA, a federal law that requires schools to respect every student's right to confidentiality and privacy, and prevents schools from sharing personally identifiable student information. June 2023, Governor Maura Healey, we are a state that prizes equality, protects freedoms, protects civil rights. April 2025, Mayor Wu, I refuse to accept that my kids and all our kids could grow up in a world where threats and intimidations are the tactics used. Hands off. June 2025, Boston Celtics. This month and always, we encourage you to join us as we champion ongoing advocacy efforts and create safe and inclusive spaces for everyone. See humanity, love one another, make us all proud to be from Massachusetts. Thank you.
Thank you. Any questions, committee? Thank you. Ann McGuire? Ann McGuire?
Hello, can you hear me?
Yes, go ahead.
I'm sorry, my name is Caroline Williams. I was called earlier, but I was unable to unmute on Teams, so I had to join by phone. So I'm just letting you know that I'm here.
Thank you. We will circle back.
Hello? Hi.
Hi.
Hi. Yeah, my name is Rebecca. I signed up for the live person testimony, but I couldn't come, so I emailed very early this morning, but I have not received any confirmation which I can switch to the virtual testimony. So I just wondering, yeah, if there's a chance I can continue for the change to the testimony online.
Thank you, Rebecca. We have you on the list now, so we'll circle back.
Thank you. Thank you so much. Appreciate it.
Please go ahead, Ann.
Thank you. Thank you, members of the Joint Committee on Public Health. Please oppose Bills S1557 and H2554, both of which remove our current public school religious exemption. Please also oppose Bill S1618, which undermines our current religious exemption. In the case of the first two bills, both got current religious exemption language in paragraph 3 of our Massachusetts school attendance law, and they replace it with an aggressive agenda of yearly data collection on all Massachusetts students based upon their vaccine status. This gutting not only removes the exemption's protection of sincere religious beliefs, its vaccine collection drive elevates vaccine compliance to a statewide religion, evangelizing the number of yearly vaccine converts through shaming, coercive public postings. Since no Massachusetts law shall be passed prohibiting the free exercise of religion, both bills are unconstitutional overreach. And Bill S1618 engages in language deception. By reversing the word order of our current religious exemption, it reverses what right is actually being protected and affirmed. Article 2 of our 1780 Declaration of Rights states, no subject shall be restrained in liberty for worshiping based upon the dictates of his own conscience. Current Massachusetts exemption law aligns with that ethic by protecting our sincere religious beliefs. Current law reads, no parent or guardian who states in writing that vaccination or immunization conflicts with his or her sincere religious beliefs shall be required to present a physician's certificate for admission to school. But S1618 reverses that wording. Suddenly, the exempting participant or adult has a sincere religious belief conflicting with immunizations. To be clear, vaccines and biologics are for-profit market technologies. They are not human rights deserving of constitutional protection. Sincere religious beliefs or dictates of conscience already hold pre-established, constitutionally protected, highest sovereign ground for both adults and children. any bill syntax that reverses this order to elevate a technology at the expense of a human right is deceptive, revisionist doublethink, and unconstitutional. I encourage you to oppose these 3 bills that either completely gut or undermine the religious exemption for Massachusetts school children. Please let parents and children know that their Massachusetts legislators continue to honor the separation of church and state, long enshrined in our 1780 Constitution, that protects individual religious rights from aggressive overreach by any vaccine industry orthodoxy. Thank you.
Thank you. Kevin Habicht. Kevin Habicht.
Hello.
Welcome.
Oh, timer's going, good. One thing working as in the field of engineering I've learned is that it's never the person, it's always the process. The process is what's flawed. In any system, there's an issue. There's a reason why I don't get electrocuted when I plug things into the wall. Oh, sorry. How about now? I believe in my heart that people want to do good for others. However, that's the difference between a living man or woman and a dead entity. One has a soul and the other has a sole purpose to make money for their shareholders. Can anyone in this room tell me the last time a corporation did anything truly altruistic for society? Anyone? Nope. Why are we allowing corporations to dictate and influence our local health policy? Through the industry-wide use of contract clauses such as NDAs and/or a right of first refusal, among others, which prevent the disclosure of adverse information, like the no studies exist narrative. You want the research grant or not? Sign here. Applying this logic, heard in other testimonies already, in the case of childhood vaccines, considering that every shot recommended is currently produced by a publicly traded company or corporation and is currently under patent protection, and all of them have zero liability, what's the incentive to or for providing the safest option available? Do vaccines work in concept? Sure, I believe they do, if they've been tested for that. But isn't there a conflict of interest when the same industry who manufactures the solutions to also to any problems which may occur? Aluminum-based adjuvants are also in every single vaccination on the schedule. I was injured as a child as well, and that's why I have to walk around with this every single day, and it requires active monitoring. It's time out of my life. I am scared that my children may go through the same thing. More specifically, I think it was related to a Hib injection, but I don't know. There's nothing causal found there. After 80-plus years of aluminum's use, there should be dozens of safer alternatives that could be used to achieve similar efficacy. And I think, based on my research, silica-based adjuvants look much more promising. The cost and utility are the primary factors in adjuvant selection. Utility meaning how well will that adjuvant work for a long-term immune response. So, when a publicly traded company sole purpose is to make money, why do we trust these same companies with what's our best interest and the interest of our children?
Thank you. Thank you for your testimony.
Yeah, thank you for your
Caitlin Calonge. Caitlin Calonge. Churston Williams. Oh, Caitlin's here. Welcome.
Sorry, eating something. Good afternoon, members of the Public Health Committee. I'm here today to oppose the Community Immunity Bill and the removal of religious exemptions, and to support Representative Soder's bill H2541. Senator Kelly Doon, I want to thank you earlier for the question about religious affiliation and church attendance, because I'm going to talk about that. This is the fourth time I've come to the State House to speak against these bills, and what I've noticed year after year is that the author of H2554 believes it's necessary to remove religious exemptions because he believes that the spirit of the law is being violated. He's presented vague and misleading numbers to support the idea that while the use of religious exemptions have increased over the years, that religious affiliation has supposedly gone down, therefore proving that exemptions are being abused and used as a loophole. I'd like to ask everyone on the committee to please present the law that states you must attend weekly church or a place of worship in order to be religious or have a relationship with God. I don't believe that God can only be found in a church, because I find him in my home, in the beautiful community of people that support me, and my family, and in my children. My strong faith is what allows me to be here today and to keep coming back year after year to fight for my children's education and their rights as a human being to be treated fairly and equally. My relationship with God is what makes me believe that we can change the hearts and minds of everyone on this committee to see that our children are worthy of the same rights as everyone else. Everyone's relationship with God is different, and there's no right or wrong way to practice it. And frankly, I resent that I have to sit up here today and defend it. If these bills pass, the authors and supporters of them will be able to say that they achieved their goal of increasing vaccine compliance among students. However, it will be a false win. The compliance numbers will increase to 100% because he will have kicked the non-compliant out of school. But our children aren't going to just disappear. They'll still be out in the community. You may be able to bully a small percentage into betraying their beliefs, but I can promise you that the majority of us will not comply. Just like in California, Connecticut, New York, and Maine, families will move. They will find a state that respects their religious freedoms, and they will go there. What you will succeed at is tearing families apart, children from their friends, their cousins, grandparents, and the communities that they're deeply rooted in. Not to mention any children with special needs that have developed deep relationships with therapists, OTs, PTs, speech therapists, and special needs teachers. While West Virginia just reinstated their religious exemptions, Maine has introduced a bill to restore their religious exemptions, and Connecticut has been undergoing costly litigations and efforts to reinstate their exemptions. While it seems that more states are moving towards reinstating and protecting religious freedoms, Massachusetts, a state which is usually a leader in uplifting minority groups, is taking unnecessary steps backwards. Lastly, the group Massachusetts Families for Vaccines, who's here today to support these bills, states on their website that the proposed bills uphold the rights of parents to choose whether their children will be vaccinated. Let me be clear that threatening families with the removal of their children's education is not a choice, and there should be no place for coercion in a free state. Thank you.
Thank you. Lenin Prado. Lenin Prado.
Yes, I'm here. Can you hear me?
Please go ahead.
Thank you. Good afternoon, Mr. Chair, Madam Chair, and all the members of the Joint Committee on Public Health. I'm here to testify in opposition to bills S1557, H2554, and S1618. There are three distinct accounts in the Gospels of the New Testament, Matthew, Mark, and Luke, where children attempt to approach Jesus only to be rebuked by the disciples. Their actions reveal an instinct to control access to Jesus, to decide who's worthy of his presence and attention. But Jesus responds differently. In Mark's gospel, he becomes indignant at the disciples' response and offers a profound correction. He says, "Let the children come to me, do not hinder them, for to such belong the kingdom of God." This passage is more than a story. It is a cornerstone of my faith and my family's faith. It reflects a broader message of love, inclusion, and justice that runs throughout the teachings of Jesus. He welcomed those whom society often shunned, the poor, the sick, women, and children. His ministry was a bold declaration that no one should be excluded or marginalized. These are the values I teach my children, that every person, regardless of their background, is inherently worthy of kindness, compassion, and most importantly, love. You see, love is what binds us together as human beings. It is the moral fabric that holds up our communities. At school or on the playground, my children aren't defined by their vaccination status. Their teachers and friends see them for who they are: compassionate, inclusive, and kind-hearted. They embody the very principles that Massachusetts claims to hold dear: equity, respect, and inclusion. But if these bills pass, those same values will not be extended to them. Massachusetts has long prided itself on being a beacon of tolerance and refuge, a place where diversity of thought, belief, and identity is not just protected, but celebrated. Removing the religious exemption undermines that identity. It sends the message that our state's commitment to inclusion has its limits, that it is conditional. And so I urge you to consider what this bill truly communicates. Are the values of justice, equity, and inclusion only for those who comply with certain mandates? Or are they, as I believe that they should be, universal and unconditional? Now, I appreciate Representative Vargas's acknowledgement that these conversations are emotional and can at times become highly charged because families' concerns for their children are at stake. In Representative Vargas's testimony, he referenced the Catholic Church's support for vaccination. Now, while it is true that the church may encourage vaccination, it is equally true that it does not mandate it. Catholic teaching emphasizes the primacy of individual conscience, particularly when moral or ethical concerns are at stake. In fact, the church also opposes abortion. It is a core doctrinal belief. Yet I wonder if Representative Vargas would also seek to impose that doctrinal stance on a woman's right to choose. You see, this inconsistency highlights the danger of selectively invoking religious principles only when they align with a particular policy goal. True religious freedom must include the right to dissent, to exercise conscience, and to make deeply personal decisions without fear of exclusion or penalty. Let us not turn away children who come in faith, love, and peace. Let us not become the modern-day disciples who forget the lesson Jesus so clearly taught. Instead, let us choose inclusion, not just in word, but in law. Thank you.
Thank you. Sabrina Santiago. Sabrina Santiago. Stacy Boris. Stacy Boris. Jessica McGovern.
I'm here.
Please go ahead.
Hi, my name is Jessica McGovern, and I reside in Manchester by the Sea, Massachusetts. I support Bill H2541. I oppose Bills S1557, S1618, S1244, and H2554. Religious exemptions are not being abused in Massachusetts. They are being used. 2 Massachusetts court cases and 2 Supreme Court cases have protected our religious rights. One ruling stated, governments are not free to reject beliefs because they consider them incomprehensible. You are wasting taxpayers' money and precious time with these bills. Unfortunately, in Massachusetts, the state has become the least Christian in the United States, and Boston has become a science mind, not a heart and soul mind. The new religion is science, and this new religion of science is false and corrupt. Many parents have now read that science and become educated and informed. We are not fearful. We are being religiously persecuted for using our religious exemptions. The statue in the front lawn of the State House where you are is Mary Dyer, who was hanged for her religious beliefs. It feels like we are in the year 1660 again. Instead of persecuting us, the state must provide equitable access to education for all children. The hypocrisy from the bills are rich. They want to protect children using herd immunity, yet the vaccines shed on anyone, as it states in the chickenpox vaccine insert, as you see behind me, due to the concern for transmission of vaccine virus, vaccine recipients should attempt to avoid whenever possible association with susceptible high-risk individuals, immunocompromised, pregnant women and babies for up to 6 weeks following vaccination. Why are children who take this vaccine allowed right back in school? It clearly states they shed it to others for 6 weeks. Chickenpox vaccine also contains human female and male baby cells, also guinea pig cells and baby cow cells. This is not what my God considers healing, and this is what my science considers barbaric. And it states right here behind me on the vaccine insert anyone can get from their doctor. This last winter, the CDC recommended 6 vaccines for adults: COVID, flu, RSV, pneumonia, shingles, and MMR. Did you take all 6 vaccines? Did you take your 10th COVID vaccine this last fall? Why can't you take 6 at once, just like it's recommended for infants and toddlers? I urge you to meet these children who have not had a vaccine in their lives. They are the most healthy calm, smart, thriving children I have known. I had measles, mumps, chickenpox growing up, and no one in high school, no one in my community died from any of these. We have been taught to be fearful of these, which when you're informed, you become unfearful. So I urge you to become knowledgeable about the vaccine inserts, the VAERS system, and holistic healing regarding all these illnesses that the CDC recommends people take drugs for. Thank you for your time.
Thank you. Jesse Harding. Jesse Harding. Matthew Richer. Oh, Jesse. Welcome.
Sit down. Okay. Can you hear me okay?
Yes.
Okay. My name is Jesse Harding. I'm a father, educator, college professor of religious studies, non-denominational minister who supports Bill H2431 and strongly opposes Bills S1557, H2554, and S1618. Proposals that threaten the core of medical ethics, parental rights, and constitutional freedoms in our Commonwealth. Let's begin with some facts. Massachusetts, as we've heard, has the highest vaccination rates in the country and no significant disease outbreaks in school-aged children. Only 1% of families use a religious exemption, as we've heard, often for just 1 or 2 vaccines. So why are we removing this long-standing protection? These bills would strip away religious exemptions, restrict legitimate medical exemptions, allow minors to consent to vaccination without parental knowledge or cognitive capacity, which is crazy, force families to sign legally binding, ideologically biased waivers just to access school. This isn't public health, it's coercive policy disguised as protection. Since 1986, vaccine makers have been shielded from all liability. Unlike any other industry, they can't be sued for injuries, which I think is crazy. Hepatitis B, given on the first day of life, was tested for just 5 days with only 147 infants, yet we're told that it's safe. Other childhood vaccines like HIV or IPV, safety tested for 3 days. DTaP, 28 days of safety testing. This is crazy. PCV, 13, only 6 months. Pfizer's top-selling drugs, Enbrel, was tested for 6.5 years. Eliquis, about 7.5 years. Lyrica, 2 years. Lipitor, 5 years. The standard for safety testing with pharmaceuticals is years of safety review, but with vaccines, there's no long-term placebo-controlled studies, no studies of the full vaccine schedule exist, and the CDC has refused to fund any or support any large-scale studies comparing fully vaccinated to completely unvaccinated children for outcomes like autism, which now is the highest in California after they've removed their right to religious exemptions, allergies, autoimmune conditions, ADHD, et cetera, et cetera. This is not good science, it's negligence, it's corruption. And if you want to see a really good study, I recommend the control group as a study to look at, which looks at unvaccinated versus vaccinated, and the outcomes are crazy to see. When families are harmed, they're dismissed, they're gaslighted, they're silenced, and as we've heard, parents know exactly what happens to their own children. But instead of being heard, they're labeled as anti-science for seeking answers and telling the truth of their experience. Where there's risk, there must be choice. Please vote no to these dangerous bills and for protecting the Commonwealth. Thank you.
Leanne Keneally. Leanne Keneally. Patrick Dooley. Patrick Dooley. Brianna Tompkins. Welcome.
All right, Brianna Tompkins. Good afternoon. I'm here to oppose the Vargas bill, Kennedy bill, and Roush bill.
My husband's family has been here in Massachusetts since the Pilgrims arrived. His relative was married to Governor Bradford. My family has been here for over 100 years, running a local family business. As you can see, we have deep roots here in Massachusetts. But we would take everything and leave if our rights are stripped away. For 22 years, I was part of the less than 1% of Massachusetts students who used a religious exemption. For the past 7 years, but really 35, my family and I have been advocating for the preservation of religious exemptions so my daughter, son, nephew, and future children can have the same education and life experiences that I did. Early on in her career, on my senator's personal website, she wrote, and I quote, "I want our young people to be able to get the education they want and deserve," end quote. On her own religious persecution, she wrote, and I quote, "People are treated poorly when they are different from the majority or the people in power." These words were written on Senator Rebecca Rausch's personal and political website. And yet, the very bill she created would destroy families whose religious beliefs differ from hers and those of you in power, doing exactly what she pledged to stop. When I pointed this out to her, she removed those statements from her website. Ironic, isn't it? Most members of the committee have children, and with a 2 to 3% vaccination reaction rate, that would mean one of them will react at some point to a vaccine. One of your children or grandchildren may need an exemption at some point in time. Why would you want to set up a future world where your children could be denied an education? Do you seriously believe that your family will never need an exemption? With over 200 new vaccines currently being created, do you honestly believe all of them will fall in line with your religious beliefs? And yes, Representative Vargas would not answer this. DPH has the right to change the schedule at any time, and it doesn't, you would have to just accept it. DPH can add a vaccine to the schedule whenever they choose, and if it goes against your religious beliefs, then what? Vargas's bill would deny a child the right to an education for refusing just one vaccine. A child whose religion guides them towards saving themselves for marriage and avoiding intravenous drugs should not be kicked out of school for declining the hepatitis B vaccine. This is wrong. Please don't treat us poorly because our religious beliefs differ from yours. Please don't create an immediate public health issue by removing healthy children from school. Please don't create a two-tiered society where some are deserving of an education and others left out. Please don't create a world where religious beliefs have to be approved by a government entity. These bills are dangerous and destructive and go against the very foundation our country and state were founded on. Please abide by your oath and do not pass these bills out of committee. I've been here enough times saying the exact same thing. Let's just move on. Thank you.
Thank you. Carrie Montgomery.
Hello, excuse me. Hello, excuse me.
Yes, go ahead.
This is Sabrina Santiago. I couldn't unmute myself, so I was skipped.
Okay, we will circle back soon.
Okay, thank you so much. I appreciate it. Sorry about that.
It's Carrie, right?
Yes.
Thanks. Thank you to the chairs and the members of the committee. My name is Carrie Montgomery, and I live in Attleboro. I'm here to testify against H 2554, S 1557, and S 1618, and support 2541. Not because I'm anti-science or misinformed, but because I'm anti-segregation and anti-discrimination. As the Joint Committee on Public Health, you should know strong public health policy must also respect medical and religious diversity. Not all children can safely follow the same medical path. Forcing them to do so can cause real harm. After my daughter's early set of vaccinations, she suffered a severe reaction that changed our lives. Emergency room nurses said it was a vaccine injury, but reporting it could risk their jobs, so I had to do it myself. When I asked her doctor why could this have happened, he told me I wasn't welcome in his office if we questioned vaccines. Since then, she's faced serious and ongoing medical challenges. I wish we could simply vaccinate and move on, but it's not safe for her. I held her as she had a seizure. Asking me to risk this again is like asking a parent to give their allergic child a Snickers bar. Placing my child in harm's way would violate my deepest immoral and spiritual values. These beliefs are not political, they're not a loophole, they are personal and sincere. Parents like me would be forced to choose, violate our faith, or lose access to education. Is this how we treat families in Massachusetts?
My daughter already struggles with mental health. She depends on the support of her school, her IEP. Removing her from school wouldn't support her health, it would devastate it. One bill that allows the minors to consent to vaccines without parental knowledge. If parents get pushback when they ask questions like I did or they decline, do we really believe a child can say no? That's not informed consent, it's coercion. And if parents aren't told because of this bill, if a child is harmed or it's double vaccinated, who's accountable? Senator Roush already told us nobody is. Vaccinating my daughter behind my back would be a medical assault. Tracking unvaccinated children, their doctors, labeling schools as elevated risk is discriminatory. We would never accept public categorization of children based on HIV or hepatitis status. Why is this any different? These bills threaten Massachusetts' legacy as leaders in education and civil rights and risk costly legal battles, like Mississippi, where federal courts restored religious exemptions in 2023. Representative Vargas was mistaken. West Virginia reinstated the religious exemption in this January based on some equal protection religious acts. This is the fourth legislative session I've testified in to defend my daughter's right to exist safely in this state. Please hear not just my words, but what it means that I'm still here pleading to protect her. Removing these vaccines will not create health this exemption. It will create trauma, segregation, and harm to families like mine and those who love us. Thank you.
Thank you. Sabrina Santiago on virtual. Sabrina.
Hello.
Excuse me.
Hello.
Can I just
Can you hear me?
interrupt? My name's.
Go ahead, Sabrina.
Hi. Thank you for holding this hearing and for truly listening to all of our stories and testimonies. I'm here today in opposition to H2554, S1557, and S1618. I'm also in support of H2541. I'm a mother to 2 young daughters with a very complicated and rare disease. When I had my firstborn, I followed the CDC schedule without second thought. After all, it's what everybody does, and they're safe and effective, right? Well, come to find out, there is actually a lot more to the story. This is not a black and white issue by any means. It's 1,000 shades of gray, and there is a lot of nuance. With every medical product comes risk, and that is just a fact that cannot be disputed. I thought I was making the best decisions, but instead, I watched adverse reactions happen to my precious child during a very crucial time of development. Unfortunately, I had no prior knowledge that my child would be a part of the vulnerable subpopulation that reacts negatively to vaccines. Come to find out, years later, through genetic testing, my second-born has a gene that puts her at risk for epilepsy, heart issues, developmental delays, and so many more life-altering issues. Many vaccines list adverse reactions like these on the FDA package inserts. Doctors don't take this issue seriously, and yet they have no evidence proving vaccines are safe for her, specifically. I believe this unique genetic predisposition is the reason my oldest had poor reactions, although we'll never have answers. One size does not fit all. Every child and every person is extremely different and unique, and we can't expect to treat every person as if they're a carbon copy of one another. Stripping away decades of freedom and rights when we have exclusionary protocols and high vaccine rates just doesn't make sense. All children, regardless of race, gender, sex, sexual orientation, hair color, religion, should have the right to an education in Massachusetts. Thank you so much for your time and consideration in this matter. I urge you to truly think about the thoughts I presented here today, and please don't discriminate against families like mine. And just for the record, we will not be bullied into submission. If laws like this do pass, we will still not be getting vaccinated. Please do not allow our state to become a surveillance state. God bless everybody in this room and online today, and may God's will be done. Thank you.
Thank you. Leah Kovios?
Excuse me?
Leah Kovios?
Excuse me? Excuse me, can you hear me?
Yes.
This is Stacy Boris.
Oh, Stacy,
I was called earlier, but
Yeah, I will cycle back to you in a few minutes. Thank you.
thank you.
Thanks.
Esteemed Committee on Public Health, my name is Leah Koveos, and I'm here to testify in opposition of Bills H2554, S1557, S1618. My husband and I are both Christians and devoted to our faith. We have 3 daughters, ages 11, 8, and 2, and our oldest are in elementary school with religious exemptions because there are ingredients in some vaccines that violate our religious beliefs. For example, some vaccines contain cells from aborted fetuses. As Christians, we believe that abortion is wrong. We believe that we are entrusted by God to preserve life, not destroy it. Therefore, the thought of injecting our children with cells from aborted babies causes major moral and ethical conflict for us. And while Bill S1618 claims to preserve the religious exemption, it would require parents to sign a standardized document, which is compelled speech and goes against our beliefs. We have religious exemptions to spiritually protect our children, and not, as the bill suggests, to put our children in harm. This bill would grant unrestricted authority to DPH and practitioners to vaccinate any minor without parental knowledge or consent, which would keep parents in the dark about medical procedures that would affect their own children. Lastly, this bill would require schools below the herd immunity threshold to send notice to parents, which will no doubt create an environment of unnecessary fear and will lead to massive discrimination and bullying. Bullying is already a major issue in our schools. We need to be coming up with solutions to improve it, not providing grounds for more bullying. So if these bills are passed and religious exemptions are eliminated, my husband and I will be in a major predicament. We will have to make the intolerable choice of choosing between educating our children or remaining true to our moral conscience. While some may be able to homeschool their children, my husband and I both work and operate our own business, so homeschooling is not a possibility for us, nor is it the life that we envision for our daughters. We want them to continue to attend school, participate in classroom discussions, run for school office, and dress in cap and gown and graduate with a diploma. But if these bills are passed, they will never have such opportunities. And I wish it was as simple as rolling up their sleeves and injecting them with vaccines, but it isn't. This is an extremely complicated issue, but if we are forced to choose between allowing our children to attend school or God, the choice is God. But please, don't force us to make this difficult and horrible choice. We're not looking for special treatment. We just want our sincerely held religious beliefs respected, and we want our healthy children to go to school and lead successful lives. So please respect our religious views and preserve our children's right to an education. Thank you.
Thank you. Aaron Cotton. Aaron Cotton. Kara Albert. Kara Albert. Oh, thank you.
And Caroline, I'm still here waiting.
Good afternoon, honorable committee members. My name is Kara Albert. I live in Needham with my husband and 2 children. I'm here today because I oppose the Community Immunity Bill and the Vargas Kennedy Bill. I'm the mother of 2 school-aged children. Sorry. A son in middle school and a daughter just completing her first year of high school. Excuse me. My son is a strong student. He cares about his schoolwork and more than anything loves to play soccer. Oh, shit. Sorry. He loves to play out in the backyard and practice with his friend at the fields. He's a social kid, sometimes a little too social. He enjoys the camaraderie and making his peers laugh. My daughter is a very serious student. Sorry, I don't know why I'm crying that much, but I mean, I do, but my daughter is a very serious student, a perfectionist. She couldn't wait to get to high school to take advanced classes and be surrounded by other academically minded kids. She comes home and tells me about the things she learned each day. While she's never been a really strong athlete, she discovered a love for volleyball. She practiced a lot and made the freshman team. Needham happens to have a very competitive sports program, and not all kids make it. She was thrilled and so proud of herself. She also joined the debate team this year and competed in a number of debates around the state, requiring many hours of research and practice. As someone who is typically more reserved and introverted, it has opened her up in ways you cannot imagine. My children are doing well at school, and this is more than I could ever ask for. Than I could ever ask for. For many years now, I've submitted a letter at the start of each school year informing the school of our religious exemption to vaccination. The school has acknowledged and accepted it in accordance with the law without issue or disruption to my children's education. If this bill passes, it will potentially take away my children's right to an education. It will also take away my right as a parent to do what I feel is best for them. And our assurance that our religious exemptions are recognized, keeping them in school and allowing them to thrive both academically and socially. This bill would require an annual DPH review and approval process for our religious exemption at their school, extracurricular activities, and camps. This doesn't make sense to me. This would create lots of extra work, waiting games, and will require extra resources. And if our exemptions are denied, there's no appeals process. Why would anyone want this? Why waste efforts and resources to fix a system that is not broken? Why take the power out of the hands of parents who do what they believe is right for their families and their faith? My children could be excluded from school unjustifiably while waiting for answers from DPH, or excluded altogether. Can you imagine what that would do to them mentally and physically? Would you want that for your own children? The current exemption law provides a clear and straightforward process that parents and schools understand and follow, allowing children continued access to school without interruption or threat of expulsion. This bill has the potential to essentially remove the right of my family to exert their religious rights and overturn our current protections. Why is the acceptance of diverse views the rule everywhere today? Our workplaces, organizations, schools, and institutions, but not here at the Mass State Legislature. Why does a small group of lawmakers feel it's okay to take away rights from us, a small minority of families who have certain religious beliefs? Thank you.
Thank you. Thank you. I have a panel: Grace Brown, Lucas Brown, Annabelle Brown, Rosalie Brown. Welcome.
Dear esteemed members of the Joint Committee on Public Health, my name is Annabelle Brown, and I am here to testify in opposition to H2554, S1557, and S1618. If H2554 were to pass, I would no longer be able to attend school. I'm a 5th grade student at a small private school. This was my first year at the school, and I've done very well. I'm a high honor student, a cheerleader, a basketball player, and a member of the running club. Next year, I am hoping to become a member of the National Junior Honor Society, the Yearbook Club, and Student Council. Losing my right to an education because of my sincere religious beliefs would devastate me. I've not missed a single day of school this year for being sick. I am healthy, I do not pose a threat to anyone, and I do not deserve to be discriminated against. I beg you to vote no on these discriminatory bills. Thank you for your time.
Dear esteemed members of the committee, my name is Rosalie Brown, and I'm here today to oppose the removal of the religious exemption. If this bill were to pass, I would be excluded from school, which would be extremely upsetting. This past year, I was homeschooled, and it was okay, but I strongly prefer traditional school and can't wait to go back next year. I want to join cheerleading and eventually play varsity soccer. I deserve the right to an education just like every other child in Massachusetts and do not want that taken away from me. My mom and dad have talked about relocating our family if these bills were to pass. This is equally upsetting to me. Relocating would mean leaving my friends, my safe neighborhood, my grandparents, my church, and the school I have been looking forward to attending. Massachusetts is supposed to be a welcoming state. My family should not be forced to move away because of our sincere religious beliefs. Please vote no on these bills. Thank you for your time.
Esteemed members of the committee, my name is Lucas Brown, and I am here to oppose H2554, S1557, and S1618. The removal of the religious exemption would have an immediate negative impact on my family. Our children would be excluded from school, and my wife would need to homeschool all 5 of them from kindergarten through 12th grade, a huge undertaking. The other alternative would be to uproot our family and relocate. I am originally from the Mid-Atlantic and have lived in Massachusetts for 12 years. This has become my home. I love the community that we live in, and my family is thriving here. As you have heard, my daughters are very involved in school, including activities and sports. The passage of this bill would force us out of our home. I will have to find a new job. We will need to find new schools, a new church, and put down roots somewhere else. This reality stands in stark contrast to Massachusetts' reputation as a welcoming and inclusive state. We have sanctuary cities for the transgender community, and we have become a haven for migrants. How can Massachusetts welcome migrants fleeing persecution, yet discriminate against its own citizens for their sincerely held religious beliefs? The First Amendment protects an individual's right to practice their religion freely. Freedom of religion doesn't depend on how many people use it. It's an individual right. Please vote no on these bills. Thank you for your time.
Dear esteemed committee members, my name is Grace Brown. I am a lifelong Massachusetts resident, and I am the mother of 5 children. I am testifying today in opposition to H2554, S1557, and S1618. My children rely on the religious exemption to attend school. Every time that this bill is introduced, my heart sinks and I get a pit in my stomach. All I want is to be able to send my children to school without fear that that right will be taken away from us. The drive behind passing this legislation is fear-based and misguided. The truth is that Massachusetts has the highest vaccination rates in the country, and there has been no outbreak of a vaccine-preventable disease in a school setting in the last decade. If there were an outbreak, there are exclusion policies in place to prevent the spread of disease. This bill is unnecessary at best and discriminatory at worst. Can you honestly look my children in the eyes and tell them that they don't deserve to go to school? This type of segregation has no place in civilized society in 2025. The Puritans who founded our state banished people who didn't conform to their exact idea of religion. Let's not repeat that kind of discrimination today in 2025. If this bill were to pass, my family would be forced to homeschool long-term or move out of state. We are very fortunate that we would have the means to do either of those things, although they would both be quite difficult. But what about those who cannot homeschool or relocate? All children deserve the right to an education, no matter what their beliefs are. I urge you to vote no on this legislation. Thank you so much for your time.
Thank you. Stacy Boris on virtual. Stacy Boris.
Hi, can you hear me this time?
Yes, go ahead.
Okay, thank you. My name is Stacey Boris. I'm a lifelong Massachusetts resident, a mother, and a licensed physical therapist. I've personally experienced the consequences of relying on a religious exemption, and am here today to speak in strong opposition to H2554, S1557, and S1618. What are we trying to accomplish by removing the religious exemption? If this is about child safety, then we must consider all children. Too often, conversations about vaccine policy ignore the children who are at risk for vaccination, and it's unfair to have this discussion without acknowledging all sides of the story. This is not an either-or situation. It's a both-and. We must protect all children, those vulnerable to disease, as well as those vulnerable to injury. If you're here today fighting for your child out of concern for illness, know that I am here doing the same for my children, out of the same place of love. And even though we have different beliefs, we can safely coexist. Please note there are so many nuances to religious exemption. Some parents use them for just 1 or 2 vaccines because of certain ingredients or because of a past adverse reaction. These are deeply held religious beliefs that it is our God-given duty to protect our children. This is not a loophole or a convenient excuse as it has frequently been referred to. Our religious beliefs guide every part of our lives, including health decisions, and to force parents to violate their morally formed conscience or their child will be excluded from school is discrimination. Religious freedom does not require you to follow a major religion or depend on a majority approval. The fact that others may not share these beliefs does not make them less valid or less deserving of protection. My kindergartner has not missed a single day of school due to illness this year, and yet this legislation labels him as a threat. This is not theoretical for me. I had a long-standing religious exemption, but at 40 years old and pregnant, I lost my job because of that same exemption. I was already a high-risk pregnancy and was being threatened to take a product that now years later has shown increased rates of miscarriage and stillbirth. I wasn't a threat. I was a mother and healthcare professional trying to protect myself and my child. I'm still devastated over losing my job, but I am more grateful that God gave me the strength to stand firm in my convictions. Now, under this legislation, I would be forced into the same situation for my children. Please consider the broader implications of this legislation. Massachusetts has always stood for liberty, tolerance, and thoughtful policy. You can protect public health without sacrificing parental rights and religious freedom. I urge you to vote no on these bills and preserve the religious exemption, not just for me, but for every family who is doing their best to protect their children in good faith. Thank you for your time and consideration.
Thank you. Jacqueline Fajian. Jacqueline? Welcome.
Hello, my name is Jackie Fashion, and I will be testifying in opposition of Bills H2554, S1557, and S1618. I am supporting Bill H2541. This is my 7th time testifying to protect our medical freedom, our parental rights, and our God-given human right to decide what gets injected into our own bodies as well as the bodies of our children. Do you hear how crazy that sounds? How on earth can some of you sit up there and continue to support these atrocious bills? And why do you keep bringing them back after witnessing such strong opposition from your constituents year after year? Do you represent us or do you rule over us? Because it's getting really hard to tell. In previous hearings, we have cited factual information and peer-reviewed studies regarding the lack of safety and efficacy of some childhood vaccines, as well as the infamous COVID injection. It all seemed to fall on deaf ears. Let me ask you, have any of you actually thoroughly researched the information that has been presented to you during all of these hearings? Or do you just ignore it and chalk it up to misinformation and conspiracy theories? It baffles me that some of you think it's okay to take away our parental rights in making our own child's medical decisions. It baffles me that some of you think a child of any age or mental capacity is capable of making healthcare decisions on their own without parental knowledge or consent. It baffles me that some of you think you have the right to take away our religious freedoms. And it blows my mind that I am sitting here again for the 7th time pleading for my God-given constitutional rights as a human being and as a parent. Don't you realize if you are so concerned about community immunity, coercive mandates, lack of informed consent, and the ever-growing mile-long list of vaccination requirements with zero manufacturer liability for vaccine injuries, those are the things that are driving vaccine hesitancy. And these overreaching bills are helping steer that bus. I implore you to do the right thing by joining me and so many others in opposing these tyrannical bills. Please do not vote them through favorably. It's way past time we kill these bills for good. Enough is enough. I am so tired and so fed up, but until my last dying breath, I will never stop fighting for our children, our medical freedom, or our God-given human rights. And thank you to those of you asking questions and paying attention and listening. Thank you.
Thank
Any
you.
questions?
Any questions? No. Lynn Greenwood. Lynn Greenwood. Thanks.
All right. Good day to everyone on the committee. Thank you for enduring the long day. My son was injured by the flu mist 18 years ago. He was 4 years old. Debilitating migraines was the result. I got no help from the doctors. Flu mist was taken off the market shortly after. I know multiple families with the same injury, one in my town. It's not 1 in a million. That's mathematically impossible. Flu mist is now being released direct to consumer in fall of 2025. Same ingredients, same product. Skip the doctors. No listing of migraines as adverse events. Who will help the people injured? No one. When you talk about the insurance, who pays for it? When you don't acknowledge the injury, there is no insurance. All 3 of my kids are very healthy, fit, over 18 now in college, rarely get sick. They were all denied access at one point to education in the state of Massachusetts with medical exemptions. So Lyme, I'm a Lyme disease survivor, never tested positive, disabled for 6 months from the neck down 8 years ago. Cured myself with functional and integrated doctors, no insurance. The cure is to treat it like a parasite, in case anybody is curious. The Quiet Epidemic, that is a documentary released 3 years ago. Investigative journalists FOIA'd the emails from the CDC. The CDC took 2 markers out of the Lyme test from the beginning, in the 80s. Thus, rarely people test positive. A fraudulent test can make a disease disappear. Dissolving Illusions is a book that I recommend everybody should read. It's about the history of the vaccine industry. There's so much facts in here. Polio. My oldest brother, Richie, received the first batch of the polio vaccine in 1955. The original vaccine was contaminated with the SV40 virus. The SV40 causes cancer. Richie died of leukemia at the age of 17. 3 other boys in the neighborhood also had leukemia. So the book displays how the way they diagnosed polio changed when the vaccine was released. In the book also, polio, the trials were manufactured with one process, and the product given to the public, that was for the test, was given to the public, was a different process. This is the same exact thing that happened with the COVID shot, so history repeats itself. The Pfizer shot contains the SV40 promoter. History repeats. So my 55-year-old brother-in-law dropped dead after his 4th shot, very healthy. 2 of my nieces are injured. The Cleveland Clinic study, we have 2 of them. The COVID shot, I'll leave you with this. The COVID shot, the more you take, the more likely you are to get COVID. The current Cleveland Clinic study, the current vaccine for flu this year increased your risk of getting the flu by 28%. And can I just say that we talk a lot about religion today. There's a huge revival going on with the younger kids in this country. Even in Massachusetts, there's a big revival this weekend and next weekend with the students. So we all know in the end that God wins. So.
Thank you. Nicholas Cottonstedt, I'm not sure if I'm saying that right, and Mary Ellen. Welcome.
Thank you for hearing our testimony. The last time I was here
Cecilia was with us. This is a picture of her at her first communion. My name is Mary Ellen Cottonsteady. I am a resident of Sterling, Massachusetts. I am opposed to bills S-1618, S-1557, and H-2554. I support H-2541. My daughter Cecilia was born on June 1st, 2012, and died on August 23rd, 2022 at the age of 10. Cecilia was well until her 4-month vaccinations. She developed as all healthy babies do, hitting age-appropriate milestones. She was very interactive and thriving. On October 2nd, 2012, she received her 4-month vaccinations, Prevnar and Pentasil. The shots were given to keep her well and prevent suffering, but they did just the opposite. The vaccinations given that day had a catastrophic effect on Cecilia's health. On that very same day, she received her vaccinations. She started to have infantile spasms. As the days turned to months and the months turned to years, the seizures never stopped, despite the best medical care in the nation. And my healthy girl became very sick and died. The constant seizures wreaked havoc on her developing brain and body. She could not speak or walk in a straight line. She couldn't eat regular food or interact appropriately with the world around her. She wore diapers, received formula through a G-tube, and was totally dependent on our family for her every need. These events and their cause have been confirmed by the Vaccine Injury Court and upheld by the D.C. Federal Circuit Court of Appeals. If I could go back in time, I would not have given Cecilia any vaccines that day, as I now have knowledge a child's neurological system is not fully developed until the age of 3, and vaccines contain neurotoxins that are not subject to double-blind inert placebo testing, as is required for all other pharmaceuticals. Now that I understand that how some vaccines are derived, as her mother, I would insist on the right and conscience to refuse Pentasil, which is manufactured using aborted fetal tissue and contains human DNA, is morally objectionable and medically questionable. Cecilia is not alone in her suffering. Every year, there are thousands of children harmed in significant ways by vaccines. Parents have the right to be informed of the sometimes devastating risks of vaccines. No law should take away parental consent, much less knowledge in this matter, as these bills seek to do. No law should take away your parental right to conscience in moral matters. The citizens of Massachusetts must retain our right to determine routine health care for our children. As the Supreme Court ruled in Berskowitz versus Wyeth, vaccines are unavoidably unsafe. Some will be harmed. Where there is risk, there must be choice. I oppose these bills. Thank you for your time.
Hi, my name is Nicholas Cottonsteady. I'm a resident of Sterling, Massachusetts. I'm opposed to bills S-1618, S-1557, and H-2554. I support H-2541. My daughter Cecilia died at the age of 10. She was catastrophically injured from her 4-month Pentasil and Prevnar vaccinations. After a 7-year battle in the Vaccine Injury Court in the U.S. Court of Appeals for the Federal Circuit, it was ruled unanimously that she was injured and should be helped. She received her medical trust 1 week before her death, too late to help us with her care. However, this should not have happened. She had a 1986 table injury in which the government agreed to compensate victims like Cecilia at a rate of around $1 billion a year. However, via fiat in 1996, Secretary Shalala and a lawyer from the American Academy of Pediatrics removed her injury. Since then, parents have no recourse to help their injured children. These laws punish families of injured children by requiring liability-free vaccines for an education while enriching Big Pharma. These laws will only result in less safe vaccines because pharma will have zero incentive to make them safe because no one is responsible for harm and our children become their captured consumer. I'm concerned that S1618 will allow a provider to administer preventive care without an established relationship with our children about parental knowledge or consent if a provider feels is in their best interest. Records of this intervention can be kept confidential from parents, shielding the provider, the manufacturer, state and federal government from liability for adverse reactions. The proper religious exemption will compel us to sign a statement that refusing to immunize our children may result in serious illness or death of the participant or others. This statement obviously conflicts with our religious belief to not harm our children, as we experienced the opposite, in which vaccines severely injured and killed our daughter. The religious exemption is fundamental to our state constitution, rights, and the First Amendment. We should not be forced into violating our moral conscience by injecting products developed from aborted fetuses, such as the MMR, the varicella, the Pencil vaccine, the COVID-19, and Hep A vaccines. At least 76 babies were killed in developing the MMR. The Pontifical Academy of Life tells us that we should object, and we object strongly to these laws. The panel should be concerned with making vaccines safer, not bullying families with injured children into further harming their children in order to get an education. Thank you for your time.
Rocio Collado on virtual, or Rocio Collado. Lisa Ottaviano.
I'm here. Can you hear me?
Go ahead, Lisa.
Thank you. I am testifying in opposition to Bills H2554, S1557, and S1618. I am exceptionally grateful that my children have both already graduated high school with their religious exemptions intact. My youngest is in a private college in Massachusetts, selected specifically because the college never mandated the COVID vaccine. If the legislature removes a religious exemption and his college opts to follow suit, he will not violate his religious beliefs and will drop out of college. He will not reach his full earning potential without a college degree, which will likely prohibit being able to homeschool his future children. This will necessitate moving to a state honoring religious freedom so he can send his children to public school. I'm a curious person by nature, and I am curious about many things related to these proposed bills. I'm curious why the legislature is targeting the small percentage of children with religious exemptions and ignoring the huge gap population of students whose parents have no objection to vaccination but need supports to follow through on their pediatric appointments. I'm curious why the Massachusetts government is welcoming with open arms undocumented, unvaccinated immigrants who are not screened for infectious diseases if we are so concerned about infectious diseases. I'm curious why equity, inclusion, and diversity does not apply to folks with sincerely held religious beliefs. In the last 5 years, federal and state governments have targeted people with sincerely held religious beliefs and instead of including them, has actively sought to expel them from schools, government, the military, healthcare, corporations, companies with more than 100 employees, travel by airplane, as well as participation in society in general. I'm curious that the Pledge of Allegiance our children recite in school daily ends with "and liberty and justice for all," not with liberty and justice for all who are vaccinated. I'm curious why there appears to be an intense interest in moving these bills quickly this session, and I'm curious as to whether it has anything to do with HHS's autism study or the FDA's new requirement for vaccines to be tested against inert placebos, which has never been done before. I'm curious as to why the media is reporting 2 deaths from measles that actually occurred due to improperly treated bacterial pneumonia. I urge the committee to also get curious about these issues and not vote bills H2552, S1557, S1618 out of committee favorably. My husband and I are so concerned about these and other proposed legislation in Massachusetts that we are actively planning our escape and just bought our retirement property in a state that honors freedom. This deeply saddens us as we intended to live out the rest of our lives in Massachusetts. I'm also testifying in support of Bill H2541 and H2341. Physicians should be free to use their clinical judgment and patients' medical histories to be able to assess their need for a medical intervention without fear of losing their license, hospital privileges, or jobs. Children should not be excluded from school due to their medical needs or for any other reason. It is bad for families and it's bad for society in general when children are excluded from school. Also, no one should be coerced into getting a COVID or other mRNA vaccine ever again. The effect of the COVID vaccine has been devastating. Look around and think about the people in your circles and how many of them who are vaccinated have become incapacitated or disabled or died suddenly. I urge the committee to vote bills H2541 and H2341 out of committee favorably. Thank you for your time.
Thank you. Ria Zhang on virtual. Amanda O'Rourke. Michael.
Hello?
Oh,
Can you
go
hear
ahead. Go ahead, Amanda.
I'm a longtime Massachusetts resident, and I do have a child in a private school that I would very much like to keep there. I oppose bills, the Vargas, Kennedy, and Roush bill, and my religious belief in God is not limited to a building or a book. My God created my body with the ability to heal itself, and in the event of measles, vitamin A, a God-given medicine, will promote healing without any side effects, as opposed to a measles vaccine. Taking away my religious belief and exempting vaccines discriminates against my right to religious freedom and the ability to protect my child as I see fit. The war on vaccines shouldn't be a public debate. It's a private decision based on families' personal choices. On contrary belief that vaccinated children are more sick, I have to say that my experience with my child has resulted in 0 sick days this year and has not been to the doctor for a sick visit in 10 years. Regardless of your decision today, my child will remain unvaccinated and will continue to be a member of the community. Thank you.
Thank you. Michael King, Mass Family
Thanks so much.
Institute.
Go ahead. My name is Michael King from Massachusetts Family Institute. The future is bright. It is so encouraging to see the incredible testimonies today. The more I think you host these kinds of hearings, the more you grow and unify this incredible voice of parents. This hearing is always the most lopsided. We are on our way to about 90% being opposed to these bills today. I'm glad that Representative Vargas brought up the court has ruled. I want to go back to the robust conversation regarding the Supreme Judicial Court ruling recently in the DCF case. The SJC reaffirmed that the Massachusetts Constitution provides even more protection for religious liberty than the First Amendment does. Strict scrutiny applies to every infringement on religious freedom. And then the SJC went on and stated that courts should be reluctant to question the sincerity of a parent's religious beliefs or whether the beliefs are really religious. In a stunning affirmation of religious freedom and parental rights, the court stated, "There is no question that the rights to freely practice one's religion and to raise children according to the dictates of one's own conscience are among the most sacred private interests, long recognized as such by this court, the SJC, and the United States Supreme Court." So what an incredible decision from the SJC. There's already a public school exit in Massachusetts and the nation. The exponential rise of education freedom coupled with the continued intolerant woke agenda in our public schools fuels this exit. If the State House were to pass these bills, it would throw gasoline on this already growing public school exit. This is not just the religious community, but anyone that cares about parental rights and bodily autonomy. We live in a nation and especially a state, according to its constitution, that holds religious freedom in the highest regard. Passing this kind of legislation only opens the door wide open for lawsuits to continue to protect these rights. And we've heard about many lawsuits in other states that have passed these kinds of laws. There have been several recent victories for religious freedom at the Supreme Court that have established even greater precedent to protect religious freedom. With the launch of the Massachusetts Liberty Legal Center and national partners like First Liberty and the Alliance Defending Freedom, Massachusetts Family Institute will continue to fight successfully to support these God-given, inalienable rights for Massachusetts residents. Thanks so much.
Thank you. Frederick Fogel. Frederick Fogel. Go ahead, Fred.
I'm here. Can you hear me? Yeah, is that working? Can you hear me?
Yes.
Okay, good. Thank you. Thank you, chairs and distinguished members of the committee. My name is Fred Fogel. I graduated Harvard Law School in 1985, and I've been practicing since then in the corporate sector primarily. I want to acknowledge and applaud the Commonwealth's record of success in raising vaccination rates while respecting parental choice. In that context, I will address Section 6 and 7 of S 1618, the Community Immunity Act, and advocate in opposition to it. Those sections permit a provider to administer preventative care, including vaccinations, to a minor child without the consent or even the knowledge of parents, and even if the child is incapable of providing informed consent. When deciding who has the ultimate authority over health decisions for children, the United States Supreme Court has been unambiguous for over 100 years. This power and responsibility belongs to parents and not to the state. As Justice O'Connor put it, the interests of parents in the care, custody, and control of their children is perhaps the oldest of the fundamental liberty interests recognized by this court. Overall, outside of medically urgent situations, there is no legally permissible context in which medical treatment can be given to a non-emancipated minor in the absence of a parent. Yet that is precisely what the Act permits. It allows parental consent and even parental knowledge to be bypassed and access to medical records entirely blocked. This is almost certainly unconstitutional under both federal laws and the laws of the Commonwealth. A federal district court, I think about 2 years ago in the District of Columbia, enjoined a similar law, finding it conflicted with both federal law and the Free Exercise Clause of the Constitution. The district was forced to withdraw the law. More directly, and has been referred to by a few speakers today, including Senator Roush, a case was decided by the Commonwealth's highest court, which unambiguously asserted the primacy of parental rights in making vaccination decisions for children. And that was even when the children were in state custody. The act would allow the state to supersede parental decisions for children who were in their parents' custody. That was the cases, the care and protection of Eve, which everyone should look at. I think it is unambiguous that the Community Immunity Act would violate it. And worse than failing the constitutional test, the act fails the test of common sense. A young or even intellectually disabled child could be vaccinated without anyone knowing the child's medical history or exemption history. The parent might never know or be able to respond to adverse reactions, properly make future medical decisions, or seek compensation in the event of side effects. This is the main reason the DC law was struck down by a federal court a few years ago. I think parents and your constituents would not just be surprised, but really honestly outraged by such a thing. Before acting on this bill as a whole, I would urge the most careful study. Massachusetts has succeeded with a balanced approach that for decades has respected individual choice and parental rights, while at the same time increasing vaccination rates and protecting public health. Thank you for your time.
Thank you. Michelle Frigon. Michelle Frigon.
Hello.
Hi.
Hello again to everyone and the new folks who don't know how this goes. And unfortunately, many of us do, because we live in biopharma Mass, where Purdue killed a whole generation of people with opiates. And you just heard from some parents of some angels who could be with us now. And I just want to say I'm so grateful for their voices, but I am sick to watch them be put through this again. Shame on you. I had 3 friends this morning tell me they are leaving our homeschooling because they are tired, but they will not waver from their sincerely held belief in God our Father. Excuse me. Please, Lord, I pray, keep your hand steadily over our children and the weary parents here. In Christ's name, amen. We have performed this hearing for hours and hours and hundreds of hours before 2020. You are seeing that frustration, and it is not undeserved, as the state has been trying to remove this for years. Why does this keep happening, people ask me. Mass is the most vaccinated in the country. In case anyone missed the last 5 hearings, here's a recap. There were hundreds of parents. They spent hours talking about their kids' heartbreaking injuries and pleading for respect for their basic religious beliefs. Senator Rebecca Rausch, Vargas, Sir, Decker, and others rolled their eyes on Zoom. Many of us will never forget your positions and words before today. You seem a lot nicer today. Interesting. It was less than flattering what we saw. Thank you so much for that awakening. Wait a minute. Rebecca's not even here. She called people liars and left the room. Before that day I saw in that hearing, before I saw people on this board bribing children with ice cream and gift cards to gain compliance, I believed it was in good faith, and it's not. Why would I, as a mother, trust these very same boards now? You took an oath. I won't go into details, but the state ripped my children's world apart in 2020. Let's have some background. We have an epidemic of the sickest children in the developed world with the most medical intervention in history. It's because of this that consent is essential. You must question how coercion is the answer here, right? Do you? You must eventually recognize you're literally causing the problem. It is against your oath to not wake up to this. Vaccines are safe and effective mantra is propaganda. Get your shots if you want them, but 72% of your voters said audit this legislature, yet no audit. You have lost all of our trust. There is zero. There is no standing for you to be trusted again. The science is settled, Mr. Vargas. You're absolutely crazy to say that. What a joke. People know the professionals you told us we had to trust were wrong. Respect and trust is earned. COVID showed us what you do when you get the ability to overstep our rights. 6 feet, masks, kids lost their world, irreparably delayed and damaged, yet the propaganda rolls on. Anyone that declines is sanitized, masked, injected. They're all just canceled. It's absolutely unbelievable how the state government targeted people. You locked people out. We knew it failed. We all know. We saw what happened. People who requested valid exemptions, they were not honored. They were not honored. We saw it, and we knew it didn't work. It's backfiring spectacularly. The writing's on the wall. You should be laughed out of here. Public health experts turned into little tyrants. The problem's larger now. Now it's a giant microscope over the state hypocrisy. Are all families worthy of respect? It's not your place to decide what people do for their bodies, remember? Medical choice is private, except for this. Is artificially forcing 100% actually 100%? Of course not. Do you see the response when government is empowered to force? History is screaming at you here today. Article 2, Mass Constitution, God wins.
Thank you. Deborah Condrelli. Deborah Colindrelli. Michelle Orfanos. Michelle Orfanos.
Hello, this is Deborah Calendrelli. Can you hear me?
Hi, Deborah. Go ahead.
Hi, how are you? Thank you. Today I am in opposition of bills S157, 1618, and 2544. These bills could not advance on their own merit over the years, so what is different this time? Big money pharma with highly trained employees to lobby at the State House and experts for closed-door meetings. Excuse me. I have worked in the medical field for almost 40 years with many different experts. What I have learned, for every expert in favor, there is an expert in opposition. This is my story. In 1979, I was 12 years old. My best friend was Tim Kelly. We played baseball, Matchbox cars, Army, G.I. Joes, sports, etc. I would tell my mom all the time, I wish I was a boy. What do you think the experts of today would have done with my 12-year-old self? The expert teacher would have had me in front of an expert counselor who would have referred me to an expert medical person who would have asked me, Deb, you want to be a boy? And I would have said, hell yeah, you bet I do. The problem is my 12-year-old self would have had no way of understanding what they were about to do to my body, both chemically and surgically, because my brain was too underdeveloped and too immature to see beyond my want at that moment. They would have robbed me, these experts, of my precious blessing of life, motherhood. They would have robbed me of my son and daughter. But hey, they're experts and they know better than any parent ever could. I am thankful I grew up in a time where experts understood the immaturity of a child and allowed me to grow into a woman and a mother without leading me down a road of regret. The point of the story is this. There are going to be experts for and against these bills, and it depends on who you align yourself with. I personally align myself with God, Jesus Christ, my Savior. He is the only one that dictates to me and whispers in my ear through prayer what is best for me and my family. And if Vargas can take him out of the equation, there's nothing standing between him and absolute power over our lives. I will not abandon my God just because he wants to negate my relationship. And as far as the Community Immunity Act, it's wrong in so many ways. To keep things about a child from their parent is just of poor character and integrity. These are the predators I tell my kids to stay away from. I pray to God for many things, especially today. I pray that when Goliath comes to destroy our relationship with him and rob us of our parental rights, that we strike him down yet again another year. God has gifted me with free will to find my own expert opinions, make my own conclusions, and we as parents are resilient. We won't abandon our God. We will find each other, create a parallel community, and we will find a way to succeed. This is just unacceptable year after year. Thank you for your time.
Thank you. Kelly Gallagher? Kelly Gallagher?
Come back to me in about 30 minutes. I'm driving right now.
We will circle back.
Thank you.
Caroline Williams, still here.
Thank you for being safe on the roads. Jennifer Stevenson.
Sorry. My name is Jennifer Stevenson, and I'm a Massachusetts resident. As a parent and a teacher, I'm here in strong opposition to any attempt to remove or change the religious exemption for school vaccines in Massachusetts. I'm guided by my morally formed conscience. My daughter is a rising high school senior. She is a strong student and a talented musician. If the exemption is removed, she could be excluded from school, causing serious academic and emotional harm. Senior year is one of many social events, including prom and homecoming, as well as the most important year in making decisions regarding her future. She also has a complex genetic condition, and I support the medical exemption bill. No doctor can assure us that she wouldn't suffer an adverse reaction. But under current ACIP guidelines, she'd need to have a serious reaction to each individual vaccine to qualify for a medical exemption to that one shot. This means she would need to be harmed, possibly permanently, before qualifying for protection. I cannot and will not take that risk. There is no system in place to screen children for individual risk. And Massachusetts already has a disease-specific exclusion rule in place to protect public health if an outbreak occurs. That system works. Removing the exemption will punish students, damage trust, and violate deeply held convictions. I urge you to preserve this exemption and protect the rights of families in this state. Thank you.
Thank you. Julie Capuzziello. Julie Capuzziello. Will Monks.
Thank you, honorable committee members. My name is Will Monks, and I am a Massachusetts resident.
I am testifying in opposition of Bills H2554, S1557, and S1618. My wife and I have twin 14-year-old daughters. One is severely autistic, nonverbal, and is a boarding student at the Boston Higashi School in Randolph, Massachusetts. It is an international school, world-renowned, and our daughter lives there 6 days per week. We enrolled her at this school shortly after her 10th birthday in March of 2021. She is a danger to herself and the community as she frequently bolts, sometimes into busy streets. This program keeps her healthy and safe and meets all of her academic and physical needs. She is thriving, and it has been a lifesaver for our family. Our other daughter developed a negative self-image as a result of looking at herself during remote learning on Zoom classroom during the COVID-19 lockdowns. As things got worse, she developed an eating disorder, was hospitalized for 3 weeks, and was placed into a residential rehab facility for 4 months in southern Connecticut. This was at 12 years old. Upon completion of the program, she refused to go back to her public school because she was ashamed, and we were forced to place her in a private school, which has been a bit of a financial hardship for us. Despite these hardships, we are thankful that we have been afforded the services to help our daughters learn and grow. We are especially grateful that our daughter's boarding school is a short drive from our house, and we can bring her home on weekends. Leaving Massachusetts is not an option for us. Families like ours are not able to homeschool severely autistic children like our daughter. To say that both of our girls would regress is an understatement. I can't imagine what their lives would look like if they weren't able to attend the schools they love. As many have stated, the Massachusetts Department of Health's immunization exemptions and vaccine preventable disease exclusion in school settings states that during disease outbreaks, quote, in situations where one or more cases of a vaccine preventable or any other communicable disease are present in a school, all susceptible persons, including those with medical or religious exemptions, are subject to exclusion as described in the Department of Public Health's reportable diseases and isolation and quarantine requirements, end quote. The protocols are already in place to keep all children safe in the event of an outbreak. Massachusetts has the highest childhood vaccination rate in the country. Why is there a push to infringe on the religious rights of my family and many other families that are here today when we have such a high vaccination rate? Massachusetts prides itself on being an inclusive state with a strong commitment to diversity and inclusion in many aspects of life, most importantly in education. How does removing our religious rights support inclusion? Our children's bodies are a gift from God, and no organized religion has a right to infringe on or override our relationship with God. Please consider the disastrous hardship that will be placed on my family and many other families if you support these bills. Thank you.
Thank you. Selena Fitnides, I may be saying that very wrong. I apologize if I am. All right. Thank you. Welcome.
Good afternoon, members of the committee. My name is Selena Fitnides. I'm an attorney, a civil rights attorney practicing in Massachusetts, testifying today against 3 of the bills under consideration. This is my first time testifying at a vaccine bill hearing. I am not a religious person. I chose to give my 3 children all the recommended vaccines on the schedule. And yet, as an attorney, I am disgusted by the repeated efforts to so disrespectfully violate religious students and their parents' constitutional rights by eliminating or interfering with the long-standing religious exemption to mandated vaccination in Massachusetts. This latest salvo, the bills, 3 of the bills under consideration today, either would place unconstitutional, unworkable, undue bureaucratic burdens on the free exercise of religion, that would be Senate Bill 1618, or like House Bill 2554 and Senate 1557, they would unconstitutionally seek to leverage the right to a free public education, which is guaranteed under the Massachusetts Constitution, to coerce families into sacrificing their religious principles by subjecting their children to a medical procedure that they believe is prohibited by their faith. Enforcement of school vaccine mandates without a religious exemption provision would result in lawsuits being filed under the Massachusetts Civil Rights Act. I think we may have some future plaintiffs in the House today if these bills should be successful. The Massachusetts Civil Rights Act allows an aggrieved party to sue anyone who interferes with or attempts to interfere with their exercise or enjoyment of rights secured by the Constitution of the United States or the Commonwealth by means of threats, intimidation, or coercion, and coercion is what is before us in these bills. These are lawsuits that families would stand a good chance of winning, and here is why. The bills under consideration today are assault on not just one constitutional right, but 3 constitutional rights: a child's right to a free public education guaranteed by our Constitution, parents' rights under the state and federal Constitution to direct the upbringing of their children, which obviously would be directly violated by allowing minors of all ages to consent to medical procedures without their parents' knowledge, and all people's right under the state and federal constitutions to freely exercise their religious beliefs in accordance with their own conscience. Now, these rights are obviously not completely absolute, but our Constitution, as Mr. King pointed out here in Massachusetts, provides greater protection for these rights than does the United States Constitution and perhaps any other constitution in the country. The legislators who put forth these bills seem to be confused about which state they're operating in. They think that perhaps our Constitution is the same as that of New York or California. That would be incorrect as a legal matter. Just a few weeks ago, the Supreme Judicial Court reaffirmed that under the Massachusetts Constitution, a law burdening religion, even incidentally burdening religion, must advance a compelling interest and be narrowly tailored to serve that interest in order to withstand constitutional scrutiny. For those of you who aren't lawyers, that is a strict scrutiny test of constitutionality. That is the highest level test. I would submit, based on what I've heard today, and I'm new to this, that the legislation that we're considering today is not an incidental burdening of religion. It seems to be targeting religion, so that would automatically elevate it to strict scrutiny even under the federal Constitution. This strict scrutiny test is not a test that a school vaccine mandate in Massachusetts that does not contain a religious exemption would be likely to pass. The government, no doubt, has a compelling interest in protecting children from exposure to communicable diseases. But to overcome a free exercise challenge to a school vaccine mandate, the government would have to show that its goal of protecting children would be substantially hindered by allowing an individual child, not an assumed collective group of child, an individual child, a religious exemption from vaccination. And given the extraordinarily high rate of exemption of community immunity in the Commonwealth, the government simply would not be able to make this showing, with only 1% of school children in Massachusetts having a religious exemption from vaccination, which is obviously far below the percentage that could possibly undermine herd immunity and expose unvaccinated children to infection.
Thank you.
It would not succeed.
Thank you.
I'll just close by saying I strongly encourage the committee to reject these bills. Oppressive and unnecessary public health measures that limit educational opportunities for children and infringe on multiple civil liberties will only increase distrust in government and public health institutions and result in costly litigation. The bills under consideration should be rejected. Thank you.
Thomas Haskins. Thomas Haskins. Dana Demetrio. Dana Demetrio. Julia King. I've had Julia.
Good afternoon, committee chairs and members. My name is Julia King. I'm a mother to 3 healthy children. I was born and raised in the Commonwealth 37 years ago to the day. Today, I'm supporting Bill H2541 and H2376 and opposing the remaining bills. This is the 4th time I've given testimony in opposition to what are, in substance, the same bills, and I truly resent having to spend my time fighting for rights the public clearly wants to maintain. The consequences of passing these bills will be devastating for my family and the Commonwealth at large. These detrimental bills would attempt to force and coerce families to violate their autonomy in making healthcare decisions in conjunction with their faith or lose access to a constitutionally protected right to an education. The pandemic proved how harmful a loss of in-person education is to the youth of our nation and how consequential it was and still is for the families trying to pick up the pieces. In past sessions, the rhetoric has always been that we need to protect those most vulnerable in our population. Therefore, we must sacrifice the rights of others. This isn't equality, and it's highly presumptuous in its sentiment that those of us in opposition do not have vulnerable children or family members. I myself have multiple family members that are immunocompromised. We live in a world where risk is a constant. While I truly and deeply empathize with those living in fear, removing the religious exemption or making it difficult to obtain is not going to achieve the kind of compliance proponents are hoping for. It's ironic that outside this very building is a statue dedicated to in memory of Mary Dyer, a Quaker that was hanged in 1660 on the Boston Common for practicing her faith. Her death was a pivotal influence in the legalization of religious freedom in this country. The removal of rights is a key feature of authoritarianism, and if history teaches us anything, it's that it does not look kindly upon those that seek to oppress. Religious exemptions have always been available in our state. The data from our own DPH proves they are not a problem. The proposed bills are not going to achieve a higher uptake in vaccination as the proponents are hoping. What they will do is malign a minority population. Do we really want to create a society that deems it appropriate to discriminate against one another for private medical and religious choices? If these bills were to pass, my family would seriously consider leaving the state. As a concerned parent and citizen of the Commonwealth, I respectfully urge you to vote no on these destructive bills, and please support Bill H2541 to reinforce medical exemptions for the minority population that so desperately needs them. Thank you for your time.
Thank you. Logan Byer. Logan Byer. Welcome.
Good morning. My name is Logan Byer, and I'm here today as a private citizen and a student in our Commonwealth to voice my strong support for the complementary bills H2554 and S1557. I am an MD PhD candidate at Harvard Medical School and the T.H. Chan School of Public Health. In everything I do, my goal is to help keep kids healthy and safe. In my research, I study how we can invest in neighborhoods and communities to improve child well-being, and I am training to soon become a pediatrician. One of the most common jobs pediatricians do across Massachusetts is counsel families on vaccines. On the individual level, vaccines keep children safe from potentially devastating illnesses. And on the community level, high rates of vaccination ensure all people, including those who are immunocompromised or unable to get vaccinated themselves, can enjoy the freedom of good health. A while back, I was speaking with a mom whose daughter was just a few months away from starting kindergarten. I knew this woman well. She was a devoted parent and a pillar in the local community. But when our conversation turned to vaccines, she confided in me that she hadn't yet fully vaccinated her daughter. She'd heard the rumors that vaccines might cause autism and wasn't sure what to believe. When I encouraged her that there was no time like the present to start catching up on missed immunizations, citing the fact that getting up to date on vaccines would be required anyways for her daughter to start kindergarten, she looked at me with surprise, shook her head, and said, "Actually, that's not true. I'm planning to apply for a religious exemption. We don't really go to church, but you don't have to prove anything. That way, I can wait to vaccinate her until I feel sure." Stories like this one add up. Even though no world religions actually forbid vaccines, because let's be clear, a personal religious belief is generally just a personal belief, not a religious one. Misuse of the current religious exemption loophole in Massachusetts policy has led to kindergarten classes across our state with terrifyingly low rates of vaccination. To give just 4 examples, there's a kindergarten in East Boston where the rate of vaccination is only 46%, one in Brockton where the rate is 39%, one in Saugus, where the rate is 37%, and in Great Barrington, there is a kindergarten where only 23% of students, less than 1 in 4, are fully vaccinated. The science is so clear. Vaccines are safe, and vaccines save lives. And in a moment when vaccine-preventable illnesses are resurging in other parts of the United States, high rates of vaccination are one of the most cost-effective strategies we have to keep our communities here in Massachusetts healthy. Bills H2554 and S1557 will close the loopholes in existing state law, finally eliminating all non-medical exemptions for childhood vaccines in our public schools. I urge the members of the Joint Committee to support these bills to keep our communities and our children safe.
Thank you. Any questions? Thank you. Jennifer Falter? Jennifer Falter? Welcome.
Hello, my name is Jennifer Falter, and I'm a mother and a registered nurse here in the Commonwealth. I'm here today to testify in sharp opposition to S1557 and H2554. Article 2 from the Declaration of Rights in the Massachusetts Constitution specifically states, "No subject shall be hurt, molested, or restrained in his person, liberty, or estate for worshiping God in the manner and season most agreeable to the dictates of his own conscience." These bills directly violate that article, forcing residents of the state to choose between their sincerely held beliefs, affording their children a public education would greatly restrain a family's ability to practice their religion in the manner they see fit. This bill is discriminatory against those who have differing religious beliefs, and it's unfathomable to me that in a country, and more specifically a state that was founded by those seeking relief from religious persecution, that we would be facing it in 2025, 400 years later. It's also unconscionable to me that in a state that prides itself on being proponents of diversity, equity, and inclusion, we are proposing to exclude a certain group of people from public education for their religious beliefs. As a registered nurse, my role is to advocate for my patients. The concept of informed consent is fundamental to medical care. It would never be acceptable for a member of a healthcare team to force or coerce someone into accepting a medical intervention that they fundamentally disagreed with. But these bills do just that. They force people to choose between their deeply held beliefs and their children's ability to access a public education. For me, violating my deeply held beliefs is not an option. I would provide my 2 children with an alternative education plan, or I'll simply leave the state. I have resources to do that, but there's many others that do not. These bills will disproportionately affect children of lower socioeconomic status whose parents do not have the ability to provide an alternative to public education, and it will harm already vulnerable children and discriminate against them for their religious beliefs. I was going to speak on Rebecca Rausch's bill, but instead I'd like to make some comments about some things that Representative Vargas has said. He's quoting RFK Jr. like we answer to him. We do not. We answer to God and God alone. Our relationship with him dictates our religious beliefs when it comes to vaccination. He casually mentions that his child had a fever after their vaccinations, like that's the only possible adverse event. He conveniently left before others spoke about the devastating effects that their children had. A couple whose daughter suffered for a decade before succumbing to her injuries, confirmed by the Vaccine Injury Court. Where is the justice for Cecilia? Who will be responsible for that next child that is harmed like she was? Representative Vargas did not even stay to hear her family speak, or any of the families here today. How can he continue proposing this bill when it's been proven that her death was directly related to receiving her childhood vaccinations? How can this committee knowingly move forward with this bill, knowing that this can and did happen to a child? Please do the right thing. Please oppose the religious exemption removal.
Thank you. Julie Deirdrickson. Julie Deirdrickson, welcome.
I just have to log in. Okay. Thank you to the committee members for hearing me today. My name is Julie Deirdrickson, and I respectfully urge you to oppose Bills S1557, H2554, and S1618. I've been a school nurse in Massachusetts for 25 years, and I've seen firsthand that our current immunization policies function effectively. I honestly think it's redundant to keep going back over this issue. Religious exemptions are rare. We have only 4 in my district of almost 1,500. And our existing exclusion protocols allow schools to manage communicable illnesses without forcing our families to compromise their sincerely held religious beliefs. In respect to S1618, I trust that we all agree that allowing minors to consent to medical treatments without considering age and mental capacity is dangerous. We all know this. Children lack the maturity to understand the full implications of medical decisions, especially those that are irreversible. In response to Senator Roush's data this morning, data is a funny thing. And while religious exemption rates continue to hover just around 1% statewide, many of our communities have higher rates of homelessness, migrant and or refugee children who may be considered non-compliant for our current vaccine schedule. These students of ours are rightfully protected under the McKinney-Vento Act, which prohibits them from being denied access to school related to their vaccine status. I'm also actually still seeing some non-compliance from those COVID years when well visits were less of a priority. Taking away the religious exemption will have no effect on these non-compliant situations or the X's on Senator Roush's map. Vaccines may play a role in public health, but defining herd immunity by immunization alone is overly simplistic, and it ignores key aspects of epidemiology. Herd immunity occurs when, either through vaccination or through natural infection, enough people are immune to prevent the spread of disease. Natural immunity can offer long-lasting protection. In fact, the CDC advises that checking for laboratory evidence of immunity is an acceptable alternative to vaccination in its advisory on immigrant and refugee health. By excluding the importance of natural immunity, we dismiss valuable data and we misinform public policy, which is exactly what I believe this bill will do. It makes you wonder, is the intention of the Community Immunity Act to promote health and control the spread of illness, or is it simply to promote vaccines? I urge you to oppose these bills in favor of policies that respect both logical public health initiatives and fundamental human rights. Given that American kids are the sickest in the world, I truly believe we can find a better, more balanced path forward, being mindful of the influence and the profit of the pharmaceutical industry and take into account the foundational importance of nutrition, clean water, exercise, sleep, and stress management for a strong immune system, the true first line of defense against illness. Thank you so much for your time and your consideration.
Thank you. Daniel Seitz on virtual. Daniel Seitz.
I'm here. Can you hear me?
Yes, go ahead.
Great, thank you. Good afternoon. I'm here to speak in opposition to the 3 bills that seek to further restrict and erode parents' rights to make healthcare decisions for their children, namely S1618, S1557, and H2554. And also, I am here to speak in support of H2431. Parents are not stupid, despite what so-called experts often like to imply. They have seen their children getting sicker and sicker and more immune compromised as more and more liability-free, but demonstrably risky vaccines are forced upon their children. In some cases, as you've heard today, children who were healthy and normal one day have been rendered disabled for life. Also, many of us have spent hundreds, if not thousands of hours studying immunology, vaccinology, epidemiology, in order to inform ourselves about these risks and benefits of vaccines. Vaccine skepticism and so-called noncompliance are thoroughly rational responses to the information that we've learned and also to what we've observed. But parents' anecdotal concerns are backed up now by excellent research and scholarship. And just to give one example, Paul Thomas, a pediatrician formerly licensed in Oregon, who believed in vaccines but also believed in informed consent, let his parents choose whether to forego vaccines, go on a modified schedule, or to follow the CDC schedule. And what he found after observations and has published this, is that the children who fared the best were those who were not, who forego vaccines, followed by those who had a modified schedule. And the children with the worst vaccine outcomes were those who strictly followed the schedule. He's published his work, and for his efforts in terms of making this publicly available, was actually lost his license in Oregon. I just want to say a quick word about the bill to prevent people from being forced to get COVID shots. We now know that the information given to the public was false. The vaccines did not stop transmission. They do cause serious side effects. You have an epidemic of strokes among young people, myocarditis. We're seeing now an epidemic in cancer and in excess deaths. So as a result, you now have probably the lowest trust in public health in any time since that has been tracked. The only way you can regain trust in public health, trust in a public process like this, is to respect individual choice and not try to further coerce and force the public into a one-size-fits-all medical procedure. Thank you for your time today.
Thank you. Lindsay Stempniak. Lindsay Stempniak. Alita Dunn. Alita Dunn.
Hello? Can you hear me?
Yes, go ahead.
Hello, thank you. I stand before you as an immigrant who came to this great nation, a first world country, seeking opportunity, freedom, and a better life. I believe in the promise of a society that values individual rights and personal choice. But today, I'm deeply concerned about the Bill S-1618, the Community Immunity Act proposed by Senator Rebecca Rausch, which threatens the very freedoms I came here for. Since 2020, I've watched policies like this chip away at parental rights, treating families as if they can't make informed decisions for their children. This bill aims to end standardized vaccine exceptions and centralize control with the state, stripping parents of their fundamental right to choose what's best for their kids. This isn't just about vaccines, it's about who gets to decide, us the parents or the government. In a first world country abundant in resources and opportunity, why are we facing measures that feel more like control than care? I left a third world country to escape overreach, yet here I am questioning if my family's freedoms are safer than where I came from. This bill assumes parents can be trusted, requiring state oversight and standardized forms for exceptions, as if our choices are inherently wrong. It risks punishing families who, for medical or religious reasons, make different decisions in a nation as advanced as ours. We should empower parents, not undermine them. I urge you to oppose S-1618 and protect the rights that make this country truly great. Let's keep freedom first. Also, the speech of Senator Rauch follows a business speech. We, the parents here, we follow our hearts. What we have, the biggest love that we have in our lives is for our children. One more thing, she never replied when she was asked about liability. Who is gonna be in charge and responsible if something happened to a minor who decides with a doctor without the parental consent about his health, or any treatment? Laws should serve the collective good without disregarding individual freedoms or minority perspective. We are going to feel the marginalized valid in our religious beliefs. My beliefs are not the same than Senator Rauch, and that doesn't mean that my beliefs are wrong. Please stand up. Thank you, mamas, for coming there.
Thank you. Thank you, Leila. Kelly Gallagher. We have Kelly Gallagher on virtual.
Question, there is some people waiting to join the room. Is there someone who can accept people into the room, into the virtual?
Thank you. We will look into that.
Thank you.
Michelle Orfanos?
Yes. Hi, can you hear me?
Yes, go ahead.
Before you start my time, I just want to let you know that the Teams app frequently kicked me off of my laptop and my phone. And so there's got to be a better way going forward. It was very frustrating. I'm glad I'm here. Thank you for giving me the opportunity to jump back in here. So my name is Michelle Orfanos. I've been a nurse for well over 20 years. I would first like to apologize to all these people that have been doing this for, what did they say, 4 to 7 years they've been coming to discuss their sincerely held religious beliefs and the heartbreaking stories that they have. And that they just want the right to choose and to put in a religious exemption, as this state, this country was founded on Judeo-Christian values. It's astounding to me that we are still coming back to this, and it does resurface. And so I would like to go on record to oppose the 3 bills from Roush, Kennedy, and Vargas. I support all of the medical freedom bills and the religious and medical bills for the children in the schools and the entries for the vaccines. What I think was interesting when Rebecca Roush had an exorbitant amount of time, more than we did, and went overtime in the theatrics of her putting that bill forward, she completely lied about the measles, that the children have died from measles. The children had other co-founding issues, and there were medical protocols that were involved in those deaths, had you just taken the time to look at that. So, and she also mentioned the Constitution and how there's a stain on the state. According to Article 2 of the Commonwealth of Massachusetts, we indeed have the religious right followed, and what we say should be believed in when we tell you we have sincerely held religious beliefs. I really hope you're listening. I hope you heard the heartbreaking stories of these parents. That little kid, the little bionic kid. Did you hear her when she said she wants to be treated just like everyone else because she's homeschooled? Please listen to the people that you're supposed to represent. It's important to really do your job and listen to these heartbreaking stories. Last thing I'll say is the only question that they asked Rebecca Roush at the end of her theatrics was an insurance question about money. Shouldn't the real question be, who in their right mind is vaccinating a child against their parent without their parents' consent? I was a student, I was a school nurse for a long time. What does that even look like? How do you vaccinate a child without the parents' consent? I mean, what world are we living in? Please, listen to the people you're supposed to represent. Thank you.
Thank you. Nicole Gentile? Leanne Keneally?
Good afternoon, chairs and members of the Joint Committee on Public Health. Like many others in the room here today, this is not my first year here to speak out against Bills H2554, S1557, and Bill S1618. I wasn't quite sure what I was going to say today. I could have resurrected a testimony from past years. I want to be here speaking from my heart, letting God tell me what to say. The first thing I want to address is some of what Representative Vargas spoke about in his testimony earlier. He talked about the fact that many of us are here talking about our constitutional rights. He also referenced several states, there are 5 currently, that do not allow for religious exemptions. What he did not tell you is that one state, Mississippi, that had removed the religious exemption in 1979 was sued, and was ruled in the favor of the plaintiffs, and they have added back that religious exemption. So there is precedent there that it is coming back in some of these states that had previously removed it. The other thing he did not mention is that when Connecticut decided to remove their religious exemption, they grandfathered in children that already had one on file, a difference in the way that was implemented in that state. I tell you this because you are sitting up there ready to make a decision that affects many people in this room, on the phone, and people that aren't able to be part of this discussion today because we were given 3 days notice. It is the last week of school or the end of the school year for many of us parents. I was at an award ceremony this morning for my children and had to rush here afterward because this is so important. My children deserve an education. My children go to a Christian school. And as we were sitting there this morning worshiping God, I had tears in my eyes thinking that my children may not be here next year because all of you think you get to decide what I do with my children's bodies, and that is unfair, and it is not right. My sincerely held religious beliefs have nothing to do with the government. You can't tell me what is right for my children, and you can't tell me my children are a harm to the other children in their classrooms. My children are healthy. Many of their fellow classmates had the flu several times this year. Mine did not have the flu. They are healthy children. They are not a risk to anyone else. Vaccines work for those that take them. There should not be an issue. We have a 1.2% religious exemption rate. Someone earlier held up poster boards. They're not the issue. 7 times greater is the population of children that have non-compliance. Let's do something for them. Massachusetts is a state that is recognized as a leader in equity and inclusion. This feels exclusive. Please be the state that you claim to be and make sure that you're upholding the rights of all of your citizens. Thank you.
Thank you. Stephanie Quirk. Stephanie Quirk. Boyd Conklin. Boyd Conklin. Brenda Nazario. Brenda Nazario. Julia Murphy.
Oops. Hello, yes, Brenda Nazario, sorry.
Go ahead, Brenda.
Hello, thank you. Thank you, chairs and members of the committee. My name is Brenda Nazario, and I'm here today to express strong opposition to Senate Bill 1618, the Community Immunity Act, and any effort to eliminate the religious exemption for school vaccinations in Massachusetts. I understand that this bill is presented as a public health measure, but we need to look at the facts and also at the unintended harm it may cause to children and families. Removing the religious exemption will not change the convictions of families who use it. Excuse me. These parents will not violate their beliefs. Their children will not suddenly become vaccinated. They will simply be barred from school while still participating in everyday life, including going to grocery stores, birthday parties, places of worship, sporting events, and etc. The risk doesn't go away, it just shifts. Some will express concern about declining vaccination rates, but the data tells a different story. According to the Department of Public Health, the real issue is non-compliance, not religious exemption. Non-compliant students outnumber religiously exempt students by a factor of 7. These are students with no exemption on file, just incomplete records. If we truly care about the public health, we should invest in non-coercive, community-based outreach, especially in socioeconomically disadvantaged areas, not punishing law-abiding families with sincere religious beliefs. Others may say this bill is necessary to protect the medically fragile. As a parent, I care deeply about the vulnerable children. But we must be honest, most medically fragile individuals can still take vaccines according to the CDC guidelines. And those who cannot are already protected under existing medical exemptions and exclusion protocols. Even now, we do not exclude children who are HIV positive, strep carriers, and of those carrying many infections that circulate in schools. And no one proposes that. Because we rightly value inclusion, why not extend that same fairness to healthy children whose families follow the law and hold sincere religious convictions? Some may claim that religious exemption is being abused. That's simply not true. Excuse me. Courts across the country, and just recently, the Massachusetts Supreme Judicial Court have upheld the rights of parents who hold sincere religious objections to vaccination. These beliefs are real and protected. They may involve concerns about aborted fetal cells, animal tissue, and previous vaccine injury. Matters of conscience arrive through prayer and conviction. Finally, many of us now recognize that keeping our kids out of school during COVID was a mistake, one that excluded healthy children who posed no active risk. It caused widespread mental health, developmental, and social harm. Massachusetts already has laws in place that balance public health and constitutional rights. These laws are working. This bill would upset that balance, replacing cooperation with coercion and trust with state control. I urge you to oppose these measures. Let's continue to protect public health without sacrificing civil rights, family integrity, and every child's right to education. Thank you.
Thank you. Julia Murphy.
Mr. Chairman, this is Kelly Gallagher. You called me about 10 minutes ago.
Go ahead, Kelly. And then we have Julia Murphy.
Thank you very
after
much.
you.
Thank you.
I speak not in opposition to vaccination itself, but in strong opposition to the proposed removal of religious exemptions for school-required vaccines. This is not simply a policy debate. It's a test of the values and commitment that guide this chamber and the constitutional protections that define our democracy. We live in a pluralistic society. Diversity does not just refer to skin color or language, it includes beliefs. Real inclusion means making space for religious minorities, not just when it's convenient, but especially when it's uncomfortable. Stripping away religious exemptions sends a clear and troubling message that some deeply held convictions no longer have a place in our public and even private institutions. These bills also raise serious equity concerns. Many families using religious exemptions are not wealthy or powerful. They are everyday people whose faith and traditions guide their medical decisions. Removing this exemption puts them in an impossible position. Abandon your faith or your child's education. And let's be clear, this move is unnecessary. You know Massachusetts has the highest rates of vaccination and the lowest vaccination hesitancy in the country. There is no public health emergency that justifies this erosion of religious liberty. To act as though there is, it would not only be unnecessary, it would be punitive to people of faith whose convictions do not align with the majority. Some argue this is about safety, but compassion must also be part of our equation. We cannot use irrational fear to justify policies that steamroll over sincere, peaceful religious practice. Compassion means listening. It means understanding that public health and religious rights do not have to be enemies. Inclusion means making room for those beliefs in the laws we craft. If we claim to value inclusion, we cannot at the same time legislate people of faith out of the public and private school system. Removing the religious exemption won't improve health outcomes, but it will damage trust. It will alienate communities. It will teach children that conformity matters more than their faith. I urge you, don't take a one-size-fits-all approach to a beautifully diverse population. Keep the religious exemption in place, not because we agree with every belief, but because we agree with the principle that liberty matters. Inclusion without respect for religious beliefs is not inclusion at all. We can protect public health and honor the convictions of our neighbors. That is the true spirit of equity. That is the true spirit of America. Thank you.
Thank you. Julia Murphy. No. Caitlin Gilmay.
Good afternoon, members of the committee, and thank you for your patience today. My name is Caitlin Gilmay. I'm a parent, an advocate, and one of the founding members of Maine Families for Vaccines. I'm here because I know what happens when a loophole in vaccine policy leads to real-world harm, and I don't want any more families to go through what mine did. When my son Thomas was a baby, he got chickenpox, too young to be vaccinated, too small to be safe. Nearly every child in our daycare was exposed and excluded. Most families missed over a month of care. The center lost more than $20,000 and nearly shut down. I was scared for my baby, who developed painful blisters and pneumonitis, and worried we'd unknowingly put others at risk. That experience led me to help pass Maine's 2019 law eliminating non-medical exemptions. Since then, our immunizations have gone up, considerably so. We no longer worry about visiting my father, who's immunocompromised, because we know that our rates are strong. Thomas is 7 now. He understands that Tommy's Law helps make places like his school and Scout meetings safer for every family. We're teaching our kids that community matters and that protecting others is something to be proud of. That's why I support S 1557 and H 2554. Massachusetts families deserve the same peace of mind. Right now, they don't have it. Statewide numbers hide local risks. In some schools, exemption rates top 10%. Parents shouldn't have to guess whether their child's classroom is safe. These bills aren't about belief. They're about accountability. They protect children who can't be vaccinated, not those who won't. And they give schools and health officials the tools to prevent outbreaks, not just respond to them. Massachusetts has long been a leader in public health. Let's keep it that way. Let's protect medically vulnerable children and close the loophole. Thank you for your time and commitment.
Thank you. Aaron Johnson? Aaron Johnson? Olga Nicotina? Olga?
Here. Hi.
Go ahead. Thank you.
Hi, my name is Olga Nikitina. I'm here to oppose Bill S-1618, Bill S-1557, and Bill H-2554. Because if you will pass these bills, that's going to mean that me and my children will have to continue to do the homeschooling. We were homeschooling our kids before COVID and through the COVID, and because that was the true desire of our kids. And after that era was done and our kids expressed wishes to go to school, we sent them in, and we saw a tremendous progress in our kids in ELA and social skills. Even though our kids entered the school in the mid-year, it was still pretty successful. We have strong religious beliefs that's gonna stay with us. And if you will pass these bills, that means that we're gonna pull our kids and continue to educate them at home. Homeschooling was hard, and I would drive 45 minutes one way just to get my kids into co-op in-person class. And I would do the same because I truly believe that this is not for our kids and this is not for our family. Our personal experience with vaccination, we were start vaccinating our older child when he was one month old. And we were told that this is the way how we protect them. So we went to the pediatrician appointment at 1, 2, 4, 6, and 9 months. And that was the only time when our child was sick. He was crying, his feet were swollen from the vaccination. And we were left with the things from pediatrician that said, as long as he's peeing, pooping, and drinking, that should be fine, and this reaction is normal. So we don't want to go over this again. And our child developed a severe allergic reaction at 9 months old, and he was reacting on any food that we would put it into his mouth even before it was normal. It was okay for him. So we stopped vaccinating until we will figure out what's happening. And I was lucky that I was still nursing him and was able to provide food at that time. So I truly believe that this religious belief or any other religious belief that family has should be protected, and we should still be able to access the public education. I also support the bill H-2431 that's going to help us to protect our freedom. Thank you.
Thank you. Caitlin Finn. Caitlin Finn.
My name is Caitlin Finn. I have lived in the Commonwealth my entire life. I have two beautiful children that are the reason why I stand in front of you today. My son has special needs and an IEP with the public school system. My daughter is set to start kindergarten this fall. I strongly oppose bills H2554, S1557, and S1618. They are all ridiculously unnecessary and discriminatory. Massachusetts has the highest vaccination rates in the country. Herd immunity needs 95% or higher. We far exceed that. Instead, we are targeting a tiny subset of kids that only make out about 1% of the school population, which is spread out across the whole state. There is no emergency here. We have always had exclusion protocols that keep unvaccinated children home during outbreaks. Our children are being targeted when there is a huge gap in data that could be focused on instead. Passing these bills will not make us go and vaccinate our children. They will remain in the community but lose out on their education. Does this really align with what Massachusetts stands for? It is far from inclusion and acceptance of others. It is far from not leaving any children behind. I will not stop fighting these bills because my children and all children deserve an education no matter what beliefs they have. It is in the Massachusetts Constitution that every child has a right to an education. A large percentage of special needs children will be affected as well if these bills also go against FAPE law. The Community Immunity Act is also problematic as well. It makes it nearly impossible to obtain an exemption, requiring a doctor to sign off on it, which majority will not agree with. It allows minors to consent to a broad range of procedures with no criteria for maturity or risk-benefit understanding. It also targets unvaccinated children and will pin them against their peers. I am a practicing Wiccan. I do not have a church. It is a personal religious journey. I do not have a leader. Blanket religious statements made today do not include people like me. The system that we have in place now is not broken. It balances protection and freedom in the best interests of all children. There is no need for these bills. Please stand with all children and protect their right to an education. Thank you.
Charlotte Vanderzicht. Charlotte Vanderzicht. No. Renata Letanowaska. Sorry if I'm getting that wrong. Renata Letanowaska. James Cormier. Welcome.
Good afternoon, Honorable Chairs Driscoll and Decker, and Honorable Committee members. Thank you for staying. My name is Dr. James Cormier. I'm a native Massachusetts resident. I live in Ashburnham. I'm speaking today on behalf of my wife and my two children. I'm here today testifying in opposition of bills H2554, S1557, S1618, and I am in support of H2541. I am in favor of keeping the religious exemption to vaccination for Massachusetts. I believe the law has been around for 50 plus years, and it was a factor in my decision and my wife's decision to move back to Massachusetts to raise our family. In my opinion, this law strikes a fair balance between respecting religious freedoms, individual rights, and public health. The current law has provisions built in to help reduce risk. The provision is as follows: if there's an emergency or an epidemic of a disease declared by the Department of Public Health, anyone using the exemption must self-quarantine. Self-quarantine is a proven mechanism to reduce the risk of spreading disease. Now, 20 years that we've used it in our family, can you guess how many emergencies or epidemics there have been? 0. So. Vaccination is a medical procedure designed to help reduce the risk of spreading disease, but it's not absolute. Disease outbreaks have and can still occur in populations where everyone is vaccinated. Some vaccine outbreaks, or some outbreaks, are caused actually by the very vaccine, the virus in the vaccine, like measles, what happened in California a few years ago. Many of those cases were actually the strand of the virus that was from the live virus from the vaccine. So no vaccines are 100% effective for every individual. Some people don't become immune after vaccination for a number of reasons. And the artificial immunity acquired from vaccinations can wane after time compared to natural immunity, which has always been considered superior to artificial immunity. Some people have serious adverse reactions to vaccines. I personally have concerns with the use of fetal cells in vaccines and concerns about bodily autonomy. So vaccines are not without its own risks and concerns. Passage of these bills would result in severe hardships for a small population that use these exemptions. However, they would not improve public health, and they would actually increase the distrust of our government. I really do not want to have to move away from Massachusetts. I respectfully ask this committee to reject these proposed bills that aim to remove the religious exemption. The current law continues to be effective in achieving a good balance between respecting religious freedoms, individual rights, and achieving public health. Thank you.
Thank you. Allison Chapman. Allison Chapman.
Hello, thank you. Good afternoon, Chairs Driscoll and Decker and the members of the Joint Committee on Public Health. Thank you for hearing my testimony. My name is Allison Chapman, and I'm here in opposition to H 2554, S 1557, S 1618, and in strong support of H 2541. Last Sunday, my family witnessed the hellacious sight of my 25-year-old son experiencing the worst grand mal seizure you've ever seen, foaming at the mouth, jerking arms and legs, frothing. Sorry. While the world moves in slow motion around you, you are helpless. All three of my children, my late mother, experienced serious adverse events to their vaccinations. My son's body and his brain are still paying the price. I am not anti-vaccine. I hate that term. I am not anti-vaccine. I'm an injury advocate. I'm a Catholic. And where science abandoned my children, my faith protected them. My oldest had convulsive episodes where she couldn't breathe within 1 hour of her 4-month shots. She continued to do it in her sleep for 6 months after. My son, within 48 hours, spiked 105-degree temperature, full body rash, screaming GI pain, began having absent seizures that were finally managed and under control for 15 years until last Sunday. My youngest turned purple, choking, and required the infant Heimlich after the vitamin K shot. I asked doctors for help, but they had no training in vaccine injury. They do not do training in vaccine injury. So I got on my knees and I prayed. I read a 2004 letter from Pope Benedict who said that when your conscience is informed and you must take an exemption, you must dedicate time to make change. So I did. I wrote letters, I testified, I went and met with every legislator I could possibly meet. And I talked with scientists to study my children and others like them. But instead of real answers, we received a lot of epidemiology. That's really important to know here, epidemiology. When your child is sick, you do not take them to an epidemiologist. You take them to a doctor. You ask them to take your blood, urine, stool, find out what's wrong with them. You do not tell them to go look at the population. In 2013 to 2014, a JAMA study showed that all children under 5, in this particular study, the second most common reason for them to go to the ER from a drug adverse event were vaccinations. At a rate of 2.1%, this particular JAMA study came out with. Harvard Pilgrim showed 2.6%. These are immediate reactions, but we don't do long-term or cumulative effects because those studies were never done. We are medically under-exempting our children in Massachusetts, and we have failed to ask the right scientific questions. We cannot keep children out of school. I think we've learned that lesson during COVID. And I know you guys didn't experience what I did. I know you can't really understand it, but please hear my story. It's real. There's no lies. My girls both just graduated college, magna cum laude, after being on IEPs their whole lives. My son is now a speller. He was hidden. His language, he couldn't tell you what he was thinking or feeling until he was 23, through spelling in the air. I believe in public education, and every kid deserves an education. This bill would make kids like them be denied an education. Begging you to please vote no on this. Thank you for hearing me.
Jody Chapin. Jody Chapin. Jody Chapin. Esme Von Hoffman. Esme Von Hoffman. Welcome.
Dear honorable committee members, I'm Esme Von Hoffman for Massachusetts. I've worked as a journalist in the past and have a background in investigative work. I am here in a personal capacity, but I have used investigative approach to do my research presented here based on documentation and public records. I will present to you what I found from documents I've uncovered to this date. The Safe Communities Coalition and Action Fund lobbying for bills S1157 and House Bill 2554, which in fact, according to a website which they fund, they refer to as, quote, our landmark bill. This organization's Safe Communities Coalition and Action Fund is not Massachusetts-based. Rather, it was founded as the Safe Action Fund in 2020 in Colorado and has since moved its headquarters to Portland, Maine, where its executive director is North Saunders. The Safe Action Fund is a registered foreign corporation in Massachusetts as of April 7th, 2025. So all its officers and directors are based in Maine, but it has one member, Catherine Blair, who is a registered agent in Massachusetts. Safe Action funds a website called Massachusetts Families for Vaccines, although it is not an officially registered organization under that name, according to my research. So to recap, Safe Action Fund is a Colorado-funded, Maine-based organization that is registered as a foreign corporation in Massachusetts using Catherine Blair as its agent. They fund a website called Massachusetts Families for Vaccines, which Catherine Blair has said she leads. Now I'd like to talk to you how it appears that Big Pharma is funding Safe Communities Coalition and Action Fund, who in turn funds Massachusetts Families for Vaccines. According to Safe Communities Coalition website, which is copyrighted by the Safe Communities Coalition and Action Fund, their partners include Merck, GSK, Moderna, Sanofi, CSL Seqirus, and Immunize.org. The Maine-based North Saunders, who is the executive director of Safe Communities Coalition and Action Fund, is a regular speaker for the Minnesota-based Immunize.org's webinars and will speak at their upcoming 2025 conference. Immunize.org's funders, according to their website, include big pharmaceutical companies like Bavarian Nordic, CL Seqirus, Dynavax, GSK, Merck, Moderna, Novavax, Pfizer, Sanofi USA, Valvena, and VBI Vaccines. Immunize.org's corporate members include all of the above companies and AstraZeneca. So in conclusion, these organizations and companies behind writing and pushing these bills, S1557 and H25547, restricting religious freedoms in Massachusetts, are not homegrown, independent Massachusetts entities, but rather they are supported by national and international corporate interests which have a clear financial stake in the outcome. Thank you for your time.
Thank you.
Hi, this is Julie Capitello. I was called about an hour ago.
Any questions?
Is it possible to testify?
Any questions? Okay, thank you. Bonnie Manila? Bonnie Manila? Lisa Geiger?
All right.
You're on.
Hi, I'm here.
Oh,
Bonnie Manila.
Bonnie, go ahead, and then we'll take Lisa after you. Bonnie, you can go ahead.
I can't hear anything.
Bonnie, can you hear us now?
Hi, can you hear me?
Yes.
Oh, I can't hear you, but I'll go if you can hear me. Oh,
You can go ahead. We will circle back to Bonnie. Do we have Lisa? All right, Lisa, welcome.
thank you very much.
You guys freezing? Just checking. All right, ladies and gentlemen. Thank you, chairs and members of the committee. My name is Dr. Lisa Geiger. I strongly oppose the Community Immunity Act and any effort to remove religious exemption for school vaccinations. Now, you've heard claims that vaccinated students pose a threat to those who are medically vulnerable, but that argument ignores both science and reality. Any student who is truly at risk from a vaccine-preventable illness is equally at risk for the other 54 that don't have vaccines, many of which are endemic and common in school environments. They circulate like mad, and these include strep and RSV and norovirus and others that circulate widely and without restriction. So let's be honest, a school is not a controlled clinical setting, especially at the end of the school year, yeah? And it is an unpredictable environment with constant exposure to a range of illnesses. And that is why every state, including Massachusetts, offers home and hospital instruction for students who are immunocompromised or medically fragile. And this is not discrimination, it's appropriate medical accommodation. Now, responsible physicians and parents would not place a severely immunocompromised child in a setting where dozens of unpreventable diseases are routinely transmitted, regardless of whether they're vaccinatable or not. To scapegoat religious families who make up just a small percentage of the school population for hypothetical risks is not only medically unfounded, it is discriminatory. It's discriminatory. And these families already comply with exclusion during outbreaks and act responsibly within the framework of the existing public health law. They are not a problem. My son has autism and is unvaccinated and had to stay home. The only time he's ever missed school was because he had to stay home because the other kids were sick. He is a healthy little puppy, and I'm proud of him. The real risk is not unvaccinated healthy students. It is using fear to justify exclusion even when no outbreak exists and even when medical realities don't support it. And that's what these bills do. They weaponize policy against a minority of families, and they deserve better. We can do better. Do you think? And this is weaponized policy is against a minority of family with sincerely held beliefs. It's not a capricious thing. This does not come easy. You walk long on your knees for this sometimes. Public health must be based on truth and not on political inconvenience and convenience. I urge you to vote no on both the Community Immunity Act and any attempt to remove the religious exemption. We can protect the vulnerable students without sacrificing rights, without sacrificing inclusion, without sacrificing integrity. I was really impressed with the word strict security, scouting, scrutiny, testing. That you have to go down the road and really see if this is a problem, if these particular diseases are a problem or not. And we found that I think the general consensus is I think we can do better by our citizens, by our children, by ourselves. And if anybody would be willing to contact Senator Roush and just let her know this, because I know she left after she talked her piece.
Thank you.
I would be appreciative. Thank you.
Thank you very much. Jessica Britton. Jessica Britton. Shannon Murray. Shannon Murray. Try Bonnie again on virtual. Bonnie Manila.
Hi, Shannon Murray, I'm here.
Oh, Shannon, go ahead.
Yes. I am here to strongly oppose Bills 2554, S1557, and S1618 regarding childhood immunizations and the community immunity. Proponents of these bills argue that removing religious exemptions is necessary due to declining vaccination rates in schools. However, according to the school immunization data on mass.gov, Massachusetts has one of the highest vaccination rates in the country at 96.3%. The remaining 3.7% includes both religious exemptions and non-compliance, such as incomplete records. Religious exemptions account for only 1% of students. The push to eliminate these exemptions assumes that families with deeply held beliefs will simply comply under pressure, but history tells us otherwise. In California, after the removal of non-medical exemptions in 2016, homeschooling rose by 78%. Public school enrollment dropped by 6%, a loss of 400,000 students. New York saw a 101% increase in homeschooling after eliminating religious exemptions in 2019. In Maine, homeschooling increased by 57% and public school enrollment declined by 5% after similar policy changes. These shifts do not stop at the classroom. Forbes, citing U.S. Census data, reported a troubling exodus from California. 100 people leave for every 46 who move in. 2018 to 2022, over 350 companies relocated out of state. New York saw 8.2 million residents leave in 2022 alone. While not solely caused by exemption laws, government overreach, including policies like these, clearly play a role. As a homeschooling family by choice, I can say with strong confidence that homeschooling is not for everyone. No family should be forced into it because the state refuses to respect their religious convictions. That's coercive, discriminatory, and deeply concerning. Targeting just 1% of the student population with these bills suggests that not a public health crisis, but a troubling level of government intrusion into personal and religious freedoms. The First Amendment guarantees freedom of religion. Forcing families to choose between education and faith is wrong, unconstitutional, and ineffective. We must learn from the outcomes in other states. Removing religious exemptions has not meaningfully increased vaccination rates, but it has driven families out of public schools and even out of the state. Please consider the broader consequences before moving forward with these bills. Thank you for your time.
Thank you.
Bonnie Manila is here. She can speak now, if that's okay.
Is in the room?
Yeah. I can wait. I was just letting you know
Step
my
right
phone
up.
was calling. Thank you. Sorry, my phone was having issues before. So I am also in opposition of the Roush and the Vargas bill, and I support Representative Soder's bill. Sweetheart, you need to go over there. This is my fourth time testifying on these two bills specifically, but it isn't just about 4 hearings. It's about 6 years of constant stress, vigilance, and fear for the future of our family. These bills have reshaped our lives since my oldest was only 3 years old and he is now 9. Since then, we've lived under a cloud of uncertainty, constantly questioning whether our children will be allowed to participate in school like every other child. Our local elementary school principal once assured us everyone is welcome here, but when we explained why we were proactively pulling our children out due to the looming threat of exclusion, she was shocked. As homeschoolers, we've made the best of it. My kids received IEP-based speech services and they have truly thrived. We're part of a strong, supportive community. But let me be clear, homeschooling is not an easy or universal solution. It comes with real sacrifices, especially in a state where 2 incomes aren't just common, they are often essential. We've given up careers,
Others have navigated special needs with limited support. Why would we force families into this corner? Because these bills do force families, including our most vulnerable, to choose between their religious beliefs, their children's education, and their safety. It's unacceptable. The same lawmakers who have ensured kids can eat lunch at school are simultaneously working to push them out of school entirely. It makes no sense. My kids participate in sports and want to go to high school and college someday, despite our success in homeschooling. Let's not pretend these bills make children safer, because they don't. The numbers simply reflect less kids. And don't tell me my religious beliefs aren't valid because they lack official approval. That's like saying you're not American if you didn't vote for the current president. Our beliefs are sincere, they are deeply held, and we will not abandon them. We're not alone. Many families have already left Massachusetts, a state founded on religious freedom. Despite the long day today, you may notice the crowd is smaller. Some couldn't make it on short notice. Others have given up, believing this committee doesn't really listen to its constituents, but instead to out-of-state lobbying groups actively working against us. There's a fine line between legislative persistence and targeted harassment, and we have crossed it. Massachusetts has long balanced public health with religious liberty. There is no justification to change it now, any more than there was 6 years ago. I urge you, please do not pass these bills from committee. Thank you.
Thank you.
All right,
Audrey Fox. Audrey Fox. Janelle Susia. Janelle Susia.
Here. Yep.
Go ahead, Janelle.
Here. Okay. I'll be quick. Hello, my name is Janelle Susie. I'm from Belchertown. I'm opposed to the Community Immunity Act and the bills that remove the religious exemptions. I'd like to start out with a prayer. Father God, we pray for the members today and the bills before us. We pray that our representatives understand the profound and negative impact these bills will have on the most vulnerable and innocent among us, our children. We ask that they hear and value our sincere concerns and pray that they are steadfast and courageous in rejecting these bills. We ask this in Jesus' mighty name, amen. I have 2 daughters, ages 29 and 31. I abided by the vaccine schedules, and unfortunately both my daughters were vaccine injured. My eldest had a febrile seizure, which landed her in the hospital at 18 months old, just days after the DTaP vaccine. Ironically, she contracted whooping cough, yet had the pertussis vaccine. Her pediatrician said that happens sometimes. I asked the doctors, could the seizures be from the vaccines? Oh, no, not the vaccines. My youngest, on August 1st, 1996, at just 2 months old, received DTP along with influenza B and polio, all on the same day. Then on October 1st, 4 months old, received again DTP, influenza B, and polio. And on December 1st, 6 months old, she received again DTP, influenza B, and polio. Suddenly, this perfect baby who was always laughing and never cried, she was different. She was losing weight, crying a lot, saying, "Mommy, it hurts," but she couldn't tell me where because she was 22 months old. After many doctor's visits, we finally discovered she was a type 1 diabetic. That's an autoimmune disease. Her body attacked and destroyed her insulin cells. What on earth could have triggered that? Again, I asked, could this be from the vaccinations? The answer was a little different this time. It was silence. It stands to reason that injecting a baby with 15 shots mixed with viruses and toxic adjuvants in a 4-month span could have created an autoimmune disorder resulting in type 1 diabetes, which is also on the inserts. As I did more research, I discovered with absolute horror the ingredients that are in the development of the vaccinations, including fetal cells. Not only is this against my faith, but I detest the thought of another human's DNA injected into my children, hence the onslaught of autoimmune disease. With this information, I opted her out with a religious exemption. Today, if one of these bills were approved, I could be reported for protecting my child. From my experience, not one size fits all. We are all individuals. For some, taking a particular vaccine is like playing Russian roulette that could impact and ruin their lives forever, especially those who are already compromised. For some, the benefits do not outweigh the risk. In closing, we must never be forced with our education, livelihoods, or freedoms to choose. One day you and your loved ones may find yourselves where we are today. What will be your legacy? Will you succumb to the pressure of evil? Because this is what it is. Or will you be strong and courageous and protect your constituents, your family members, and their future generations? I'd just like to add that the Vaccine Injury Court has paid out to date $5.4 billion in vaccine injury and death. Thank you.
Thank you. Ann Harding. Ann Harding. Melissa Mignosa.
Hello, Chair. Hello, Chair Decker. Can you hear me?
Yes, go ahead, Ann.
Oh, sorry. I'm on the T. I'm heading to the State House. I'm testifying in person. That's okay.
Would you like to go? You're on the T?
Yeah, I'm on the T,
All right,
so it's very noisy.
we'll circle
right?
back to you, Ann.
Awesome. Thank you so much.
Melissa Mignosa. Ashley Makaridikis. Not going to get this one, I'm sorry. Makaridakis.
Makridakis, yes.
All right. Welcome.
Hi. Yes, thank you. My name is Ashley Makridakis. I live in Sudbury, and I am the mother of 4 healthy children. This is now my 7th time testifying against these bills, and in past years, I have peppered you with statistics pertaining to these cases. But now I will pivot and channel my former professional cheerleader and infuse a morale-boosting, empowering angle in my testimony this year. So I want to begin by echoing what my Lord and Savior Jesus Christ says in the book of Matthew. I have not come to bring peace, but a sword. I will not back down in my sharp opposition of bills H2554, S1557, and S1618. I will speak even when my voice shakes. These bills are motivated by a personal agenda and fear-mongering, not public safety. This is supported by religious exemptions making up less than 1% of school kids, yet the larger 4.1 of non-compliance children are not. And yes, this is an attack. Vaccines are not a one-size-fits-all thing. If safety was actually a precedent, then why isn't there proper screening done for kids with vulnerabilities to vaccine injuries? Where there is a risk, there must be choice, and coercion is not consent. May I remind you that Massachusetts is the birthplace of the revolution. We are Massachusetts residents. We have a spirit of fight and resistance. We have rebellion in our blood. We will fight these bills. My ancestors who came here from the Mayflower fought oppression, and I will do the same. Their blood runs in mine, and I will fight. True health does not come from forcing vaccines with risks on kids and threaten to take away their right to an education. You want to talk about adhering to public health? Why are you obsessed with tacking the less than 1% of kids on religious exemptions and not addressing the fact that 30.1% of Massachusetts children are clinically obese or overweight? These bills aren't motivated by wanting to keep the public healthy and safe. It is an attack on our personal beliefs. Let me be clear, we will not comply. I will not compromise my maternal instincts, my religion, or my constitutional rights, and offer my kids up to be subjected to the severe risk in the name of what these senators define as public health. I assure you of this. We aren't just going to trust the information handed to us by the people who directly benefit from our compliance. We cannot force vaccines with pamphlets full of risk onto children. I end with Matthew 18:5-6, and whoever causes one of these little ones to stumble, it better be to have them a millstone around their neck and thrown into the sea. His words, not mine. Like my Jesus said, I will advocate to protect these little ones, my little ones. Thank you for your time. Jesus is King.
Thank you. Stephanie Tamby. Robert Mitchell. Richard.
Hi. Can you guys hear me?
Yes.
Hello? Oh, this is Rocio Collado. I was called a couple of hours ago and I had the hardest time unmuting and I've been trying to get in. So I know I missed my time 2 hours ago, but I just wanted to make sure that you're aware that I am here now.
Okay, we'll try and circle back. Thank you.
Thank you.
Richard Mann. David Cromwick. Oh, here we go. Thank you. Welcome.
I don't have too much to add to the wonderful testimonies of many people on the opposition to the S618 and 18 and 1557 and House 2554. In terms of supporting the House 2431, and when I see a statement in here about the requirement of COVID-19 vaccines, that brings a very strong warning. I've been looking at the whole concept of vaccines for mRNA in general and for COVID, and basically those vaccines are bioweapons. If you look at a gentleman by the name of Francis Boyle, who passed away about 6 months ago, he's the gentleman who, a lawyer who crafted the bioweapons laws for the country back in the Bush 1 regime. He had looked at stuff in Vietnam and bioweapon use in our country and then in the Gulf War. And he sees the COVID vaccines as bioweapons. And I mean, the guy who wrote the law, and that's it. So the state should not be at all involved in promoting the COVID vaccines. They're just, they impact a person's life, and there's just a lot of problems with it, and I won't go further with that. But I was sending online some stuff to you, and you should look at it, but I can't, beyond that, I'll just leave that is what I've said now. Thank you.
Thank you. Thank you for your testimony. The mention of written testimony is a good segue here. Next up, I have Kristen Lewangnag. Kristen? Oh, David Cromick, I'm sorry. Yeah, but as you make your way up, just a time check. We have this scheduled until 5 o'clock today. So if you have testimony that you'd like to submit, just a reminder, you can submit it to matthew.murphy@masenate.gov. And we'll do our best to get as many people in as we can. If you'd like to, cede time to the next person on the list, you're more than welcome to do that. I'd ask, too, that as you do continue testifying, if you have new information, new things you'd like to add versus reiterating things that have already been mentioned, certainly welcome for the committee members as we consider all of this. But again, just a quick time check. We're getting close to the 5 o'clock hour here, so, sir.
Are you going to get to everyone? I'm so sorry to interrupt.
Sorry. Yeah, please mute your mic. Thank you. Go ahead, sir.
Yeah,
I've
thanks.
been on for 8 hours.
So we do not know enough to justify almost anything we believe. And I think you'll understand what I'm saying there is, I'm a Mass resident taxpayer. I oppose bills H2554, S1557, and S1618. I'm opposed to government overreach, and I support the family to make decisions for their children. Relative to vaccines, I was a fan of vaccines until COVID. And during COVID, I started asking questions. How could they tell us a vaccine is safe and effective after 3 months of clinical data. So as an engineer, I said, I'm going to start doing some research here. I started looking at the clinical data from Pfizer. I started reading books. I'm going to make reference to a couple of those. And my family decided, you know what, this vaccine's not safe enough. I can't trust that. How can they tell me that it's safe and effective with just 3 months of data? So we didn't get the vaccine. Then I continued to do further research, and is anybody here familiar with the VAERS database? Okay, if you looked at the vaccine adverse event reporting system, right? We had, since 1990, that's the inception of this database, 2,669,318 adverse events in total. The COVID vaccine alone, 1,663,522 adverse events attributed to the COVID vaccine. 49,567 deaths total since the inception of this database. 38,000, this is from yesterday because I pulled that out yesterday, 38,615 deaths due to the COVID vaccine. Tell me, how could we still be pushing this COVID vaccine, which I call the poison shot, when we have that data? If that's not a signal, then I have no idea what the government's doing anymore. It's just ridiculous. So what is the objective? This committee, what is the objective? Healthy children. As a result of this, I've read books called Turtles All the Way Down, Vaccine Data and Myth. Has anybody read that book? Are you familiar with that book? Anyone? Okay, I recommend you read that book, because after reading that book, guess what? I was for a vaccine. Now, I would not get one vaccine. If my daughter just had a baby girl, she's not going to get her child vaccinated, because I don't believe there's such a thing as a safe and effective vaccine if you read that book. Another book, Vax Facts by Paul Thomas, this gentleman made a reference to it. He basically said, he's a pediatrician, over 20 years of experience. I mean, he's seen it all. He says, you take a vaccine, you're playing Russian roulette. So if you have children, do you want to play Russian roulette with your children? I don't. Number 3, Vax Unfacts. RFK Jr., Robert Hooker. That person, Dot Vargas, who said, RFK said that vaccines are safe. You know what? That's BS. He wrote that book, Vax Unvaxxed, and the bottom line is the healthiest children on the planet are those that don't get any vaccines. So I challenge everyone, do your homework. Do your homework. Because this idea of experts, now you understand what I'm saying. We don't know enough to justify anything we believe.
Thank you.
Thank you.
Thank you. Kristen Lewenag. Kristen?
Have you called Sean Nelson yet?
Brian King?
Thank you, committee, for hearing my testimony. Thank you for your patience, and thank you for allowing everybody here to speak in time and letting them go over time if they do need to. I appreciate that. My name is Brian King. I'm a father of 3. I'm here to express my strong opposition to the Community Immunity Act, as well as any effort to eliminate the religious exemption for school vaccinations. When I first learned about these bills and the arguments being made in their support, I wanted to understand the facts for myself, and as a parent, I take these issues seriously, so I turned to the data. What I found was deeply concerning. My testimony today is based entirely on public data available from the Massachusetts Department of Public Health, as well as the Department of Elementary and Secondary Education, and it directly contradicts many of the claims made in support of these bills. So in fact, the statements are not just misleading, they're actually simply false. So as supporters of these measures frequently claim that the vaccination rates have recently declined. This is false. The fact is that DPH data shows vaccination rates at all grade levels remain high. There is a slight decrease in kindergarten MMR vaccination during the COVID lockdowns, but due to access to limited care. But rates have recently recovered and remain high at all grade levels, as shown here. Supporters also claim that kindergarten vaccination rates have declined. However, DPH data also shows that precisely the opposite of this. Kindergarten immunization rates for all vaccinations remain high and actually increased compared to prior years. So given these high vaccination rates that are increasing, I have to ask, why are we here again to oppose these bills? These bills are an attempt to fix a problem that doesn't exist, and with a solution that infringes upon the constitutional rights of people to practice religion freely and to a right to an education. Next one. So supporters also like to blame children with religious exemptions as the reason for pockets of under-vaccination where they do exist. The fact that the primary driver of lower vaccination rates is actually noncompliance, as we heard several times today, not religious exemptions. Noncompliant students, as you know, are students that do not have all the required vaccinations, but they also do not have exemptions. Data from the DPH and the DOE show that the schools with the lowest reported kindergarten MMR vaccination rates, were the top 10 shown on this chart, only 7 students had exemptions and 181 were non-compliant and had no exemptions. So I strongly encourage the committee to review the data, and which is clearly established that there is no vaccine uptake problem in the state of Massachusetts. Non-compliance is an issue that should be addressed with the suggestions that have been proposed to the committee today with other testimony. This proposed legislation is unnecessary and should not be moved sent to study. So I ask yourselves, are you willing to infringe on the rights of people and to practice religion freely and to right to an education for a problem that doesn't exist? I certainly hope not. Medical interventions, and including vaccinations, is not a one-size-fits-all solution, and legislation should also not be one-size-fits-all. Thank you very much.
Thank you. Michelle Freitas and Maverick Freitas. Welcome.
Hello, chairs and other standing members of the DPH. My name is Michelle Freitas, and I'm a Christian mom of 2. I'm here with my son today, who's also standing up for his freedoms. I'm here to oppose the Community Immunity Act and both Vargas bills to remove the religious exemptions. If these bills were to pass, this would have a real impact on our family. Our family already homeschools, but I can't say that's forever. Our family already sacrifices in so many ways to make homeschooling possible. Why are we targeting and discriminating against those of us with true held religious beliefs? Why are you robbing my children of their right to an education or options to educate? We homeschool our children to be able to teach them the Bible and center their education around it. It's hard. It takes sacrifice. This bill unfairly targets families like us. This country was founded on religious freedom, and here we are fostering religious intolerance under the guise of public health. What happened to inclusion and equity? We're supposed to be a state which is inclusive to everyone in every walk of life. So you are saying, oh, just them? They don't matter? How is that not hypocritical? If these bills were to pass, where does it end? Children don't just disappear if they're excluded from school. They will still be at sporting events, birthday parties, church, grocery stores, and playgrounds. Where will it end? What other rights will be taken next? They are not just little petri dishes filled with disease roaming around trying to spread things. They are healthy children, the youth of America who deserve a chance at an education just like all children. Plain and simple, healthy children should not be banned from school just based on their religious beliefs and vaccination status. We know all too well that keeping kids out of school does what keeping kids out of school does to their mental health through COVID, and I'm sure we don't want to do that again in any capacity. This small minority group will not change based on law. We will not all of a sudden go against any religious convictions and follow discriminatory law. There is only one God I will bend the knee to, and it certainly is not the group of lawmakers standing before me. It is Jesus Christ, my Lord and Savior. We will not comply, and I will not co-parent with the government. I strongly oppose these bills. Thank you for your time.
Hello, my name is Maverick Freitas, and I'm 11 years old. I live in the town of Carver and just finished 5th grade as a homeschooler. I'm here today opposing the Community Immunity Act and both Vargas bills. My mother started attending these sections 6 years ago, and I piqued my interest in politics. Seeing her fighting bills, writing emails, making phone calls, sacrificing so much time and praying really showed me that you can make a difference on a small scale. My mother is fighting the good fight to protect my rights and my opportunities right now so I don't have to. I am a Christian who loves the Lord, and I don't understand why we are even here arguing about taking away a God-given right over our bodies. Man did not give us a body of sovereignty. God did. I myself am a vaccine-injured child who would not qualify to get a medical exemption, and you are telling me I can't attend school anymore based on my belief in God? I'm a homeschooler now, but what if I want to go into a trade or learn about a subject I would have to attend school for? I'm not worthy to do... Am I not worthy to do that because I am a Christian? This country was founded on freedom to practice religion. We are in the great state of Massachusetts, where all began, seeking religion freedom. I am interested in politics because it is a way to serve people and to listen to their concerns and create change. I pray you all are listening to what we are saying. I sit before you today so you can see the face of someone you are personally affecting. An 11-year-old boy who you would be fine with just tossing to the side based on who I worship. A child you are willingly discriminating against to move up the political ladder. I'm taking this position as a legislator. You promise to listen to us, each and every one of us. You have a constitutional duty to not discriminate against us and allow us access to an education. I'm standing here today saying no to each one of these bills. Thank you for your time.
Thank you. Carrie Baldwin. Carrie Baldwin.
Thank you for having me today. I'm a lifelong Massachusetts resident. I'm from Northampton, Western Mass. I only got honked at once for driving too slowly on the way here, so I think I did pretty well. I am a registered Democrat. I'm an applied statistician and an educator with 20 years of professional experience. I'm a lecturer in data science, currently serving the Commonwealth. The views I'm expressing today are strictly my own. I strongly oppose H2554, S1557, and S1618. They appear to violate the First Amendment's free exercise clause, rest on unsupportable claims, and ignore evidence that stricter mandates fuel vaccine hesitancy. The sponsors advance an agenda that is emotionally driven and happens to align with the pharmaceutical industry rather than constituents' rights. Others have covered the constitutionality issues around the removal of the exemption very well. I would ask legislators to carefully consider their votes on these bills, demanding that their proponents provide statistically reliable proof of concept that these bills would meaningfully improve public health. You will find that, as we have seen, they can't. Instead, they will provide dramatized anecdotes to appeal to your emotions. It's alarming to hear lawmakers like Senator Roush use well-known propaganda techniques to attempt to preemptively discredit the people who oppose these bills. This callous disregard is unacceptable coming from a public official. How could you possibly know who is in the room and what they know? Many of the people here have done more research than most doctors on the topic of vaccines. I would put my money on any of the people who came here today to oppose these bills against the doctors who repeat the safe and effective propaganda without details. We've heard from a number of physicians today. I would ask lawmakers to avoid relying on their testimony exclusively and instead consider all of the testimony you are hearing with equal weight and take the necessary time to satisfy yourselves that you understand the complex landscape of this vaccine conversation. The physicians who have spoken in favor of these bills oversimplified the issue, repeating a familiar narrative without proof. Doctors are not infallible. I know this because I teach them. I teach many of them when they apply to become hospital administrators. They make mistakes just like anyone else. I know this. I grade their exams. They confuse correlation with causation, and an example is assuming that stricter vaccine mandates improve public health. They extrapolate findings beyond the scope of the data. After the failed COVID vaccines that thousands of vigilant independent researchers have shown did far more harm than good, physicians who jubilantly administered these injections don't have a good track record. They have shown that they are more inclined to follow the unsupported directives than rely on their own research and intellect. Please oppose these bills.
Thank you. Laura Friedland Case. Laura Friedland Case.
Hi there. You guys are doing an amazing job of sitting through much testimony, so I appreciate it. I'm going to focus on one thing. Somebody mentioned the book Dissolving Illusions, and I want to talk about that because I want to challenge a little bit the dogma around vaccines being the most amazing medical miracle. Maybe they are, but we should also be considering other viewpoints, and Carrie just mentioned correlation and causation. Dissolving Illusion points out that mortality from infectious diseases was declining precipitously before the substantial rollout of vaccines, of the vaccine programs. And that was because of improvement in sanitation, nutrition, and living conditions. Dissolving Illusions describes that in the 1800s, living conditions were very, very bad. There was overcrowding, access to water and food, good water and food was limited, work conditions were brutal, and people were weak to begin with because of their hard, hard lives. So they succumbed to infectious diseases easily. With the improvement in sanitation and nutrition and living conditions, there was less mortality from infectious diseases. So I know that's pretty radical to say, but I think it's important in these conversations to hold the idea that we can look at different possibilities and not discount them. So anyway, that's, I think, the main point that I want to say, and I want to not take a lot of time because I want people to get to their chance to talk. So I appreciate you guys. Thanks a lot.
Thank you. Renee Souza. Renee Souza. Jenna Reedy. Jenna Reedy. All right. Jenna. Welcome.
Chairpersons and members of the committee, my name's Jennifer Reedy, and I stand before you today as a mother, a taxpayer, and a citizen deeply concerned about the harm these proposed bills will inflict on families like mine. I work hard, pay taxes, and like many families in Massachusetts, I do so with the understanding that our government has a fundamental obligation to educate all children, regardless of income, ability, or background. Yet these bills threaten to strip families of the basic rights while also violating religious freedoms protected under both the U.S. Constitution and the Massachusetts Constitution. The First Amendment of the U.S. Constitution guarantees freedom of religion, stating Congress shall make no law respecting an establishment of religion or prohibiting the free exercise thereof. Likewise, Article 2 of the Massachusetts Constitution affirms that every person has a right to worship according to their own beliefs without government interference. If these bills pass, my family will be left with zero options to educate our children without compromising our faith. My two young children, both on IEPs, depend deeply on the specialized services and social structure of school. Removing them would be catastrophic for their development and mental health. We cannot afford alternatives in this housing market and job market. We can't move. Our support system and communities are here. My husband battles chronic Lyme and barely gets out of bed every day. He's not able to homeschool my kids, and neither am I, since I carry the sole financial weight of our family, raising children and caring for aging parents, all in an economy where housing and daily costs are becoming unbearable. Like most parents, I'm treading water on a daily basis. Massachusetts is one of the most expensive states to live in. Parents are exhausted, working full-time, barely making ends meet. Yet instead of supporting families, these bills force us with impossible choices, punishing our faith and circumstances. Moreover, Massachusetts proudly champions diversity, equity, and inclusion. But how is excluding children from school equitable? How is forcing families out of the system inclusive? DEI should not be a selective principle. It should apply to all families, all children, regardless of their faith, financial status, or unique needs. Massachusetts is losing residents and birth rates are declining. Families are struggling to stay. These policies only drive more people away, pushing out very families trying to raise the next generation here. Why would lawmakers make life harder for families when Massachusetts should be fighting to retain them? I urge you to support H2541, oppose H2554, H1557, and H1618, because Massachusetts must uphold its commitment to education, constitutional freedoms, and well-beings of all families, not just the ones who fit into a narrow policy framework. Thank you.
Stephen
since
Helfer.
9:45
Stephen
and heard
Helfer.
multiple names.
Oh, sorry. You please mute your mic. Stephen Helfer. Thank you.
Thank you all for taking so much time to listen to us. As you've just mentioned, my name is Stephen Helfer at Cambridge, Mass. I oppose the Roush, Kennedy, and Vargas bills and support House 2541. Senator Driscoll, you've several times asked the audience or the participants not to applaud, and I certainly understand that, but I would ask you to consider that most of the people in this room are accustomed to being told, well, they're really too stupid to make their own decisions by a lot of opponents of theirs. And with these bills, now they're also being told they don't have the moral authority to make decisions on their own. So I think they're very exuberant to be able to sit before this committee and be heard. Between 1978 and the present, at least the number of vaccines I believe required for school here in Massachusetts has gone from 8 to 20. That's a lot of vaccines. We've also seen a rise in asthma, ADHD, food allergies, and yes, autism. We all know that correlation does not mean causation, but I do think it does give people some pause to wonder if there are possible side effects that are not being acknowledged or explored. Also, the number of injuries that we hear in the VARs, which I believe is put out by the CDC, is a very large number, yet we're told over and over again, oh, they're safe and effective, don't worry. I'm not an expert, I don't know, but I do think Massachusetts citizens, many of whom have looked into this very carefully, have a right to be heard and should not be dismissed. I'm sure everyone in the public health profession would agree with me that public health in the past has made mistakes. Two examples are in the 20th century, public health in the United States ran what were called the Tuskegee experiments, where they withheld syphilis medication to men with syphilis, and they knew they could have cured them, but they felt in the interest of science it would be beneficial to deny them this medication. Also, for 70 years in the 20th century, boy, 3 minutes goes fast, we had a big eugenics movement in this country run by public health that was supposed to improve the human race. I ask you not to pass these bills from the committee and exercise restraint. Thank you very much.
Sarah Higgins. Sarah Higgins. Andrea Brunelli. Andrea Brunelli. Marie Heslin Bastone. Marie Heslin Bastone. Francis Flanagan.
Oh, hi. I'm so sorry. This is Rebecca Zen. I'm not sure because I have been logged out multiple times. Not sure if my name had been called and I missed my turn.
Sorry, not
already.
yet, Rebecca. Still down on the list.
Oh,
I have
okay.
you on here, though.
Okay. Okay. All right. Thank you.
Amy Kindle. Amy Kindle. Andrea Murphy.
Excuse me, somebody used my name to speak a while ago, and I just want to make sure that I have my turn while somebody confused my name with theirs.
Sorry, what's your name?
Anita Dunn,
Anita
and
Dunn.
somebody else spoke, and she was Alina something with an M, but spoke when
Okay.
it was my turn.
Thank you, Anita. I'll try and circle back to you.
Thank you.
Welcome.
Hi, I'm Andrea Murphy. Thank you for, I'm glad I had the opportunity to speak. I am a lifelong resident of Massachusetts. My son is in public school. We actually had his field day this morning where I watched the joy that he was experiencing being threatened once again. I have been here several times, as many people have. There's members on the committee that may not have heard all of the compelling testimony in the past about opposing H2554, the removal of religious exemptions, and opposing the Community Immunity Bill for the past several years, as I have. The honorable committees in the past have all determined that these two bills are not in the best interest of the citizens of the state. What is notable and concerning is that the 2019 Community Immunity Bill did spell out the section that is particularly concerning to me as a parent, is that a minor may request and consent preventative care. It is the provider has no liability. The information and records are kept confidential, and there is no age or cognitive capacity determinations. It was spelled out in the 2019 version. We're here now because the newest version, as it's been changed, has the same results, but in the last section, it's hidden, it's buried deceptively. There's just a small change in an existing law, Chapter 112, but the result is the same. This is my senator who is sponsoring this. I've talked to her extensively about it, and she denies that that's what's happening, but it is. I needed to be at field day this morning because my son broke his toe. I had to make sure that he wasn't doing the obstacle course in the long run because he does not have the ability to understand how his choices will impact his long-term health. I live in Rentham. I was at the outlets last week, and there are sandwich boards on every aisle. Anxious, go to urgent care. Depressed, go to urgent care. So now, while this constant bombarding our youth with messaging may be necessary, what is the solution at urgent care? That's considered preventative. Are you preventing depression? Could my child receive medication that I, as the caregiver, the one that's responsible for his well-being, would not know about? And that is what this bill allows. It's way beyond just a vaccine. What is the definition of preventative care? Anything could be preventative. I could prevent an abortion. Anything could be preventative care. It's too dangerous. There are other dangerous aspects of this bill, the burden placed on DPH and the state budget, endless paperwork, that process that would be detrimental to school-age children, and it's why just the children. I'm around these children. The children today are not healthier than they were 30 years ago. They are more medicated. They are not healthier. I want to leave you with the words of Governor Healy, and I'll wrap it up. Just a few days ago in her public post, her words, there's still much work ahead, but we can promise we'll always fight for your right to health and happiness and celebrate you exactly as you are. And I'm asking for that same consideration. Thank you for opposing these bills.
Anita Dunn. Anita?
Thank you so much for giving me the time. I really appreciate the board's ability to listen to each person individually. My name is Anita. I'm a registered Democrat, a mother of 3. My career has been dedicated to diagnostics and pharmaceuticals. I'm here to urge you to oppose bills S1557, H2554, S1618, and to support H2541 and S347. I want to be clear. I believe in science. I believe in vaccines. Before the birth of my first child in 2015, I sent an email to all of our family members requiring them to be up to date on their Tdap and flu shots before they could meet the baby. That's how seriously I take public health. But I've also seen firsthand how real an individual vaccine reactions can be. When my twins were born, one of my daughters was mistakenly fed breast milk from another mother who later tested positive for HIV. That triggered a series of emergency treatments, antiviral medications, intensive testing, and multiple vaccines, all administered in a short period of time. She's never fully recovered. She's now immune compromised and is documented as a vaccine over-responder, a condition supported by both medical research as a side effect from the medication she was given, and it is in her own records. 2 physicians, one from MGH and one from Children's, have told us she shouldn't receive any more vaccines. But they also told us they can't provide a formal vaccine exemption because the political climate is too contempt at this point. This is exactly why we need H2541 and S347. It protects doctors who act in the best interest of their patients. And H582, which preserved the religious exemptions for families who need it as a last resort. In Massachusetts, we always say, my body, my choice, but that must apply to all medical decisions. Every single one. We can't cherry pick. If we do so, anything less is inconsistent and unjust. My daughter is academically gifted, but medically fragile. We can't homeschool. If these bills pass, we'll be forced to leave Massachusetts and move my husband's business, which currently employs 30 people. Please don't let that happen. Please don't let me light my medically complex child who was caused this by a medication. I don't want to light her on fire for other vaccine-injured children and other immune-compromised children. It's not fair to make a choice for one of my children versus the other. Thank you very much for your time. I appreciate everyone's ability to listen closely.
Thank you. Lindsay Hurley. Welcome.
Thank you. It's very late in the day. Thank you so much for hearing me. I'm Lindsay Hurley. I'm from Acton, and I'm here today to testify in strong opposition to Senate Bill 1554 and H2554, the bills that seek to remove the religious exemption for school vaccinations. These bills reflect the agenda of big pharmaceutical companies and are not the will, interest, or health of the people of Massachusetts. Let's talk about the group advocating for these bills, Massachusetts Families for Vaccines, who claim to be a grassroots, parent-led organization. But let's take a closer look and let's follow the money. Based on public information on their websites, Massachusetts Families for Vaccine is a chapter of the Safe Communities Coalition, which you heard about earlier. Their Massachusetts website links to the Safe Action Fund as the funding source, which, when clicked, leads directly back to the Safe Communities Coalition website. So who does Safe Communities Coalition partner with? It partners with Merck, GlaxoSmithKline, Sanofi, CSL, Seqirus, and Moderna. It also has ties to some well-funded NGOs. Vaccinate Your Family and Immunize.org are both organizations receiving significant funding from big pharma companies, including Pfizer, Moderna, GlaxoSmithKline, Merck, etc. Let's also consider the Kimberly Coffee Foundation, another partner of Massachusetts Families for Vaccines. They promote the meningitis vaccine. Their donors include Pfizer, GlaxoSmithKline, Sanofi, who make educational grants to further their work. Do you think their educational work is biased? In contrast, there is Rishan Golden, whose daughter Haley died as a result of the meningitis vaccine, which was mandated for college. Rishan's nonprofit advocates for vaccine education and freedom. And I bet they could get big pharma funding if they promoted vaccines instead. Massachusetts has true grassroots parent-led organizations: Health Action Massachusetts, Health Rights Massachusetts, and Mass Family Institute, to name a few. These organizations do not have the backing of big pharma or the deep pockets of well-funded NGOs. They are funded by private donations from the citizens of Massachusetts. Many of these concerned parents couldn't make it here today due to the very short notice and timing of this hearing on a Friday during busy graduation season. Some even moved out of state or have chosen homeschooling rather to continue the fight of the system that doesn't seem to care or listen. These are the real voices of the people of Massachusetts that you've heard today. They're pissed off, exhausted, and fed up with the influence of big pharma and their deep pocket allies who want to revoke all our medical freedoms. Thank you.
Thank you. Ilsis Nieves, sorry if I'm not getting that right. Nieves, his last name. Misty King.
Thank you for the opportunity to speak. I'm a little nervous. It's my first time, my third time being here. I am in opposition to bills. I'll finish that at the end. My son planned to attend college in the spring of 2020. Then COVID happened and students were mandated to take an experimental injection in order to attend. I did reach out to his doctor after reading as much literature as possible, and he was denied a medical exemption. He was diagnosed with erythema multiforme, and I was cautioned by his doctor that it could turn into Stevens-Johnson syndrome, a possible life-threatening illness, which was also a side effect of the COVID vaccine, that he was expected and mandated to take in order to attend college. His doctor denied there could be any adverse reactions. After her denial, he chose to submit a religious exemption to the college after careful and prayerful consideration together as a family. However, the consequences for doing so were deliberate and shockingly discriminatory modifications. I'll briefly describe a few. The first round of modifications from the college excluded him from wearing a uniform, essentially making him a commuter, which would have ruined his chances at the program he chose, and experience college with his peers. The second round excluded him from sports and library to study. The third round excluded him from eating with his peers in the cafeteria. They instead designated him to the back of the cafeteria at a single table where he could be shunned and shamed. The modifications literally increased each time my son pushed back at the discriminatory actions by refusing the experimental injection and submitting a religious exemption based on his faith beliefs and informed consent that he and I researched extensively. Although the exemption was approved after a long battle with severely imposed modifications, he chose not to attend, standing by his convictions, faith, and belief. His education did suffer, but we did not and will not submit to the tyrannical attempts to remove our rights. We will continue to educate ourselves with a caring and experienced, educated community we have found on this journey. I have previously consented to vaccines in the past because I did trust the professionals. As a mother of 3 beautiful children with deeply held religious beliefs, I have a responsibility to guide my family that their bodies are a gift from God, and we have the right and duty to do the best we can to protect it, especially from government overreach. I am not misinformed. To the contrary, my eyes are wide open to the past 24 years that I trusted the professionals. Never again. Finally, I ask that each one of you find the time to thoroughly read the same information I did when this journey began, and that this recommended vaccine schedule, which is on the CDC website in its entirety, research the ingredients, research the provider handout in comparison to the patient's handout. From each vaccine, read the studies, the possible adverse events, the reactions, and so much more. I respectfully but firmly ask that you reject these bills, H225, S1557, and S1618. Thank you.
Thank you. Rebecca Zhang. Rebecca Zhang.
Yes, I'm here. Can you hear me?
Go ahead.
Oh, okay. I'm driving. If it's possible, I can be called later. I should stay pristine from now.
Sorry. We're going to have to move on.
So does that mean I will be called again or will not?
This is it. We're right up against time here.
Oh, okay. Then I understand. No way. I can talk.
You can submit testimony in writing as well.
No worry. I would still like to speak in front of you. I would appreciate it because I understand not everyone may have time to read anyway. So I personally know the developer of the COVID vaccine and also the mRNA developer myself. I'm calling about personal relationship. And I discussed with them personally why the people I know, their mother-in-law died right after the vaccine. And they told me the same. All drug has side effect. So they knew it, their side effect. But honestly, no one knows. And they never disclose to the public. So we all remember, everyone telling us those vaccines are safe, absolutely safe. No one even questioned about it. And I asked a friend, a personal relationship, I question it because there's not enough time to examine if they're safe or not. So I decided to back out. And years pass now, the people want us, and many experts, they are the expert in vaccine and well-known heart doctor already said those vaccines will cause severe side effects. And now we see many people dying, including complete healthy young children, died of a heart attack, and also have severe problem like children diabetes. And even the Children's Hospital's well-known doctor, now who was strongly believing the COVID vaccine, now she started questioning, even her daughter have side effects. And even my daughter and many people I see have side effects. This is not a joke. But imagine how many interest groups telling us those are absolutely safe. Those are same people educate every one of us. We should believe in science. We should believe in expert. Excuse me, they have two sides of science. They have two sides of expert. I think we do not need a doctorate degree to tell us if we can qualify to be a responsible parent. We just need to use common sense. All drug has side effects. Even milk and peanut can kill people. Why they said to us is we should protect children by force them and limit their choice. That's nothing but a joke. We do not protect anyone, eliminate their choice. Everybody are different. Someone be safe, but somebody could kill others. That's the fact.
Thank you.
I'm coming from the Communism Party. I'm sorry, I had to finish this. I believe I'm coming to a country of freedom, but this is a dictatorship country. They only allow you to believe what you believe and do not allow you to make a choice for your body when we are not believing this vaccine is suitable for us. I'm sorry, we have so many dictators here. Okay,
Thank you, Rebecca.
I hope Rebecca should stop that nonsense bill, waste our taxpayers' money, and the lawmaker can hear and use the common sense to make judgment and do not violate our basic human right.
Thank you, Rebecca.
Those are basic
I'd ask you to
rights.
please submit the rest of your testimony in writing. Thank you so much. Grady Hoover. Grady Hoover. Lisa Galinsky. Gabrielle Friedman.
Hi, I don't know if you called me. It was Kirsten Beatty. Because the computer, I was kicked off a few times.
Thank you, Kristen. You're on my list. I'm not sure if we're going to get to you, though, but you're more than willing to, more than able to submit testimony to matthew.murphy@masenate.gov. We're going to move on. Welcome.
Hi, thank you so much.
Have you called Angela Ortiz?
Sorry, could you please mute your mic? Go ahead.
Thank you so much. Thank you for staying, and thank you for listening to this. I'm so happy to be part of this process. I just want to say that I did have something written, but I just don't know how any legislator could vote for these bills after listening to these constituents who are so passionate and so educated and just want to be seen, like myself. My name is Gabrielle Friedman. I am a resident in Massachusetts. I've been a healthcare provider for 30 years. I've seen many, many vaccine-injured children. These parents are lost, and they do not feel like they are heard and seen. I myself have 2 children. One is adopted, and one is biological. We chose not to vaccinate my biological child. She is on the National Honor Society. She's getting ready for college. She's doing great. My son, who was vaccinated before we adopted him, has a very different story. The difference is so stark. He has ADHD. He has a lot of learning disorders. He would not be able to sit here and read a paragraph to you like some of these other children did so beautifully. I myself have a clotting disorder, and I was told not to get the COVID vaccine. I have a genetic condition. But I witnessed one of my best friends have a seizure in my driveway the day after she had the COVID booster. Thank goodness her car was in park, otherwise she would have driven right through my house. That was a terrifying experience that still affects us to this day. I do not feel that children should be singled out or have the feeling of being othered. They should not be denied social interaction or access to things like camp and sports and education. Education is not a privilege, it is a right, and children should not be punished by denying them access to these social developments just based on their family's convictions. This is truly un-American. But let me be clear, this is not about being anti-vaccine. I am not anti-vaccine. I am pro-freedom, I am pro-parent, I am pro-child. Our country was built on the idea that we can hold different beliefs and coexist and learn together and thrive as one nation. And it is my sincere and deeply held belief that I have the right to make my own healthcare decisions for myself and for my children. If we start stripping away religious exemptions, what's next? Who decides which beliefs are valid and which are not? I'm just, again, want to say that I really appreciate you staying and listening, and hopefully you're listening to these unbelievable families, and I'm so happy to be a part of this process. Thank you so much.
Thank you. Do we have the Silva panel? Silva? Yvette Silva, Amari.
Thank you for hearing
Welcome.
My name is Yvette. I'm a mother of 5. My husband and I are both business owners and homeschooling parents in Mass. I'm here today to strongly oppose these bills 2554, 1557, S1618 because they threaten medical freedom, religious liberty, and parental rights. As a Christian, I believe our bodies and our children's bodies were fearfully and wonderfully made by God. I trust the immune system He gave us, and I've learned firsthand that even well-meaning doctors can be wrong. When I was pregnant with my daughter, my OB urged me to terminate my pregnancy, stated my baby would likely have serious complications due to Q13 and would not live a full life. But I didn't lean on fear, I leaned on faith. I trusted the discernment God gave me as a mother, and I said no. My doctor did not support my choice until the day my daughter was born, healthy, whole, and full of life. Her life is a living testimony that God has final word, not a diagnosis, not a system. I've read the vaccine inserts. I know the ingredients. I would not feed them to my children. I would not inject them. I do not make these decisions lightly. We homeschool. We fully stepped into our role as educators and protectors. These bills try to force their way into our home by tracking our private decisions and cornering us through policy. Let me paint a picture. My children are bright, curious, full of life. They play multiple sports, volunteer, active members of our community. They are not a threat to society. They are children. They deserve protection from a system who would shame or exclude them just because they think differently. The surveillance bill would push immunization and exemption data by schools and district. The religious repeal bill would eliminate the religious exemption entirely, but my faith is not a loophole. It's a right protected by the First Amendment. The Constitution doesn't say freedom of religion unless afraid. This bill doesn't change policy. It tells me my beliefs no longer count. That's not science. That is discrimination. Just for sake of time, I want to jump to the fact that our doctor called us in May 2019. Actually, they sent us a letter. And it said, we have changed our policy for patients who do not consent to vaccinations. We will no longer be able to treat patients that refuse immunization. We would be willing to develop a schedule to bring your children up to date. So I called and asked her, what does that look like? Dr. Mark Antonio told me we have 30 days to bring all of our children fully up to date on their vaccine schedule. I have the letter here. No conversation, no care, just a deadline or loss of access to care, which did happen. It took us 2 full years to find a PCP office willing to accept our family because of our vaccination status. This is not inclusion, it's exclusion. And I want to speak plainly about the risk. Since 1988, $4.9 billion have been paid out to families for vaccine injuries, and that's just the approved claims. If vaccines carry zero risk, why does this program exist? I'll let you guys speak.
Hi, I'm Imari. I'm 12 years old. When I was 2 and a half, I split my chin and I was given a DTaP. And I was one of 5 siblings with the following: asthma, allergies, and vision loss. I know that's not everyone's story, but it's mine. We eat healthy, we're active, and we believe in God made our bodies with everything we need to stay strong. But even though I'm healthy, we've been kicked out of doctors' offices just because my parents said no to vaccines. It's hard to feel like people think I'm dangerous or less deserving of care even when I've never hurt anyone. I'm learning to think critically, and something doesn't feel right when people say you're too young to decide what goes in your body, but then say I should be responsible for other people's health. I want to protect my religious exemptions. Thank you.
Hi, I'm Imani Silva. I'm 13 years old. I'm old enough to understand what's happening, and I want to speak for myself. I see a lot on the news how young kids are told they can make big decisions, even about their gender or surgeries, and adults say that's their choice. But when it comes to vaccines, suddenly we don't have a choice. We can't say no, even when we believe it's the right thing for our health or our faith. That doesn't make sense. My parents teach me to think for myself, and they've protected us our whole lives. I trust them. I trust the body God gave me. I believe freedom means making informed choices, not being forced to do what the government says. And one day I'll be old enough to vote, and I'll remember who stood up for our rights and who didn't. I believe every person should have the right to make medical choices with their family and their faith without being forced or tracked or treated unfairly.
Thank you. Sarah Harrison? Natalie Vargas Sanchez?
Hi, thank you so much. Thank you for the opportunity to speak with you today. My name is Natalia Vargas, and I am here to testify in support of Bill H. 2431. The COVID-19 vaccine mandate for healthcare workers caused a lasting disruption to my career, my family finances, and our future. It excluded me from the job market and forced to step away from the profession I had worked so hard to build. During the pandemic, I worked as a diabetes nurse educator at a community health center in Lawrence. I had just earned my Master's of Science in Nursing and obtained a board certification as a family nurse practitioner. I serve a predominantly Spanish-speaking population, patients who needed someone who understood their language, culture, and guiding them through complex diabetes care. At the time, my husband and I were just aiming for a home and hoping to start a family. When the mandate was implemented, I was faced with many unanswered questions, especially about the long-term effects of the vaccines on fertility, pregnancy, and child development. Meanwhile, it was clear to me that vaccinated individuals were still contracting and spreading COVID-19, including in the widely reported Provincetown outbreak in July 2021. On September 15, 2021, I was faced with a devastating choice. Comply with a requirement I could not in good conscience accept or lose my job. I was officially terminated 1 month later. Despite my qualifications, I was turned away from job opportunities solely because of my vaccination status. Several interviews ended abruptly when I disclosed it. I left those experiences feeling humiliated and hopeless. Financially, we suffered. I didn't apply for unemployment benefits because I was led to believe that I was ineligible to these services due to non-compliance to the mandate. Our savings were used to cover basic living expenses, and the dream of homeownership slipped away. The mandate also has forced us to stop postponing having a second child. We cannot afford it. It stunted my growth as an advanced practice nurse in a community that needs bilingual healthcare providers. And patients lost a provider who understood and cared for them. I urge you to support Bill H-2431 and oppose the others, so no one has to choose between their conscience and their careers. Thank you.
Thank you. Gabriela Berube. Gabriela Berube. Carl Rupucci.
So I'm from North Andover, Massachusetts. I grew up here in Massachusetts since 1963. So the thing is, with my parents and stuff like that, nobody ever had a fear of anything, polio or chicken pox or anything like this, unlike today with COVID. Now the thing is, I keep hearing science, listen to the science, follow the science. Well, the thing is, I am a scientist. I have a bachelor's degree in chemistry. I have multiple patents on transdermal drug delivery systems. And the thing is, I was never against it. I never really looked at the vaccinations for my own kids, except for one point in time at a pharmaceutical company. What was happening is the swine flu, something like that, a rapid turnout of a vaccine. So I asked the chief medical officer, who was a pediatrician, and I mentioned it to him. I said, what do you think for my kids? He says, first of all, kids don't usually die from the flu. It's very, very rare. I said, what about giving them this an injection? He says, once you put it in, you can't take it out. I always remembered that. So now here we come back to this COVID, mRNA, totally brand new. I know they might make yogurt, they do all kinds of stuff. I'm not an expert at mRNA, but you have to look at what was happening then. So you have COVID. I caught COVID. How do I know this? I get a little bit of a cold, kind of unusual. My wife has sniffles. My daughter has nothing, but tested positive on a nasal test. So months later, I said, hey, you know, forget nasal test. I went for antibodies, T cells, both my wife. I went to 2 different labs. My wife did one, and my daughter did one. My daughter came out negative, my wife positive, I was positive. 3 hits, T cells and antibodies. So the thing is, the stuff was around. Yet, you go to the primary care, hey, I have positive for antibodies. I want to go to this assisted living place to help out over there. You can't go in. I said, can't you write me a note that I have antibodies? Can't do that. We recommend the vaccine. No way. That's not science. The whole point of getting the vaccine was to have antibodies. Totally ridiculous. The next thing is, for you guys, Department of Public Health, Boston Public Health, you let everybody go to the TD Garden with a vaccination card, right? Here's one thing you couldn't do with that vaccine card. Now, we have guys from MIT, Harvard, Thomas Chan, top people that can do all kinds of stuff. But you know what you guys couldn't do? Protect the people that went. Because when you showed a piece of paper with the vaccine card, you could not ascertain whether or not the vaccine card was really true. You did not know my name or anybody's name to a particular lot number. You don't know anything. You didn't know if they actually had anything. So in the process of that, you actually committed fraud in front of thousands of people. You guys aren't together. And Vargas to say the science is decided. The thing is that right away should take his name off of anything he writes, because the science isn't. Science is always changing.
Thank you.
All right?
All right. We have a few more names that we're going to be able to get to. Again, if you want to send in testimony, if we're not able to hear you today, it's matthew.murphy@masenate.gov. Next, I have Genevieve McClay. Genevieve? Are you Genevieve? No, sorry. Oh, sorry. I was on the T earlier and I... Oh, so, okay. Hang on one sec. Is it Siri Burdenson? Yep. I was also called earlier and I wasn't. Thank you.
Thank you so much for taking for allowing me to speak, and thank you for everyone for being here today. My name is Reverend Siri Burnson. I am a minister, ordained minister, and I am a grief counselor. During the years of COVID, I saw countless parents come to my office that had lost children due to suicide. The youngest one was 14 years old, a single child, the son of parents, but one child. He took his own life because he was excluded from school. This is during the lockdowns. This is just one story of hundreds. And this is what I had to deal with during the lockdowns of COVID. I am an immigrant from Scandinavia. I can tell you this, that they had a larger death rate in the United States than they had in Scandinavia. You guys are doing this wrong, completely and absolutely wrong. It is absurd. It is absolutely absurd that people that live in this country, that you have to have a religious exemption to participate in school and activities. This is insanity. This is absolute insanity. You should not need a religious exemption to be a part of society. The Constitution tells you that you have rights as an individual. As an individual, you all have rights. And asking for a religious exemption to be a part of society, it is insane. I think that Rebecca Rausch, she is insane. It's my personal opinion. I think that Michelle Wu is another person who's completely insane. This is my opinion. I am a resident of Boston for over 25 years. What I have seen, I have been a lifelong liberal. I still am a liberal because I'm a Scandinavian. Most Scandinavians, probably 60–80% liberals. What I have seen happen to the Democratic Party, you have been hijacked. You have been hijacked by the big pharmaceutical companies. You worship pharmaceuticals like religion. It is insane. It is absolutely insane. It is disgraceful to see the country the United States of America, the land of the free, that you have become this, fascists. I speak the truth. My grandfather, he was a captain in the United States Army. He fought for this country in the Second World War. My grandparents, they both lived here when they were younger. My mother was raised in the United States. It is a disgrace to see what you have all become. You have become puppets of the pharmaceutical companies. You have all become indoctrinated. It is shameful. It is shameful to watch. You're not here about health. You're not here about the freedom of the individual. You're here to dictate to people. Thank you.
Thank you. Robert Goulston. Robert Goulston. Caroline Mitchell. Yep. Thank you.
Thank you. My name is Caroline Mitchell. I live in Rowley, Massachusetts. I'm 51 years old and had raised a couple of children. I have stayed home for about 14 years with my child who has autism, which came straight from her dad. Not vaccine related at all. I'm proof positive. They checked both DNAs, genes and such. My story starts when I went back to work in 2019. I stepped back into an investment firm, Edward Jones. I'm sure most of you have heard of it. I worked in a small female office with a financial advisor. I was her administrator. I had been there 1 year and a half, not one missed sick day, completely healthy, no ailments, no medications, no anything to worry about on my own. After that year and a half, I had actually stepped into the position in February 2020 for Edward Jones, and it was right before the pandemic, everything had shut down. I was considered essential employee, so I could stay there and work, which was great. I lasted until about February of 2021 before my people working with me were asking me about getting the vaccine. When was I getting it? It was around the mandate where the 100 people within a company or more had to get that vaccine. Edward Jones, even though we were a small office, is international and qualified for those numbers. That qualification and requirement was lifted within days of me getting the vaccine. On April 29th of 2021, my husband's birthday, I went to get the vaccine. Left work an hour early. I walked and ran 6 miles that morning, which I had frequently during the week, every week for months, years. I live in a beautiful nature preserve. So I had been with the first injection. Before given, a nurse had asked if I knew that I was supposed to have this or not. I said, aren't we all supposed to come here? My doctor sent me here. I had it lined up through my primary care physician and immediately had effects with the first injection. I had everything from flushing to palpitations, everything but passing out and being sent to the hospital. They did not send me anywhere. They had the 2 nurses follow me and stay closer for a preceding half an hour until palpitations cleared, blood pressure or whatever. They had the 2 nurses to make sure I was okay. I went home, proceeded to attempt to make my husband a birthday dinner, which didn't happen. Went to bed that evening, had shorts on. I looked at my husband and he said, "Are my knees swollen?" He said, "They sure the hell are." My knees swollen turned into the very next day of one leg, proceeding to blow up. 2 weeks later, I couldn't walk. That knee was being drained to find a heightened autoimmune response in my system. I have not had any autoimmune issues in my past. I was 100% healthy, active, taking down trees in my property, previous auto mechanic. I was a trained dental assistant at the age of 16, worked in 2 different hospitals on telemetry. I have a wide variety of people skills experience with health. I am my own advocate. They gave me the chemo drug to get my body to stop attacking itself. It took 9 months for them to get my body in control. I was then unable to work completely. I had 12 to 14 joints involved, four organs involved, and now I'm on a ton of medications to stay mobile and to stay out of pain. I'm on non-narcotics, and I have leflutamide, which is my mobility medication. But through that 9 months of trying to get my body to get in control from the initial injection, it was 3 different medications, and they started with a chemo drug, and that didn't work. It took 3 different medications, a combination of an injection and a pill to get me to move. I am now 51. I am in risk of losing my home. I cannot pay my bills. I've lost my job. I do not have SSDI. I'm in the process of an appeal. I cannot feed myself. I cannot close my hands. I went to completely paralyzed from the vaccine, and I want you to be clear, this was from the initial spot of having it. This was not a question after. My diagnosis is I am diagnosed with rheumatoid arthritis secondary to the COVID vaccine. I was diagnosed by Mass General with that. I now have neuropathy. I now have, like I said, 4 organs involved. My vision and my thyroid and my heart were the 3 organs to be impacted immediately. I lost my vision. I now have to wear glasses regularly to see. I don't have them on now because my script doesn't work anymore. It's a constant progressive disease. I walk around in pain and stiffness every day and cannot take care of myself. I have 2 young girls that come in to take care of me, to help me take care of my home duties and the things I have to do to help myself survive. I cannot cut my own food. I cannot take care of myself. I cannot wash myself. I can no longer take care of my home, my property, or work to sustain a home that was given to me mortgage-free in 2009.
Thank you.
I am stuck. So please, I urge you guys, listen to what everybody's saying, and I thank you. Thank you so much for letting me come in and do this. Without hands, I couldn't register. Last minute found out I could get in my car, and I drove in this morning and signed in. Thank you.
Thank you. Lynn Turner. Lynn? 1, 2. All right.
Hello, thank you for hearing me. I am Lynn Turner, and I am in strong opposition to S1618, S1557, and H2554. I'm in strong support for H2431 and H2541. Who I am is I was educated as an elementary school teacher. I taught for a number of years and I have 3 stepchildren, worked all the way through that. But when I had my own children, I decided to stay home with them. I am a Christian, and I believe strongly in the freedom of choice. What we've heard today is there is risk with vaccines. They always have listed adverse effects that you can have with vaccines, and where there's risk, there should be choice, and that is freedom. A lot of people here who want to force everyone to have the vaccines through these bills I do not support cry misinformation when it doesn't agree with their point of view. And we really need to hear is everyone's information and make an informed decision for ourselves. We hold these truths to be self-evident, that all men are created equal. They are endowed by their Creator with certain unalienable rights. And we need to keep those rights for all. Thank you.
Thank you. Deirdre Lane. Deirdre? Is Deirdre here? Lisa Mayer. Lisa? Welcome.
Thank you guys for being here so late and for hearing all of our testimony. You'll be happy to know I cut mine down a lot because I don't want to repeat what other people were saying. But I just want to make the point that everybody knows that pharma companies they've paid billions of dollars in criminal fines for purposely falsifying and misrepresenting data, a move that they knew would kill people. If you don't know this, you can look it up. A lot of people also know that there are more pharma lobbyists than legislators in Washington. And I don't know if that's true here in Boston. Maybe it is. It kind of seems like it might be. And also that pharma has undue influence over the FDA and the CDC. So the system has been corrupted, and there are no gold standard safety studies with an inert placebo on vaccines, and there's no liability for vaccine injuries. So I don't know how you can even think of forcing these products on anybody. It's kind of shocking. And I don't know how you can even consider trampling religious and parental and bodily autonomy rights for Massachusetts citizens. So I really hope that with regard to these vaccine bills that you'll do the right thing and throw those terrible vaccine bills in the trash heap of history once and for all. So thank you very much.
Thank you. Ann Harding? Ann?
Hello, Chair Driscoll. Hello, Chair Decker, and hello, all the members of the Public Health. Thank you so much for hearing my testimony today. I'm here to testify in support of Bill H2541 and in strong opposition of Bill S1557, H2554, and S1618. Why there is such a push to eliminate religious exemption in Massachusetts? Why there have been so much opposition from us, the people of the Commonwealth, for the past 4 years. Massachusetts already provides religious that religious exemption can be suspended for an emergency epidemic, and also provide for extensive isolations and quarantine protocols that would exclude students from school in the event of an outbreak. I came from a country where there is no religious exemption in my country, and let me tell you, it's not good. I came here 14 years ago, and I'm proud to call Massachusetts my home is because of the state of its inclusion and diversification. Removing religious exemption isn't just necessary, it would be devastating. It would force children out of school, not because they are sick, but because their family dare to follow their conscience. Unnecessary coercion, oppressive measure that disregard religious liberty will cause distrust in health institutions, create backlash in the form of increased vaccine hesitancy within the population at large. Massachusetts must avoid coercive measures that infringe on the First Amendment liberty. In 1986, vaccine manufacturers were released from all liability for injuries or death caused by childhood vaccines. Since then, the CDC recommended vaccine schedule has grown just from 24 doses in 1983 to a staggering 73 doses by 2018. Yet, despite this rapid increase, the entire U.S. childhood vaccine schedule has never been studied or tested in its entirety through long-term placebo-controlled trials for safety outcomes such as autism, chronic illness, or neurological impact. This should concern every parent, every lawmaker, and every person who believes in science, safety, and informed consent. The absence of full schedule safety study raises valid scientific and ethical questions. Can you claim a product or schedule is fully safe if it has never been tested in its totality? How can a parent make fully informed decision when safety studies are incomplete or unavailable for the actual regimen being administered? If regulatory agencies are relying on partial data to promote a full schedule, it undermines public confidence. I only have 25 seconds. I also stand in opposition of Bill S1618 and not promoting community immunity. The scariest section of this bill is minors will be able to consent to all preventative care, including vaccination regardless of age or intellectual capacity, giving children blanket ability to consent to all medical care without parental consent. If a child says yes to a vaccine administered at school or something goes wrong, who will be held accountable? Just one last thing. I pray our voices are heard and that our legislators reflect deeply on the lasting consequences that these bills would have on the people of the Commonwealth. Thank you for listening to my testimony.
Thank you. Angela Beeler. So we're down to our final three today. Thank you all for hanging in here. If you weren't able to testify, please do send us testimony. We will read it at matthew.murphy@masenate.gov. Angela?
Thank you for your patience and your fortitude in listening to all of us today. My name is Angela Beeler. I'm from Worcester, Massachusetts. I'm a mother, I'm a woman of faith, and I'm a primary care pediatrician in central Massachusetts. I am here to speak in support of Bills H2554 and S1557. During my 25-year career, I have had conversations with families about vaccines every day that I see patients, including many families who choose not to vaccinate their children. In all that time, I can only recall one family who stated their choice to not vaccinate was due to religious belief. And this family was already homeschooling very happily, not related to their choice about vaccination. Even this morning, as I listened to testimony, I honestly rarely heard a lot that I would say was related to religious beliefs, but I heard many times about personal beliefs and about medical decisions. My body, my choice. I even heard a lot about medical concerns, which would not be affected by these bills because these bills do not remove a medical exemption. As a pediatrician, I have personally seen the effects of vaccines on thousands of children. The vast majority of these children have no problems. Yes, I have seen many children with mild side effects that were easily treated. And while I acknowledge it's a rare possibility, I have not actually seen any severe side effects, although I grieve with the parents of the children who do have severe side effects and must rely on the vaccine injury program. What I have seen are children who had a vaccine-preventable disease and suffered deafness, seizures, and even death. And I have a lot of patients on biologic agents who rely on the herd immunity because if they got a vaccine-preventable illness, while it could be mild in a child who had an otherwise healthy immune system, it could be quite serious or deadly for them. I'd also like to speak as a woman with deeply held religious faith. I do believe that God asks us to respect and care for our bodies, and I personally believe that God has blessed us with the knowledge and scientific advances that allow us to take care of our bodies, including vaccines. I have enrolled my own children in vaccine trials when they were infants and young adults, including a child who was in a COVID vaccine trial, and by the way, he got the placebo in that trial. So I later took him as soon as I could and got him the COVID vaccine. I belong to a religion that encouraged all of its members to receive vaccines. What I'm struck by today is what I've not heard from and who I've not heard from, and that is very few religious leaders. In my experience, if religious rights are being trampled, religious leaders speak up loudly. I belong to a religion that my ancestors actually chose to leave Massachusetts because of their religious belief. They were later driven out of the country and shot and killed and attacked because of their religious belief. So I've seen what religious persecution is. This is not religious persecution. So I believe that this is a public health issue, and I strongly support removing an exemption that people are using as a personal belief exemption rather than an actual religious exemption.
Thank you.
Thank you for your time.
Thank you. Next we have Esther Hawkins. Esther? Great.
Dear honorable committee members, thank you for this opportunity to testify before you. My name is Esther Hawkins, resident of Woburn, Massachusetts. I would like to oppose Bill S1557, H2554, an act relative to routine child immunizations, which would remove religious exemptions. 405 years ago, the Pilgrims landed on the shores of Massachusetts. They were fleeing religious persecution and seeking freedom to practice their faith freely. It's 2025, and ironically, if this bill is passed, my family and I, residents of this state, born and raised, will be forced to relocate, where we will be able to practice our faith as we see fit. In a day and age when diversity, equity, and inclusion are frameworks used to promote fair treatment, it seems that these bills do the opposite. It is discriminatory towards a very small percentage of religious people in this state who hold to religious vaccine exemptions for our children. It draws one to ask the question, why? Why are you choosing to persecute the 1% of us who claim religious exemptions? Currently, people from around the world come to this state to seek asylum from religious persecution. Many of them I've met at our church. We welcome them with open arms. However, if this law is passed, we as law-abiding citizens will be the ones seeking asylum from persecution. This bill seeks to strip us of our religious freedom or force us to bow down to your God in your strongly held religious beliefs. This would not be freedom. This would be dictatorship. I would like to state that I am an unashamed born-again Christian, a follower of Jesus. The truths in the Bible are what my family and I follow. My Christian faith, while very personal to me, can be traced back several generations, includes scores of people who also have strongly held religious beliefs. My husband and I currently serve as teacher and pastor in our local church. We invest on a very personal level with the families in our community. We have 5 children and 1 on the way, and do not take our responsibilities lightly. We also take very seriously the Bible and its teachings, one of which is the 6th commandment, thou shalt not kill. We believe that abortion is wrong at every stage, and we believe it is murder. Thus, we have strongly held religious objections to the vaccines that are developed using fetal cell lines derived from aborted fetuses. I would want to ask you, would I ever be justified in forcing my strongly held religious beliefs on you? So why do you have the right to do that to my family and I? Life is a gift from God. We believe, as God's word teaches, that our bodies are temples of the living God. We're called to glorify God. Our society has become secularized, which makes sincere religious beliefs seem strange and difficult for those who don't believe God. I urge you to stay consistent with the tradition of Massachusetts and continue to provide sanctuary for religious minorities and ensure equitable access to all this great state has to offer for all children. Thank you.
Thank you very much. Julia Elias. Julie Elias. We have Julie. Great.
Hello, everyone. So my name is Julie Elias. I am here to oppose bills S 1618, S 1557, and H 2554. You have us back here again. Apparently, you guys didn't hear the people speak for the past 7 years, but I guess I will reiterate. We do not consent. We do not want to be force vaccinated. A lot of us are ex-vaxxers who have been injured by vaccines. I was vaccinated myself. I vaccinated my children up until 2019. And then after I suffered reactions and I noticed some reactions in them, I decided I was stopping. I had a conversation with my God, and I had a coming to God moment when I realized I was hurting my children with vaccines and would no longer be able to consciously do it. Now, for you guys to come here and tell me I cannot send my kids to school now, one of my children is missing 1 vaccine from the schedule. So you're saying now you're going to kick her out of school because I know future vaccines will injure her? I have an autoimmune disease. I don't want my children to end up with the same autoimmune disease. Vaccines do cause autoimmune disease. They caused mine. I reversed it. They caused it again, and I'm working on reversing it again. I'm not going to vaccinate myself. I'm not going to vaccinate my kids. It's just not for us. If other people want to do it, they can do it. That's fine. Also, it's unconstitutional. So it goes against our constitutional rights to bodily autonomy. It goes against our constitutional rights to send our children to school. It goes against our constitutional rights to worship God the way we worship God. Who are any of you to tell me that my relationship with God is a loophole? That is the most insulting thing I've ever heard. It's a real connection with the Creator, and if you guys don't understand that, then maybe you need to go to church and find God. Thank you.
Thank you. Thank you all for participating, and thank you. So, sorry, what's your name? You're on that list? They what? So, yeah, I'm sorry. I'm sorry if the list got mixed up, but we're going to adjourn the hearing now. I'd be happy to meet with you at another time, and would welcome people to submit written testimony to Matthew Murphy@masenate.gov. And so the hearing's adjourned. Thank you.